good morning, good afternoon, or good evening, depending where you are in the world listening to this. Welcome to the 2024 Global Forum on Nicotine conference coming at you from Warsaw. My name's Harry Shapiro. I'm the executive editor and lead author for the Global Forum on, no, not that, Global Tobacco Harm Reduction Report. I ought to know the title by now. I've been doing it for long enough and all my ears and things have fallen out on the floor. So we're off to a good start. I've got two guests with me on the commentary team today. I've got Lindsay Stroud, who is director of the Consumer Centre for the US Taxpayers Alliance, amongst many other tobacco harm reduction hats that she wears. And I've also got David Swenner, who's the adjunct professor of law at the University of Ottawa in Canada, who's also got a 40-year career in tobacco control and law and combating the egregiousness of the tobacco industry at various points in his life. So welcome. So 2024 is actually quite a sort of signal year in terms of tobacco harm reduction. As the Beatles once said, it was 20 years ago today. 20 years ago, not necessarily exactly today, but certainly this year when the first commercially available vape hit the streets in China, thanks to Honlick's pioneering invention. And in a relatively short period of time, we've got a huge range of products available. We've got an industry worth, market analysts differ, but anywhere between 30 and 50 billion US dollars. We've got upwards of 120 million users of safer nicotine products across the world, mainly, I have to say, in higher income countries, and that's a serious issue that needs to be addressed. So, bearing all that in mind, Lindsay, reasons to be cheerful?
Reasons to be cheerful. Well, 120 million people using e-cigarettes is a good reason to be cheerful, and hopefully, the majority of them had been formerly smoking. But 2024, we did have the COP, and nothing got done at COP, so that's where I'm cheerful at right now on that one. But I'm coming from the United States, where everything's on fire right now in tobacco harm reduction. So,
Indeed. David.
Yeah, I think there's an awful lot to be optimistic about. That the total numbers of people who are using these products, what we've seen happen to cigarette sales, cigarette smoking in many of the markets, the innovation that's happened. If we look at the sort of products that were available, that became available 20 years ago compared to now, I mean, that pace of change is similar to what we've seen with mobile phones. I mean, they're just a phenomenal difference. And we now have categories that didn't even exist then, that were beyond anything that anybody had even thought of at that point. And then we look at the countries that have had major breakthroughs. The biggest declines we have ever seen in cigarette sales in any country ever have happened in recent years and are associated with substitution effects. Exactly what we've seen in so many other products and services. Yeah. You give people a better alternative, they move to it. And even with all the obstructions, consumers are moving to these products. Even in countries that have tried to ban them and ban them harder, these products are still reducing cigarette smoking. So we're seeing consumers move, the market's moving, and I think it's consistent with what we've seen with so many other areas of technology, that it's unstoppable. You're not going to stop innovation. It's a matter of at what point do countries have enough sense to say, we're going to work with consumers, with market forces, and solve this problem, rather than we're going to get in the way and see if we can slow it down.
Right. So we were talking about COP just now, and you made the point that nothing happened. Well, actually, there was one thing that actually seemed quite significant happened, that a number of countries, including New Zealand, but mainly kind of smaller countries that weren't exactly big players in the tobacco harm reduction world, began to put their finger up and saying, hang on a minute, we need to be talking about tobacco harm reduction, which severely agitated those on the what we might call the opposition. But that felt quite significant, and I noticed some people, you and other people out there, may have noticed the latest WHO tweet on the matter that suggested that vapes would, quote, and direct quote, designed to kill. Now, equating vapes with a high-powered rifle seems to me the politics of the desperate. Do you think, and I say we are winning the argument that they are getting quite desperate about all of this, or is this just a bit of kind of loud hailer politics that you might expect? It sounded a bit desperate to me.
I think they're desperate. I mean, the whole kid argument that they're using now. I knew it was bad when they started turning their eyes towards the UK and New Zealand to go after youth vaping, because in the States it like dropped. That's when you knew it was really bad. But they are hiding behind the children. That was the thing that the end of COP and the Secretariat, the FCTC Secretariat, sat there and said that even if one kid gets addicted to nicotine, who cares about the smokers pretty much, or the people who smoke? If one kid gets addicted to nicotine, it's not worth, turning 1.3 billion people into former smokers. So I do think I think the argument keeps changing, and I think the WHO's got a big case of mission creep. I mean, I was going through some readings, before the FCTC was apart, and looking at some of the World Health Assembly meetings, and they were talking about smoking, and they're talking about smoking and like the harms that the combustion did, and then it's completely turned into this whole going after the demonization of nicotine and stuff, and not really looking at getting back to the root of, you were in tobacco control, wasn't that the point? As we know smoking kills you and this is harmful, we should be reducing that, and now it's turned into this mission creep out and just, okay, we're going to go after anything that has nicotine in it now, because nicotine addiction, is such a problem. It's not, the lung disease that you get from combusted tobacco.
Right. On this question of kind of youth vaping, yesterday there was a session on health economics, and the fact that there are unspoken benefits associated with tobacco harm reduction in terms of increasing quality of life and so on and so on. And the point was made that there's a feeling that policymakers and legislators don't get it in terms of the benefits, and instead just play the what about the kids, teen vaping epidemic and all of that. But you've got a perspective, David, on what they're missing when it comes to thinking that it's just about that there is in fact impacts on young people by a prohibitionist, obstructionist approach. Could you perhaps?
Sure. I mean,
elucidate
I think what's happened is that we have people who are very well funded who are using sloganeering in place of actual analysis. And so it's very easy to say something like, make America great again, or think about the children, or
developing brain.
Yeah, that's right. So you throw out a slogan rather than thinking. And in this case, if you think about what they're saying that all we're concerned about is young people, meaning you're willing to write off the lives of hundreds of millions of adults in order to try to prevent a young person from using nicotine, which itself has very low risk. But even if you're only concerned about the young people, even if we accept that abhorrent view that you're willing to sacrifice the lives of hundreds of millions of fellow human beings, well, what about the young people? What is the overall impact on them of the policies you're pursuing? So how many of those young people are now going to smoke cigarettes instead of vaping? What impact does that have? How many of them are going to get sick and die because of that? How many of them are going to lose a significant other, a parent, a grandparent, a coach, a teacher, somebody who's really important in their lives, who becomes incapacitated, ill, or dying, or dead because of cigarette smoking? And what impact, forget about the adult, what impact does that have on a young person, where a grandfather becomes somebody who's in a hospital bed spitting up blood rather than somebody who's playing catch with you? That's huge. What about the impact of their family finances when the parents are forced to buy cigarettes because they're not offered an alternative that would be far less expensive. So they no longer have the sort of disposable income, especially in poorer families, to have the sort of life that that child should deserve. You know, what about the child's exposure to secondhand smoke because the parents are having to use a combustible product? What about the chance of the house burning down? I mean, if you take a look at all of this to say the move to vaping is a huge plus for young people, not to mention just enormous in terms of overall public health. And it's that absence of an analysis, somebody wanting to simply throw out a one-liner, use a slogan rather than thinking, and hope that you can grab people emotionally. You know, we know that the limbic system can work like that, you know, thinking fast, thinking slow, get people to panic about it, and they won't even think. And how long can they maintain something like that before, you know, we actually start getting people to think this through, to say what they're saying is absolute nonsense, and it's repugnant.
I'm gonna segue in a little bit to him too. It's also this lifetime addiction. Oh, you're this, you know, that the sloganeering that you call it. But it's a lifetime addiction to vaping, a safer product. Again, we've gotten lost. It seems that we've gotten lost on this nicotine addiction versus the harms. I mean, yeah, you don't want kids using any of these products, but at least they're using a safer product than smoking cigarettes.
If we look at it and say, imagine we found a parallel universe where people get their nicotine in non-combustion forms, but they get their caffeine by smoking tea leaves. And they have all the diseases that we associate with inhaling the products of combustion, all the lung cancer, heart disease, lung disease. And somebody says, my gosh, you know, why don't we go open some Costas or Starbucks in that land and replace, you know, what they're having, or teach them to brew tea? And people are saying, what about the children? You know, what if a child, like if you tell adults that you can brew tea rather than smoke it, maybe a child will start drinking tea. And there's caffeine in that. You know, my gosh, you know, we've got to save the children. So the first thing we have to do is ban people from brewing tea and make sure it's illegal to open a Starbucks, because we have to protect the children. I mean, it's the same stuff. And we would laugh at it, you know, now. If we think about that in terms of caffeine, but that's what we're doing on nicotine.
Well, yeah. Although, of course, it's worth bearing in mind that one of the election pledges from one of the political parties in the UK is to ban high caffeine drinks from the 16-year-olds. It's one of their election pledges. So
and we know that bans always work.
Of course. Yeah. So we're getting around to caffeine in the UK as well.
Hey, they're trying to ban 16-year-olds from using social media in the States. So,
Yeah. Well, yes. Good luck with that.
Oh, yeah.
So, is it the case then that it's just a political win? I mean, interesting. We were just talking earlier about the FDA. I was going to mention the FDA in terms of the wider influence in terms of global policy and stuff. So, and you mentioned Ivali. So this idea that vaping kills.
That's
people.
mostly on the CDC, not the FDA. But
So explain a little bit about that. That's
Ivali or like
just the fact that what happens because you know the FDA, CDC oversee the biggest vaping market.
Yeah, the U.S. is the largest illegal vaping market because all the products are illegal.
Well, yeah, that's
according to the FDA.
Yeah. I mean, somebody yesterday came up with some huge figure for the number of.
Oh, their numbers keep changing because Brian King testified yesterday in front of the Senate Judiciary Committee, and now it's 27 million applications. It used to be 26 million.
But the percentage of technically illegal products in the States, not illegal because they're dodgy or badly made, illegal simply because the FDA won't authorize.
Yeah, but and that's the FDA never authorized anything before when the vapes first came out. You know, it's like 2014 that they started doing the deeming regulations. 2016 when they actually hit, and then the PMTA process. What was it? 2020 when they actually had to submit their applications. But I think the biggest problem in the States, at least with the FDA, is it's a political appointment. You know, it changes when the administration changes. So that's why we had, FDA Commissioner Gottlieb, who, put up the continuum of harm and looked like he was moving, quote unquote, moving towards, accelerating the access to harm reduction products. And then now we've got Commissioner Califf, honestly, I don't think he was really that anti-vaping, but that's really probably the biggest problem about the FDA. It's not really rooted in science, but it changes literally as, you know, the presidents change
Okay.
at this point. But I do think that I think they have an influence, but I don't think the rest of the world's following them. I don't know any other country that is requiring somebody to do a PMTA to bring a tobacco product to market.
No, that's true.
Yeah.
That's true. But I think, I mean, it's just a question of, I mean, there's the EU Tobacco Products Directive as well. They have frameworks for what we would think of what you shouldn't be doing in terms of tobacco. But so what goes on in the higher income countries in terms of policy clearly does have some impact elsewhere.
Well, yeah, I mean, I'm in the States. We got 5 states with statewide flavor bans, okay? You know, and they were about to do the menthol ban, but it's an election year, so that one got shelved. Yeah, because we're dealing with already about, you know, millions of illegal e-cigarette products. Let's just go ban, you know, a third of the combustible products. So,
so just talking about the health economic side, David. I mean, I think you made a comment to me earlier, quoting somebody that said you shouldn't mistake malignant intentions with stupidity.
Never attribute to malice that which can be adequately explained by stupidity.
Yes.
We have this tendency to think that these agencies are evil, or politicians are only out there to collect cigarette taxes. That's all they care about. And I think an awful lot of it comes down to ignorance or stupidity, that they're being inundated with misinformation. You've got all the moral panic that exists in this field, but I think it's important to understand that this is not exceptional. You know, this is what happens with new technology all of the time. And in fact, if I remember to put it in my pocket, Juma's wonderful book, Innovation and Its Enemies, Why People Resist New Technology. And this is a quote. This was written before anything about vaping came up, but how do you hear this and not think about vaping? Debates over new technology are part of a long history of social discourse over new products. Claims about the promise of new technology are at times greeted with skepticism, vilification, or outright opposition, often dominated by slander, innuendo, scare tactics, conspiracy theories, and misinformation. The assumption that new technologies carry unknown risks guides much of the debate. This is often amplified to levels that overshadow the dangers of known risks. I mean, that's what we're dealing with.
Yeah.
But this is what we've always dealt with with innovation. We eventually get over it, but this is a stage that you go through. So nobody should be surprised that we're dealing with this. You know, we've dealt with it, whether we talk about printing presses or farm mechanization or refrigeration, auto safety. I mean, just all areas of innovation as they come up. So we're going to have this, and it's going to be influencing politicians, but eventually reality comes through. Like eventually we found out that mobile phones don't actually cause brain cancer, but that was a huge scare at one point.
Indeed.
So I think the fact that we're seeing so much progress, that consumers themselves are moving, that the politicians are going to have to follow that, because otherwise all they do is lose credibility. The way that's now happening with WHO. WHO is saying nonsense.
Yeah.
The result of that is they get dismissed by the public who understand that what they're saying is nonsense. But it isn't that people just say, I don't believe the WHO when they talk about anything to do with nicotine, because clearly they're full of crap. They say, I just don't trust the WHO. And then that ends up having a problem when you look at vaccination programs or anything else WHO is involved in. And what we're seeing is a sacrificing of credibility from authorities. The same with the FDA and the CDC in the United States and in other agencies worldwide. And I think that's an even bigger problem than what we're dealing with on nicotine. People are losing trust in authority. They no longer believe their governments. They no longer believe these institutions.
Except, of course, in this particular case, you've got the WHO claiming that this is a conspiracy on the part of big tobacco.
Yeah.
They have a 25% stake in e-cigarettes.
Okay. To, you know, addict our kids and get them back to smoking and all the rest of it. Now, I feel the difference here is that big tobacco has got a pretty bad legacy. And people are prepared to believe just about anything about big tobacco. So WHO and others may feel they're kind of onto a winner with this one, particularly when it comes to the health of young people, which wouldn't necessarily apply with previous opposition to new technologies from other sorts of products. It feels different. It might not be different. But I don't think the WHO necessarily are losing credibility with the public over what they're saying about nicotine, because again, horrific percentages of health professionals still think that nicotine causes cancer, that vaping is no safer than cigarettes. They came at this believing a lot of this stuff in the first place, which is simply underlined by what WHO put out. So it seems like a bigger ask to bridge that gap between like propaganda and reality. Is it a bigger challenge, or is it just the same sort of challenge you've been talking about?
I think it's the same thing. That if we accept a basic premise, which is there is objective truth. And if there is objective truth, that the world isn't just whatever you want to believe, then eventually these groups get held to account. And we look to these supposedly authoritative expert organizations as being a source of that objective truth, to move us onto something that we didn't otherwise understand, like how do you deal with HIV/AIDS? What's the role of the elimination of smallpox or dealing with polio, et cetera? That they're supposed to be leading us. And in this case, they're not doing that. But this is also happening in an age of internet and social media where people do find out what's going on. So an extraordinary number of people do learn that nicotine isn't what's causing the problem. They do learn that there's huge differentials in risk. And they do learn that these organizations are misleading them. And then how do they feel when they find out that these organizations they'd previously trusted are misleading them? And as Hakutani talked about in her book, The Death of Truth, once people find that they can get better information from an alternative source rather than an authority, it is a very short trip from there to believing all sorts of nonsense because you've given up trust in that authority.
Yeah.
And that is a huge cost. And for the WHO to be doing stupid things like saying, we think we're fighting the cigarette companies, giving an award to India for banning alternatives to cigarettes and seeing the stock price of the cigarette companies in India soar as a result and think they're doing a good thing to beat up on cigarette companies. This is like saying, I'm so angry at you, I'm going to come and throw gold bars all over your front lawn so you can't cut your grass. I mean, it's stupidity. Yeah. And I've spent my career actually understanding the cigarette companies so you can successfully regulate and sue and debate cigarette companies. And I'm dealing with people who keep doing things to protect the industry while claiming they're fighting them.
Yep.
Yeah.
So it's these groups that do things like say, let's pass a law that makes it illegal to tell people the difference in risk between cigarettes and these alternatives, which is just given the cigarette companies a get-out-of-court-free card because you can no longer sue them for failing to inform their consumers about the magnitude of the risk of cigarettes. The cigarettes are an unreasonably hazardous nicotine delivery system because they say it would be illegal for us to tell the truth.
I'm going to segue into that, because when they get the order, all the PMTA orders actually read that, we believe that these are less harmful, but the company can't market that, even though the order that you got, the FDA is sitting here saying this, because you'd have to go pay to do the modified risk tobacco products. So there's just too many regulations.
So hang on, let's get this one clear. So. And I think this actually plays wider because I've spent probably too much time looking at WHO submissions to COP around what they call electronic nicotine delivery systems and stuff. ENDS and ENDS.
Hey, an end to smoking.
And some of those papers sort of grudgingly admit that these products may well be safer than
Dr. Brian King mentioned it yesterday. He actually sat there and said straight from the guy's mouth, these are less harmful.
we leap from Yeah, all right, okay. They're likely to be safer. We still want to tell people that they're safer, but they might be. But hey, we've got nicotine addiction, so therefore that gets us. That gets us, And I've kind of always felt that addiction is such a loaded term. In the public mind, you immediately think of the worst ravages of heroin and crack and crystal meth and all the rest of it.
Fentanyl.
And fentanyl, yes, certainly. And also, alcohol and even gambling, all these terrible things have horrible impacts on people. And of course, as soon as that becomes a narrative, it's like, okay, but it might be safer. But hang on, guys, you've got nicotine addiction to deal with. And so therefore, I think what you were saying about moving away from cigarettes to the attack on nicotine is, in a sense, a kind of acknowledgement, although they wouldn't admit it so much, they do in print, that these products actually are safer, but we still can't deal with this because of the whole addiction problem, and of course that relates back to young people.
Well, I just don't get why there's all the vitriol against e-cigarettes. I mean, and especially coming from public health. I mean, let's say e-cigarettes were just as harmful, but how do you deny all these people who've been able to quit and move over to these products? You've never seen anything like that with any NRT. And why aren't we studying that? But it's kind of the same way with COVID. When you started seeing, the people who smoke were not dying from COVID, and, and the WHO and the CDC, I know they all started to bury all this stuff. And it's like, again, this is something, people are dying, and you're seeing that something is happening, and it's all related to smoking. And yeah, we just got this up in arms that anything related to smoking has to be bad. And,
Well, indeed, the worst things are things that are like smoking but aren't causing the harm. I mean, if we look at the history of these moralistic campaigns to change behavior, the view that there's people who want to use the power of the state to impose their moral views on the behavior of others. And I've dealt with many of these people all through my career. So they're trying to dictate, what others can do. That the last thing they want is a safer alternative. So indeed, if our job, we've taken upon ourselves to get people to stop using caffeine, somebody selling radioactive coffee isn't a problem for us, because that's going to kill people and convince them they shouldn't be drinking, a caffeinated beverage. Yeah. But if somebody opens a Starbucks, that's a problem. If somebody's, selling Diet Coke, that's a problem, because that's not going to kill them. So it's what we saw with the prohibition in the States. There was great acceptance of things like Jamaican Jake, because it killed people. If they drank alcohol, they get paralyzed, they would die. That'll teach them. The people who thought AIDS was God's retribution for sinners, that was a good thing. But my gosh, if you can engage in sex, or you can drink alcohol, or you can use caffeine in ways that aren't going to kill you, that's the problem. Go after the safer things.
Yeah. So really, the idea of trying to get the argument across about the health benefits of allowing these products to be available, accessible, promoted, advertised, and all the rest of it, is problematic, even if they admit the health benefit, as was discussed yesterday, about quality of life, about people not being off work because they've got lung problems and all the rest of it. The social costs, the health costs of smoking. I don't know, but it feels like this doesn't come into the equation. They don't think along those sorts of lines, because it leads them down a path where they really don't want to go, and it sort of feels like they don't care.
I think if you're talking about people who have an abstinence-only view on nicotine, that's absolutely true. Yeah. That's not true for true public health people who are sometimes missing in action in this field. But particularly, it's not true for consumers. The consumers themselves are moving. They're learning about this. They're seeing the benefits personally. So they're way ahead of where many of the anti-nicotine people are. Yeah. And that's no different than what we've seen in other areas like illicit drugs or dealing with HIV/AIDS. So many other campaigns where it's consumers themselves that are in the lead. They're the ones who push for the change. They're the ones who see the benefits. And that eventually pushes the powers that be to start to pay attention.
And I think that is an absolutely perfect point. at which to end this very interesting discussion to kick off the conference. So I'd like to say thank you to Lindsay, and thank you to David, and thank you to everyone who's been tuning in, and I hope you enjoy the rest of the conference. Thank you so much.
I can think now.
Yeah.
Good morning, everyone. Welcome to the 11th edition of the Global Forum on Nicotine. It's a pleasure to see so many familiar faces and new participants gathered here at the Marriott Hotel in the heart of Warsaw. Over the next few days, we will delve into topics that are both critical and controversial, but essential for advancing our shared mission of tobacco harm reduction. This year's theme, Economics, Health and Tobacco Harm Reduction, expands our focus beyond individual and public health benefits to explore the economic impacts of safer nicotine products. We'll examine the costs of unintended consequences of prohibiting safer alternatives to smoking. We'll consider the healthcare savings that could be associated with substitution of combustibles with less risky products. We'll also ask whether a drop-off in tobacco tax revenues or state involved in tobacco income might influence political decision-making on regulation. And we'll address the potential risks of overly restrictive regulations on safer nicotine. If independent manufacturers of safer nicotine products are driven out of businesses and the tobacco industry's transition is stopped in its tracks, what happens next? We'll tackle head-on the question of why tobacco harm reduction faces such antipathy, given its proven success in addressing smoking-related harm. We aim for respectful debate involving all stakeholders to push the boundaries of what is possible in tobacco harm reduction. In last year's GFN closing, Paddy Kostal invoked the spirit of Nicolaus Copernicus, a Polish heretic who defied the orthodoxy of his time to propose that the earth revolves around the sun. He put rigorous observation and evidence against blind faith in a moralistic doctrine. There are echoes of his struggle in the contested space of public health, tobacco control, and tobacco harm reduction. Despite overwhelming evidence that harm reduction can significantly reduce tobacco-related death and disease, today's orthodoxy remains quit or die. Too many of those in positions of authority refuse to see beyond it through blind faith in the accepted or the acceptable doctrine. We must continue to challenge this with evidence, with data, and by highlighting the voices of those of you who have used safer nicotine to quit smoking. It's what we've been doing since the first GFN in 2014. I'm excited to embark on 3 days of learning and discussion together, knowing that although tired, we'll leave reinvigorated with new ideas, new contacts, and new ways of thinking. I must say a big thank you to GFN media partners, Drink and Drug News, EasyClick, Filter, Two Firsts, Planet of the Vapes, Tobacco Intelligence, Vaping Today, and Vapor Poland. Many of them are here in the room today. We have participants here from almost 80 countries. Thank you all for being here or watching us online, and let's make GFN 2024 a new milestone in our journey of saving lives. And now on to our first keynote. Your speaker is Polish professor Andrzej Fal, the head of the Department of Allergology, Pulmonary Diseases, and Internal Medicine at the Central Hospital in Warsaw. He will discuss the health and economic benefits of tobacco harm reduction. He will then be joined on the stage by a respondent from the United States, Michelle Minton, a senior policy analyst at the Reason Foundation. Please join me in welcoming Professor Fal to the stage.
Good morning, everyone. Thank you for this kind introduction. I'm really glad and honored to give this keynote of this morning. We've been discussing the weather outside, and I think it's perfect for a Congress because it's nice weather, but it's not too nice, so that most of you chose to come in here instead of visiting the beautiful Warsaw. But the time will come also for the second part. Bad habits, bad lifestyle, it's something that bothers us recently. In the past years became the leading cause of illnesses, diseases, and death, especially in the so-called developed countries. So let me focus this morning on the three words that are in the running title of the conference. So this is economics, health, and harm reduction. Well, actually, it's 4 words, but 3 expressions. It's been well understood, and we still tend to say that the wealthier we are, the longer we live. Well, which maybe is the case. When we look at this graph, we see that there is some correspondence between the amount spent on health, or the amount earned by the citizens, and their longevity. So the more you earn, the longer you live. But, as you may also notice, this line, it's not a 45-degree angle line. So it's not a simple proportion between spending and, well, living or healthy living. Well, if we went back 2 centuries ago, the proportion would be closer to this ideal, but still not in point. Why is that? It's very simple, because there were always wars and plagues, and these cannot be calculated in statistics. And now we have still the NCDs. The NCDs, we all know what they are, but we need to repeat it loud and louder, because most people do not know, do not understand what NCDs are. And NCDs are the non-communicable diseases. In the past 4 years, we've been focused on the communicable diseases, especially COVID pandemics. But still, for the COVID pandemics, the total absolute death count was around 7 million, let's say. Well, it's a huge amount. But yearly, around the world, due to these 5 groups of non-communicable diseases, which are cardiovascular diseases, chronic respiratory, cancers, well, whatever cancer, starting with stomach, ending with breast, diabetes, or metabolic diseases, and mental disorders. For these 5 reasons, 41 million people die prematurely. So they die much earlier than they would have if they were not sick with these diseases. So 7 million in the pandemics versus 41 million every single year dying for non-communicable diseases. This shows the scale of the problem we're facing, especially when you look at the distribution. Well, of course, the huge numbers of people dying because of non-communicable diseases, these are the low to middle income countries. But when we look at the percentage in the high income and upper middle income countries, this percentage, maybe the numbers are lower, but the percentage is 90 to 95% premature deaths are caused by non-communicable diseases. So if not these diseases, we would live probably 20 or 25 years longer, because all the other standards, including living standards, medical standards, are high enough to support us up to 120. And we're losing this extra 25, 30 years because of the non-communicable diseases. Well, and the diseases, well, they have their cause. As I mentioned, it's our unhealthy lifestyle. Risk factors. Every single disease has its risk factors. And somewhere in the middle of the 20th century, the risk factors, the predominant risk factors in the world have changed. The old risk factors that we were once used to, well, they're still present, but they are present in sub-Saharan Africa, they're present in some not wealthy parts of Southern America or Asia, but they're not, well, they're not very important, I mean, socially very important in Europe or in Northern America. So these are undernutrition, indoor air pollution, water, pure water, sanitation, and so on and so forth. Instead, we have the civilization risk factor. Well, inactivity leading to overweight, tobacco, excessive drinking. Well, these are the risk factors of today. When we look at the risk factors, the most important risk factors of today, please pay attention that tobacco accounts for over 8 million premature deaths around the world yearly. So every year, because of smoking cigarettes, 8 million people die. Well, the important message here is that more than 1 million of them never smoked. So they die because of secondhand smoking. This is the only case where not having a bad habit may cause you die because some people around you were doing something unhealthy. Well, then we have 7 million dying because of indoor and outdoor air pollution, 5 million almost because of excessive drinking, 3 or 3.5 million for junk food and lack of physical activity. Well, when we divide it into the 5 groups of diseases I already talked about, we see that really the leader is CVD, so cardiovascular diseases, but there's plenty of other illnesses or diseases in this group that are really bound to especially the 2 leaders, so tobacco and air pollution of the contemporary risk factors. So the approach suggested many years ago and still active is the 5x5 approach. So we have 5 leading groups of diseases and 5 leading risk factors. I've already named all of them. For the sake of today's conference and today's keynote, I'll focus on tobacco use because it's also a very special one. Because, well, it's the biggest killer, as I said, over 8 million lives a year. This is the toll we pay. It does kill also non-smokers. So not only smokers are endangered. And the addictive substance is not the major harmful part, because, well, in alcohol, when you drink alcohol, the more alcohol you drink, well, the sicker you potentially can become, because this is the same substance, the one that's addictive and the one that does harm to your organism. In, smoking cigarettes, you have a little bit different, even though smoking cigarettes is a major risk factor in all the diseases I already listed, but because the addictive substance, nicotine, is not the one that actually poses the biggest health threat. Of course, it does pose health threat. It's possible health threat as a decrease in myocardial oxygenation, well, leading to the sudden cardiac death. It's being arrhythmogenic. Well, all the smokers know that when lit and smoke 2 cigarettes very fast, they have tachycardia, they can produce arrhythmias of different kind. So, well, of course, this is a bad thing, but much worse things are those that are long-term acting, and this is the tar, these are the aminobenzones, these are the substances that we still come today many times back to, because we know at least 7,000 of them, 92 being defined as cancerogenic substances. And it's a very simple thing that is being overlooked, not by the audience of this room, but by many decision makers, by many politicians, even by many, well, forgive me to say, public health specialists. I'm a president of the Polish Society of Public Health, and we spread the news, and not everybody wants to agree with us, that replacing something that's really bad with something that is bad, well, it's a good idea if we cannot make people resign over it. And forgive me for saying so, but I do not remember in the history of mankind, of the Homo sapiens history, any culture that wasn't smoking, puffing, sucking, or whatever they've been calling it. But, well, we've been always drinking something and smoking something. And, well, I'm not quite sure that we can stop doing that. So that's why harm reduction are the words that will go with us forever. The problem only is that the reduction on harm can be made only in those who, well, make harm to themselves. We cannot introduce harm reduction in those who do not harm themselves by definition. So when we look at the most defined substances that are really those who are responsible for the non-communicable diseases, especially the cancer part of it, we see that actually we have 10 or 12 the most active substances, and if we have products showing that the amount of these substances or concentration of these substances is substantially less, well, they are potentially those harm-reducing. Potentially, because we have to prove this. Well, understanding that and knowing that, even WHO, sorry for saying even, because I think that WHO, when fighting with the tobacco epidemics around the world, loses from year to year, but I'll come to that in the final part of my presentation. So, but even the WHO says that investing in prevention is the best investment that can be ever made. If I was as a player at the New York Stock Exchange and somebody would tell me that, okay, once you invest $1 today, you'll get $12, $10, $8 in 15 years, well, I know, well, he's the man I want to follow. But we already know that investing in prevention, primary, secondary, and tertiary, where harm reduction is part of the tertiary prevention, investing in prevention brings you the revenue of somewhere between 15 and 1,200%. Well, investing at this level should be the thing that we will, should be the thing that we do. But this is not the case. Contrarily, when we look at cigarette smoking, we see that almost 2% of GDP is being lost just because of the tobacco-dependent diseases. So because of that, we smoke cigarettes. The GDP of the entire world, of course, it's different in different countries, in different world parts, but the GDP of the entire world is lower by 2% every year. These are huge money, of course. Our friends from the US, they like calculating, they like estimating the real numbers. So for the same year that this analysis published, they've published the costs for the American industry, which shows that the American industry loses $600 billion a year, and not even half of that are the direct healthcare spending. All the other are mostly indirect costs because of, well, dropping out from the work market, because I become sick, I cannot work anymore, having a health leave because, I'm sick, I have the COPD, the chronic obstructive pulmonary disease, I have cancer, so I need a health leave and I cannot work. So these losses are double that really we spend directly to cure the diseases. And sometimes, very often, we do forget about it. When we look at the total burden of all the 5 groups of non-communicable diseases that I presented to you, we're talking about billions losses and reducing only by 1% mental health condition, this is the red line, or cardiovascular diseases, this is the blue line, will cut the costs in the subsequent years, the cost of healthcare and the indirect cost of the diseases by 10, 20, 30, and so on, and so forth %. So this shows that going this way, trying to reduce the damages, so reduce the harm for the future, is the best way not only to improve the health of the society, is also the best way to improve the state of industry and the budget of the country, because, well, the losses are being paid by the public money. Nobody else pays. The taxpayers have to finally pay them. I said that I'll come back to the WHO and smoking. I very regularly visit WHO pages, including the one about the key facts on tobacco smoking. And this is July last year, and there's no newer data on that. Well, this is the July last year, showing that we have 1.3 billion smokers, tobacco users around the world. Well, it's a lot or not a lot, but when we go 10 years back and we look at the same page of WHO, at the same messages, the number was 1.1 billion. So in these 10 years, the number of cigarette smokers increased in the world by 200 million people. A tremendous success. Well, I know that the general population of the globe increased, so the percentage, if kept the same, would be higher. But the reason is that the smokers moved from one part of the world to the other. Let me come back to this a little bit later. Last year, the mid-year, the Polish Parliament Analysis Office asked me to prepare an analysis about the state of the tobacco epidemics in Poland and where to go and how to go. So I sat down. A very good moment and a very good way to express what I know, what I think. I consulted it with my friends and co-workers. So we put together quite a nice analysis showing a lot of facts, especially showing that years of life lost due to cigarette smoking, it's for the man, let's say, 250,000 years of life lost in Poland because of smoking. Well, this is a very good population indicator of how serious some risk factor can be, how serious the impact to the population is. Well, there was some economical evidence also attached, and we sent it to the parliament a year ago. I'll be back to that in a while. Also, in this document, we suggested that the best way out is to put much more stress on prevention. And we just put together all the facts on prevention, showing that prevention is not what the National Health Fund gives us, that go, well, make your blood test or make your X-ray, because this, well, helps us finding your disease earlier. Well, this is secondary prevention. But the basics of prevention is lifestyle promotion, is health education. Well, nobody wants to pay for it, because the benefit you get from that comes in 15, 20 years. So the political cadence is 4 years. It comes in 4 or 5 cadences. Well, the another party will be at the government at that time, so why should we worry about it? So nobody wants to invest at this level. But then we come to the thing that we will discuss, I hope, here during the 3 days. So the 3 levels of the real prevention. So the primary prevention, and we have 2 very important things that we will address in different sessions. One of them is the fiscal tool. Yesterday we had a very nice discussion about the excise tax and nicotine and cigarettes. And this fiscal tool, the excise, well applied wisely, is one of the powerful tools that can, well, help people quit smoking, but on one condition. They need to have an alternative. It's not only putting the prices of cigarettes higher, 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 and leaving those smokers without any alternative. No. High prices of the cigarettes and much lower prices of several alternatives of proven lower harm, of course. So, second thing that we'll discuss are the public bans. Many countries have introduced, most of our countries have introduced, but well, every of these countries at different level, banning smoking in public places, in restaurants, at work, this and that, selling cigarettes at gas stations and grocery stores. Well, these are the public bans. They help a lot because the availability of cigarettes, or in that case of all related products, is lower, and when the products are less available, so well, they are consumed much less. Well, secondary prevention is something that I already mentioned, so it's very active, looking for all those who already smoke, despite the primordial and primary prevention. They've started smoking, they already smoke, so we look for the disease related to smoking to find it and diagnose it as soon as possible. So, because, well, the earlier we find it, that, well, the possibility that we can prolong the life of a patient is longer. What I'm saying, prolong life and not cure the disease, because by definition, non-communicable diseases are chronic diseases. They are not curable. So we'll live with these diseases till the end of our days. Well, even though they do not necessarily kill us, but we'll not cure them. We'll have them, once recognized COPD, so chronic obstructive pulmonary disease, well, is within us all the life long. And so it's, by this definition, they are not curable. So the secondary prevention, and finally the tertiary prevention. The tertiary prevention that includes, of course, medical treatment, rehabilitation, but also the harm reduction. Well, the only problem with understanding harm reduction and understanding the need of secondary prevention, so early screening, is that only people who are well educated, I mean health education, not general education, well educated, so they have a very good primordial prevention applied at the early childhood, they will understand that tertiary prevention is necessary, that harm reduction is necessary where everything else failed, that secondary prevention is necessary if the prevention to smoke or to drink extensively failed. So these are the steps. This is not the pyramids that we apply at one time. No, these are the steps. We apply prophylaxis step by step. Well, about 250 million people every day, somewhere in the world, in different countries, are trying or willing to quit smoking. The main goal for us should be to support them. One of the supports is using the tools that I just listed. Once again, public bans, fiscal tools, harm reduction. Well, the problem is that I'm afraid this is not the case. We are not doing it properly, and that's why over 60% of those who, even in all these trials that we look at, short-term trials, 3, 6, 12, up to 12 months, well, 60% succeeded in quitting smoking. Yes, but when we look at the same group in 2 years, 60% of this group is back smoking. So it's, well, depending on what time perspective we apply, so the accuracy of this data needs to be verified. Well, actually, the effect of our attitude to harm reduction, maybe not our, but I mean those tax decision makers and healthcare system decision makers, leads us to that, as I showed you, the cigarettes have potentially 7,000, once again, and 92 substances, 92 defined cancerogens, and they are the most commonly used nicotine products in the world. All the other that have less nicotine, more harmful than nicotine substances, they are less frequently used, so it's counter logic. Absolutely counter logic. These four conclusions are not conclusions of the talk yet. I'm sorry, I'll take 4 minutes more of your time. But these are 4 of the 10 conclusions that we gave in a document written for the Polish Parliament Analysis Office. One of them was that we need to launch prevention clinic at each county, and the clinic has to have 2 responsibilities, has to have access to all the techniques supporting quitting smoking, including pharmacotherapy, nicotine replacement therapy, and harm reduction products. And these clinics, its workers, should be also responsible for coordinating all the, let's say, information campaigns or health campaigns being around. Because when I look at the campaigns that are being paid with public money even, they are absolutely not coordinated. They are made once a year because this is a not tobacco day or this is a World Health Organization day. So they're not coordinated. Second thing that we suggested is radically and progressively increase excise taxes and base the whole system of excise taxes on the less harm, less tax basis. So the less harmful the product is, the lower excise we put on it. It doesn't mean it doesn't have any excise because all these products are harmful. So, but the less harmful products should have less excise, and the most harmful products should have the highest excise. And then, when there are those saying that we do not have proof that these harm reduction products are really harm reducing, well, let's put some public survey, let's put some public money and public supervision, and let's finally do prospective studies showing that. And finally, let's end this discussion, sometimes based on nothing, only on my thoughts or my dreams, that these products are good or these products are not good. Let's prove where they are, where we are using them. And finally, we, at least in Poland, we do not monitor any health system changes, including those concerning alcohol or cigarette consumption, introduced. So we introduced a change in the law, and after 5 years, we do not know, did it go the right way or it went the wrong way? Because in the meantime, so many factors have changed that we really cannot find the real effect of the one we would like to measure, and this is not the way we can be effective. Well, looking at the politicians, I may say, I don't know, it's not a statement. I just wonder if they do not have some conflict of interest because, well, the one thing is the next year budget. So if we know that, well, we're losing the productivity in direct costs 7 to 8 billion, okay, every year it's being calculated in the market, in the industry, fine. But at the same time, on the excise tax and value-added tax for tobacco, we can add up to the budget. Well, this 23 billion, it was 2018, now it's closer to 30 billion zlotys. So the proportion shows that to save the next year's budget, well, let's wait with the new law reducing cigarette sales until the next year, maybe, because this one is really hard. It's not a... Well, we've observed that in the case of New Zealand, that we are looking so forward to see how it will work, the new law, the new attitude to selling and possession of cigarettes in New Zealand starting 2025, and now we know that it has been postponed, and it has been postponed just because of what it's written in this slide, even though these are the Polish numbers. Okay, I was already saying that the number of smokers increased partially because, there's 1 billion people more in this world in the meantime. But secondly, the smokers moved. I mean, now the most smoking countries are, as you see, China, India. I'm not saying in general numbers because this would be obvious, that, but in percentage of global smokers. So almost 1/3 of global smokers live in China, 10% in India, and so on and so forth. So please pay attention that big European community, big European countries who not necessarily, at least not all of them, followed the WHO way, the one, quit or die, but introduced harm reduction, introduced excise tax, long-term policies, introduced primordial prevention. These countries like Sweden, Czechia, even Great Britain, several others, have real big drops in the number or percentages of smoker. But, WHO responsible for the amount of smokers around the world did not do such a good job as the mentioned countries. So maybe the only word, the only thing I want to say in the summary does not sound very optimistic, but in my opinion, I showed you that we winning many battles. We learn how to use taxes. We know how to introduce public banning. We know what the harm reduction is. But despite of that, we losing the war against cigarette. Thank you for your attention.
Thank you very much, Professor, for this fantastic lecture. And let me say that when you mentioned NCDs, wars, and plugs, suddenly I'm most afraid of the first one now after your lecture. Let me invite to the stage our respondent, Michelle, please.
Is this guy on? It is. Hi, everybody. I'm Michelle Minton from the Reason Foundation in the United States. First of all, thank you to GFN for asking me to respond to Professor Fall's keynote speech, which is wonderful. I'm honored to be the respondent to that. If you don't know who I am and what my job is, I mean, honestly, you're asking, you don't understand these politicians, why are they making X, Y, and Z decision? That's kind of where I come in. My job is sort of an intermediary between the science and the policy analysis, to translate that into policy, or at least trying to translate that into policy by convincing lawmakers that these are wise decisions to make. And you asked, I don't know why, is it a conflict of interest? I'd say yes. Sometimes conflict of interest, often it's perverse incentives, as you mentioned, in terms of politicians aren't in government all that long. They have budgets that have to be renewed once every year or once every few years. And frankly, numbers are very helpful. Cost effectiveness analysis of certain policies are very helpful for me to kind of convince lawmakers that these are good ideas. And lawmakers love it because even if it never actually has the effect that we say a policy is going to have, or that someone tells them it would have, they still get to kind of implement a policy and then sell it as if it had that effect, even though 4, 5, 10 years down the line, it turns out that policy didn't actually work so well. They still get all of the congratulations, they get all of the media attention, maybe they get reelected. So it looks very good. But even though I rely so heavily on things like cost-benefit analysis, I can never stop thinking when I look at presentations like this that we have a hard time actually analyzing the true costs of policies. We talk a lot in tobacco harm reduction about how certain tobacco control policies have negative effects and unintended consequences on people. But I think the actual weight of those costs is very difficult to calculate in terms of something like, in the early days of tobacco control, we had a lot of overtly stigmatizing campaigns. That was their job. Their job was to stigmatize smoking and denormalize it. And we say, this is how many people over the 50 years since we started doing that have either not started smoking or quit smoking because of social pressure and because smoking has been denormalized. And that's great. And we have numbers for that. And we could take that to lawmakers and say, if you do this advertising campaign and you ban indoor smoking and make people go outside to smoke, eventually some percentage of people will quit and a percentage will not start smoking. And we do calculate costs, of course, of things like this, of cost to businesses or lost tax revenue from smoking. The things we have a harder time calculating are, what does this stigma do to people who don't respond in the correct way to such policies, right? The woman who has to stand outside of a bar and smoke and is maybe then exposed to some kind of harassment. Well, when you go into the literature and you look and see some of the other determinants of smoking initiation or failure to quit smoking, when we do studies like that, when we try and figure out what the determinants of smoking are, what convinces young people, or what are the factors that allow young people to initiate smoking, they're usually smoking-related things. Do your parents smoke? Were you exposed to tobacco marketing? This kind of thing. Are cigarettes cheap enough that a child could afford them? We don't look at things like discrimination or self-stigma or economic stress. But you look at the literature and you see that these things are enormous determinants of whether or not a child begins smoking or whether an adult refuses or cannot quit smoking. So taking something, our host here mentioned something about pushing the boundaries of what is possible. And so I guess I'm kind of the kook. I'm kind of the weird person. I love doing that. And I like bringing in odd parts of the conversation. I think my goal here is maybe to stimulate a different kind of conversation throughout the conference, at least some of you, to really look at what are those factors and policy areas that impact smoking, impact tobacco use, but aren't exactly, the way tobacco control does things. It's very vertical. We tax things, we ban things, we denormalize things. But then you look at the literature and you say, okay, so a child who's exposed to tobacco marketing might have twice the risk of initiating smoking. Then we ban smoking, advertising, stuff like that. Or we say children who are exposed to parents who smoke might be 1.3 times more likely to smoke. So we stigmatize parents and we raise taxes on cigarettes to convince parents to quit smoking so they're not modeling smoking for their children. But what kind of effect does that have when, for example, you ban indoor housing in assisted living in America, where if you're in poverty and the government provides you with housing, we've banned smoking indoors. And that convinces some percentage of people to quit smoking. But what about the ones who don't quit smoking and then who get kicked out of public housing? So then you have financial stress and housing instability for children, plus the modeling of smoking from their parents. Are those parents better off? Are those kids better off from that policy? These are those subpopulations. With tobacco control, we look and say, these policies convince this many people to quit smoking, yay. But for the other percentage of people, the cost for them of these society-wide policies can be enormous and can have effects on smoking, right? I mentioned housing instability. If a child is living in an unstable housing situation, whether that's living with a friend, which is speaks to a high level of instability in their housing, if they're living with one parent, if they're living multifamily housing, the children with the least stable housing, so those living in like a car or temporary housing, have their odds ratio of initiating smoking can be up to 6 times higher. 6 times higher. That's enormous, right, compared to the tobacco-specific determinants that we normally look at and target with policies. Now, this is kind of crazy, right, because I'm talking about housing. And when you're talking about tobacco policy, it's very difficult to go into a lawmaker and say, You know, it would actually be the most cost-effective way to prevent youth from smoking? Just solve the housing crisis. Go ahead, just solve the housing crisis. It's a hard sell, even though that may very well be true, that when we're looking at drug-using behaviors, you know, you mentioned that people have always been smoking or drinking something. This is true. Why people develop problematic relationships with substances is a difficult thing to suss out because it's often very unique and it involves multiple factors: genetics, you know, social environment, lots of other things, socioeconomic status. You know, we can't exactly solve the housing crisis or homelessness, although in America we might be able to if we stopped wasting our money on other things. But with tobacco harm reduction, unlike tobacco control, frankly, you can actually integrate these policies into other programs that target some of these other determinants, right? So tobacco control, like a lot of public health from the early days, is very fragmented. It's almost, not to use the word, but balkanized, where you have, atomized is probably a better word here, where you have a person who has an issue that you care about, and then you look only at that issue and how policies can affect only those determinants and those issues. Whenever I talk about or read about cost-benefit analysis when it comes to tobacco harm reduction or tobacco policies, I often think of this story. I once heard of when, not to keep bashing on the World Health Organization, back in the 1970s, the World Health Organization had this ramped up smallpox vaccination campaign in a lot of low and middle income countries. I think the cost was something like $200 million over the decade, and that was 2/3 of that was paid for by the low and middle income countries. And they were extremely aggressive, going into towns, knocking on doors, trying to coerce people into getting a smallpox vaccination. And at one point, one of the WHO workers went to a slum, a hovel, knocked on the door, and an old Bangladeshi woman came out, and they said, "We would like you to get your vaccination. You haven't gotten your vaccination yet." And she refused. She said, "I will not have smallpox vaccination until you give me food," which of course they refused to do. And what she said to them has stuck with me for years, probably a decade since I read about it, which is she said, "If you don't care if I die from starvation, why should you care if I die from smallpox?" And that quote really sticks with me because I think that's a fundamental problem that we have across public health, but especially when it comes to tobacco control and tobacco policy, is that we are not looking at people as a whole, and we're not even looking at our policies as a whole and how they fit into people's lives and what they do to people. I think it was Clive Bates recently at the e-cigarette summit who said, "We are doing tobacco control to people." And that's not exactly the way to help people. Tobacco control is coercive, it's top-down, it's vertical, and it's not inclusive like tobacco harm reduction can be. Tobacco harm reduction actually fits in quite nicely with a lot of other of our public health initiatives and our attempts to help people, right? So like mental health is one of the biggest determinants of whether somebody is gonna start smoking and whether they're gonna keep smoking. I saw a recent study that looked at women experiencing homelessness in the Bay Area, San Francisco, and California. And I think they said, over half the women had serious psychological conditions. I think they called it, I can't remember exactly the term they used. But one of the things they found was that the greatest correlate of whether these women would continue to smoke, I think about 75% of the women they studied were smokers. And I think 80 to 90% of them were trying to quit smoking actively. Very difficult. They found the biggest correlate for whether or not these women would continue to smoke was the number of other substances they used. And to go back to the housing example, another recent study, and I really like this one because I think this is helpful for how we talk about tobacco harm reduction, is they looked at men this time, homeless men, about 400 of them living in California and Los Angeles this time. And they studied them for 12 months. And they did 3 surveys with the men. So with 3 months, at 6 months, and at 12 months. And it was when they were homeless. And then the first survey was when they were homeless. Then they were put into supportive housing. And then they were studied for a year to see what happened. And after they studied them, they actually split them up it's kind of reversely. They looked at the patterns of use over that full year, the smokers who were not smoking so much at the beginning, but maybe increased their smoking once they got into supportive housing. The people who were, daily smokers got into housing and continued to be daily smokers, and then those who were smokers and then their smoking decreased. And they sort of tried to, it's called, think about it, repeated measurement latent class. So they defined people by class based on their behavior, based on the trajectory of their smoking behaviors over time. The really interesting result here for me was that an extraordinary amount of, this is not surprising, but an extraordinary amount of the men in that study had psychological conditions, PTSD, depression, bipolar disorder, schizophrenia, and there was a high degree of smoking. I think 320 out of the 420 were smokers. And they correlated that, in their study, one of the biggest factors was mental health conditions, and illicit drug use was also a big correlate. But once they got into supportive housing, I think smoking declined by about 30% across all of the subgroups, which is pretty impressive on its own. Illicit substance use decreased by 45%. That was really shocking to me, knowing that housing and substance use, going back to the homelessness study about women, showing that just the number of other substances in addition to smoking that they were using was the biggest factor determining whether they were going to continue to keep being smokers. And then you have this other study looking at homeless men showing that without any other type of intervention, just being in supportive housing, they almost cut their illicit drug use in half. Even if the smoking among certain subgroups didn't go down all that much because they had supportive housing, their mental health improved, their other substance use improved. And so down the line, and then if you think about their kids, they have more financial stability or more housing stability. Maybe they're seeing their parents model drug use less, so they're less likely to be drug users when they become adults. I guess what I'm saying is, I would like for us at this conference, when we talk to each other later, that we should be thinking in terms of how tobacco control or tobacco harm reduction policies fit into the overall framework of the way we're approaching public health, how it fits in with other laws that we have, how it fits in with current tobacco control policies, and specifically, I would like to see policies studied together in the specific environment and where they're being implemented so that we can see, and subgroup studies, because, okay, here's one of the things I think, we're losing the war. And I think one of the reasons we're losing the war with smoking is because we continue to repeat the tobacco control model of sort of like the greatest benefit for the greatest number. And in the beginning, or at least in America in the beginning, where education about smoking risk was low, basically we were picking off the low-hanging fruit. So we got a lot of return for the investment that we were putting into education. But we're only getting marginal returns now because we're approaching it from this coercive, paternalistic, top-down, greatest benefit for all kind of approach, which results in a greater amount of resources needing to be spent for those efforts in order to get smaller and smaller reductions in smoking, and it also requires greater paternalism. So at the end of the day, I think a lot of these problems would be, tobacco harm reduction could just easily replace tobacco control in the way that it can be integrated into other things, in the way that its unintended consequences are often largely beneficial, instead of with tobacco control, where the unintended consequences of stigma, for example, or of people losing jobs or losing housing or being forced out of social engagement because of denormalization. With tobacco harm reduction, you're bringing people, often people who've been pushed out, you're bringing them in, you're giving them support, you're giving them community, you're hopefully connecting them with other services that would help their other determinants that seem to have very little to do with tobacco itself, like mental health or housing.
Thank you very much, Michelle. Applause for
Thank you very much. And now we got around half an hour to open the floor to questions from the audience, both here in the room and online. Are there? Yes, I can see a question at the back of the room here, please.
I'm Brent from Sweden. Doctor from Poland, you were mentioning the direct and the indirect cost of smoking related diseases. But is there some way, I figure that the costs are even higher when you consider, for example, a husband and a wife where one is smoking and that person goes for lung cancer treatments and so on. If this was my case, my productivity and my children's productivity must surely also be affected. Any comments?
Yeah. Yes, absolutely. As I mentioned, the smoking is the only habit that affects not only the smoker, but also those around him. And of course, these are all estimates, so these are not directly calculated costs. But in these estimates, there is one coefficient always taken, at least should be always taken if they are made correctly. In every country, the exposure coefficient is different. In Poland, the coefficient before public banning was around 2.5. So one smoker influenced 2.5 people around. So it was calculated on a basis on several gatherings and so on and so forth. So every country has a coefficient in these statistics. Well, truly speaking, now after banning in public spaces of smoking in most our countries, the coefficient significantly dropped. Of course, we have less knowledge about the exposure at home because most parents declare that even though they are smokers, they never smoke in the presence of children, they go out, but we cannot prove it. It's only declarative way of they're giving facts, but I absolutely agree, yes, smoking, once again, is one of the habits, the only one of the habits that affects yourself, your family, and the close ones to yourself.
Thank you very much. You want to comment on this? Okay. Thank you very much. And let me just say that I'm most glad that in both the lecture and the response, the problem of vulnerable populations, vulnerable nations, if I may say, as we could describe those most affected, like China, India, Indonesia, and vulnerable groups, is something extremely important in my opinion. And so I'm most glad that we are including this into the conversation today. We've had another question. Yes, here, please.
Hello. My question is related to Mr. Farah's presentation about the elements which need to be implemented or can be implemented by the government to basically to reduce the risk of smoking. One of them was related to fiscal policy of the government. I fully agree that food fiscal policy stimulating the product with lower risk will play an important part. My question is, what would be your recommendation to define what should be the difference of risk? Because across the globe, there is a huge, basically, there are extremes from 70, 80% in some countries down to 10 or even 0. Thank you.
That's a very good question. Well, let's see it. Let's look at this the other way around. When we look at the price of a pack of a product, cigarettes or a harm reduction product, the entire taxes, in my opinion, should stand for around 75 to 80% of the price of this, because this is then very influential. But this is not enough. Yesterday, during a very good discussion about excise taxes and nicotine in the afternoon, there has been data shown pointing that in European countries we have different amount of excise tax in euros per pack. And this is not the attitude we should, in my opinion, apply. Because 2 euros in Germany, well, mean a little, well, not the same as 2 euros in Romania or 2 euros in Poland. This is another part of a percentage of the pack price, and comparing the mean or average salary in these countries, 2 euros mean absolutely different things. So when we're talking about excise tax, I'll only stress that in my opinion, as every regulation, it should be high enough to really influence or to really to help us to reach the goal. Because if the tax is even high, but it influences the price by 10 or 15%, nobody will notice it. The price has to be really driven by the taxes, and only in that case we can create a good policy, successful policy on banning or reducing sales of those more harmful and, well, replacing it, or at least partially, with the sales of the less harmful products. But two conditions have to be fulfilled. First, we do have to have these two products, and we do have to have a huge difference on excise taxes. Well, somewhere in the back of my mind comes also the question, we need to have the scientific proof that the harm reduction is worth it.
Thank you very much. And let me, if I may add to that equation one more thing, which I believe also will influence the thing, the actual price, different in different countries, as clearly the tax is calculated on top of that price. So if we see significant differences in prices in two EU countries, that will, well,
absolutely
change the outcome. All right, we got another question here from Norbert, please.
Yes, Norbert Zillertron-Schmidt, German Consumers Organization. You mentioned the cost of tobacco control measures. And there's one elephant in the American room I wish to mention. The current FDA regulations mean that you have to put an application which costs, according to FDA, about $300,000 to make it. Then, if you are really lucky, they approve it for each individual product. And contrary to their initial expectations of maybe 100 applications, they received several million applications. And by now they have accepted 23 in total and denied several million applications. So has somebody calculated the wealth that was destroyed by this regulation? My estimation would be you have several millions times 300,000, and adding up the shops that had to close, the businesses that went bankrupt, the people who lost their job. Who measures this cost?
I think this one is yours.
Yeah, we do it very backwards in America, where if you're a cigarette company that existed before the FDA was regulating tobacco, you don't have to go through this expensive, lengthy process. But if you're a new product, a less harmful, non-combustible product, you have to go, you have to basically prove to the FDA that you're not an evil, scary thing that's just going to take over the minds of our children, which is apparently extremely difficult to do. As far as I'm aware, nobody has calculated this cost, even really estimated the cost of the thousands of businesses, and then you would have to go even further and be like, what were the effects of the process on business closures, on the people who own those businesses, on their communities, on their families, all of that kind of stuff. As far as I'm aware, no one has calculated that, frankly, because when it comes to the types of calculations, and I'm not talking about academic researchers, but in the policy world, the types of studies we do for that in order to inform policymakers about the wisdom of their choices rarely focuses on something like that. I think someone has calculated how many businesses have closed. We know 99% of the products that were on the market no longer exist now, which is what the FDA estimated would happen before they ever did it. But they just don't care. The sad truth, at least in the United States, is we like to talk about small businesses a lot, but unless it affects the bottom line of very large businesses who happen to give a lot of money to politicians, or a lot of people are complaining about it who would maybe choose not to vote for them. They just don't really care. Because at the end of the day, it's much flashier for them to say, I've passed this law, it's going to save children's lives, than it is to say, we're going to do this other thing for 10 years, and it's going to result in, you know, a cost benefit. And we're going to return like $7 on every $1 spent. It's a much harder sell for politicians.
Sorry, we got a question.
You have a question?
We got a question here. Yeah, please.
Flora Ukereke from DAT. Professor, thank you so much for your doing this morning. What I heard you in summary was to lay out steps that is a solution for smoking, from education, demonization, taxing, and she says, no, that is not the only way. It has to be an approach that looks at the policies holistically. I would like you to directly respond to that. Do you think she is correct in what she has laid out? And madam, for you, I think my question would be, you know the way the governments are organized. They have different departments from different policies. They have different objectives and they have different timelines. In a practical way, how do you think that an integrated policy of the nature that you espouse can happen without a total change of how the organization runs? Thank you.
Thank you for the question. I do absolutely agree that we, in every action of public health, need a holistic approach first. And the holistic approach showing us the way to, and the place where we want to be in 10 or 15 years is the way to follow. But then we need to follow stepwise because, well, we cannot do all the things at the same time and be effective in everything. So following the way that we already know, leading to the place we would like to be in the future, we just follow the steps that I tried to show you at the pyramids. So start with educating the youngest and also at the same time helping those who already are sick or are less happy or less affected with the policy that we introduced at the beginning. So these two things, so the holistic approach and the step-by-step approach of prophylaxis have to be combined together to reach the goal.
Yeah, and to answer your question, yeah, so how this would look is, you know, impossible to say, but what I kind of was trying to get at are looking at combined effects of policies, and then for us in the room who advocate for policies, beginning to advocate for combined policies, as you mentioned, right? You don't raise a tax without making something else available too. You don't have an educational campaign aimed at children without also having educational campaigns aimed at adults in conjunction with one another. It doesn't, I mean, in a perfect world, it wouldn't be so difficult for agencies to coordinate their activities together for the benefit of the population. And in some way, you know, this does happen sometimes where we look at, you know, we're going to talk to the Department of, if you look at something like cannabis, for example, we have an interesting situation in the United States where it's still federally, you know, marijuana is still federally legal, but for the last 25 years, a lot of states have had legal markets. And you have government bodies that have to coordinate with one another in terms of, like, the Department of Health has to coordinate with the Department of Justice. I mean, they don't always do it so well. But I mean, I think the beginning step here would be to start studying combination policies to see how they work, to see the unintended negative consequences, the unintended benefits of these policies, how they fit in, and specifically looking at combined policies is going to be difficult to say, combined policies that take into account vulnerable subpopulations. Instead of just one big policy from one agency, it's how do we have a policy that hits all of the different, and accounts for all of the different groups with different types of risk factors. I hope that answered your question.
Thank you very much, Michelle. Let me see if we got questions from the far ends of the room. We got
one here, one here. Before we get to that question, let me just share a question that I have seen posted online from our online audience, probably from somewhere in India. And the question was whether the introduction of THR policies might, rather than help in quitting smoking, serve in attracting new users to nicotine. That's an old question, but the reason why I'm actually forwarding this question here in the room is because in many regions of the world, the answer is not obvious. So even if to some of us it might be, may I ask one of you to?
Maybe I'll start this time and then you can correct me. So I think, yes, obviously, right? A lot of people don't smoke. I was one of these people who wanted to smoke but didn't because, as a kid, because one, it was illegal for me, and then two, because I was concerned about the health consequences. And if e-cigarettes had been around when I was a youngster, I would have 100%, I would have done that immediately. I would have been an e-cigarette. I would have been one of those teenagers they use in all the pictures in the news who's, vaping. The thing I think here is that I'm trying to get at, or I'm trying to get at with my response too, is that we can do what tobacco control does, which is play whack-a-mole. Every time a new product comes out, every time something doesn't work, and just keep playing whack-a-mole forever. Or we can try and address why people are having, if they have a problematic relationship with nicotine, why are people, because this is just, I will probably never be convinced otherwise, but when it comes to substances, especially when it comes to problematic substance use, the substance itself usually has very little to do with it. That it is something else is happening in that person's life or body that they are trying to address and can't address any other way. Whether they're trying to regulate their mood or whether they're trying to escape from, a terrible financial, economic situation, war, right? Like going back to that Bangladeshi woman. It's really hard. Bloomberg will go to India and say, don't, ban e-cigarettes. But it's very difficult to convince people to care about their health when they haven't made it past the bottom line of Maslow's hierarchy, right? When they're experiencing famine or running from war if they feel like their life is in chaos. And you can tax all you want. You can stigmatize all you want. But those folks are still going to find their ways to escape, and there's substances that make them feel a little bit of pleasure in an otherwise not very pleasant world.
Right. Well, in my opinion, this is one of the most important and the toughest question in this area that can be asked, because, the possibility of recruiting new nicotine users is the biggest and toughest argument against harm reduction that's being thrown by those who are against it. But as I mentioned during the keynote, the harm reduction is possible only when harm exists. So the harm reduction tools and devices should be, in the perfect world, available only to those who are cigarette smokers. So as a medicine, drug, it should be given to those who have a disease. So those who are dependent on nicotine, who are dependent on cigarette smoking, should be, in the harm reduction technique, suggested replacement as a treatment of their habit, as a treatment of their disease, because being dependent on nicotine is a disease. And if it was this way, there wouldn't be any consideration on, whereas this will create a new group of users. But, we know instances, also in my country, we have the cases that new products have been introduced to the market, made available publicly, and sold not to the groups they should have been sold to, and they created now by themselves or by itself also a threat to public health. So instead of one threat, we have two threats now. But this shows only that legislation does not follow fast enough the changes in the market. So this is the thing that I wanted also to tell you during the keynote. Well, the politicians need to look more carefully to what is happening, and to be a little bit more flexible and willing to understand and cooperate. And finally, we need all a little bit more health education to understand what the harm reduction products are. We do not question harm reduction in hard drugs. We do not question harm reduction in diabetes with sugar. So why should we question harm reduction here? But we need to find tools that ensure that this is harm reduction and not harm spreading.
Thank you very much. Let me come back to questions from the room, and we had at least two people waiting. May I ask the gentleman at the far end of the...
Yes, thank you very much. My name is Frank Henkler-Stefani from the German Association Tobacco Industry and Novel Products. I found a very interesting discussion. There's clearly a need to have a minimum level for taxes on tobacco to encourage people to smoke. But if I understand Michelle Minden especially correctly, there's also a need for an upper limit, because if it's too high and we exclude black markets, of course, expenditure, especially in deprived families, would really take away income which could be spent on education and other issues. So there may also be quite some sensible arguments for a maximum level. And in Germany, we have requests to put levels up by some people even suggest 10%, so that levels could go up to 15 euros, which would be the cost of a bottle of champagne in the supermarket. And the question is really, how would you think a maximum limit would be sensible? How would you fix it, and how would you put it into relation with novel and risk-reduced products? Thank you.
I can answer that pretty quickly in that I just don't think taxes should be, this is my personal opinion, I don't think taxes are a good way to affect people's behavior. I think that's a very perverse way to go about it, with a lot of perverse unintended consequences, especially on vulnerable groups that are difficult to predict and hard to measure, so we usually don't really think about it all that much. We just say, well, if it's hurting them that bad, they would just quit. Right, so I don't exactly think I don't think maximum taxes would be good in the same way that I don't think, I'm fine with the taxes, but I just don't think using taxes as a way to try and modify people's behavior I generally think it's much more of a way for government to generate revenue, and then creates the perverse incentive, the conflict of interest, where they become reliant on that form of tax revenue.
Right, thank you.
A short comment on this one. As already mentioned, I think that the excise or any tax put on alcohol or cigarettes must be tested to the market, because a different level of taxation will be effective in Germany, and a different level of taxation will be effective in Poland in that case. So I don't even think there should be a common policy in the European Union, because, well, it doesn't work in all the 27 countries, exactly the same attitude. This is the first thing. Second, well, when we have a high income on the taxes and excise taxes or value-added taxes, and we claim, or maybe the government claims that they will go to teaching and health promotion, I would love to trust what they say, but I remember for 10 years I was supervising the so-called 0.5% taxation that should have been given to the Ministry of Health every year out of the excise from alcohol and tobacco. Never happened. So, well, these are the 2 points in this discussion that I want to stress as far as the taxes are concerned.
Yeah, I want to add one thing to that really quickly. And so first of all, obviously I understand that changing the price of a thing does have an effect, especially on youth, right? But I think it's very difficult, going back to the whack-a-mole issue, it's very difficult to deny the fact that we live in a pretty connected world, especially if you're in Europe, where you have different levels of taxation and different levels of prices, and the response people in the underground industry have is to simply move the products around where they're going to be making the most profit, functionally taking cigarettes from a country that has lower taxes or where the prices are lower, and then moving them into a higher one. And then you have to go as the enforcer, as the government, you have to deal with this. You're not dealing with you have to address the demand, not exactly the supply, because the market, legal or not, will always find a way to supply.
Well, exactly. I do agree with this one, with one but. The but is, well, we're not saying that we need to follow the Al Capone times and ban the cigarettes as alcohol was banned 100%. We try to say that when we raise the taxes, we leave a cheaper alternative, which is the huge difference. And if the argument of those who are against raising taxes will say, okay, we then have illegal trade, we have illegal production, I will say, okay, we do have services we have in this country that should take care and enforce the law that it's existing. So, well, this cannot be an argument against raising taxes for alcohol or cigarettes that we will create a black market for them.
All right. Well, thank you very much for this discussion. And let me give voice to lady in the far end.
Thank you very much. I'm Tatiana, I'm from Belarus. I've been managing harm reduction projects, but for people who use drugs. And that's why I'm very sensitive to the issues of discrimination. And Michelle, in her keynote, mentioned the importance of creating supportive environments for people who use tobacco. And as we all understand that the nicotine dependence is a disease, isn't it? I would like to draw the attention of this audience to the fact that the most prominent health organization in the World Health Organization, does not hire people who smoke or use tobacco products. Did you know that? I mean, in every job advertisement, the WHO writes that we have smoke-free environment and do not recruit smokers or users of any form of tobacco. So my request is, do you think that this tobacco forum full of esteemed professionals in this sphere and very humane people can make an appeal to the WHO against this ugly discrimination? What do you think?
We've been trying. We've been trying for years on that. I honestly, as long as tobacco control remains the dominant paradigm, I frankly think no, because when we call something a disease, I actually take issue with that nicotine addiction isn't a disease, because the things that we decide, whatever dependency we decide becomes a disease, is very political, frankly. We don't usually talk about caffeine addicts as having a disease of a caffeine addiction, because, I mean, well, it doesn't cause as many problems as tobacco, for one, but also, it's a socially accepted behavior. And I think the reason that places like WHO have those policies and continue trying to force those hiring policies on other businesses. We have businesses in America, I think U-Haul, for example, that has the same policy. They will not hire drivers who smoke or use nicotine, even if that's the patch. And I think the reason for this is demonization. It's part of the denormalization campaign, but it's also it's part of an anti-compassion campaign, where if you say we will not hire a person who does X, you're functionally turning them into a monster. And you're bad. It assigns all of these other features to the person who uses nicotine. Like, why are you not a good hire just because you use nicotine? I think the reason, frankly, is the WHO or whoever decided to put that policy in doesn't want people coming in to the WHO who have knowledge about what life was like using tobacco, and therefore compassion for the people who continue to use nicotine and tobacco.
I absolutely agree with that one. And one more comment. We had a big campaign in Poland for the work givers that complained that those who smoke, their employees who smoke, use at least 1 hour daily to go out for a cigarette. So actually, if they work for 250 days a year or 300 days, so they are being paid 300 hours yearly, well, just for smoking cigarette and work. And then that was a huge problem. So we were even suggested work givers to the employers to support alternative techniques for those who decide to try to switch, and there are several places in Poland where we, well, I wouldn't say introduced this regulation, but many employers went this way. And for me, it's unthinkable that a public institution could say that I will not employ you because you're a smoker. No, I have to try to help you find a way out of your smoking habit, but I cannot tell that I will not employ you. Of course, you cannot smoke among those who are not smokers. This is pretty obvious, but it's not that you will not be employed. For me, it's unthinkable.
It also really betrays a lack of confidence in their own abilities to help people quit smoking. You would think if you're a smoker, come in and we'll immediately help you quit. But no, just go away. We don't even want to talk to you.
Thank you very much. I hope that answers that question, although the question was actually to all of the audience to think about. Next one from Gerry, please.
Thanks. Gerry Stimson from KAC. It's a question about using the return or calculating returns on investment and using the return on investment argument. When I was involved in drugs harm reduction in the context of HIV prevention, HCV prevention, and so on, one of the big problems was persuading governments to spend money on undeserving populations. Why should I spend money on needle exchange, or why should I spend money on methadone for this population? So we often use the return on investment argument because the prevention of HIV has a greater social benefits. And worked with the World Bank, for example, who was trying to lend money to poor countries to do HIV prevention, and convince them that if they borrow that money, there's an effect on their positive effect on their economy. But when you come to tobacco harm reduction, there's an interesting methodological question and also interesting argument for governments, because it doesn't cost governments anything. It's one of the few public health type interventions with a small p, small h, where you don't actually have to spend any government money to do it, because the costs are borne by the consumer, who's paying money not to buy cigarettes, but paying money to buy a safer alternative. So there's an interesting methodological issue there, because how do you calculate a return on investment when the government doesn't have to invest anything? So you've got almost an infinitesimal return on investment. But secondly, it's often a point I think not picked up by governments. This is one of the very few areas where you can drive a public health intervention without actually having to pay for that intervention. I wonder if you have any thoughts on that.
Well, actually, I'd say that the income on the excise on cigarettes that the government has now is for sure. When we start thinking of changing it for other products, first, the excise is different. The amount of those who switch, well, maybe some of them will quit in the meantime. So the excise income is not so sure for the coming year. And maybe that's, they simply, being afraid of changes is very typical for a human being, maybe for a politician too. So maybe, changing the excise taxation and the product that has to be taxed makes them a little bit unsure of the real income that they will have in 1 or 2 years. I think so.
Thank you very much. And concerning the costs, let me mention a question raised in an old, it was 1990s American article. What will we do with all those poor pulmonologists and cardiologists if suddenly everybody stops smoking?
Well, that's a good question. That's why I'm also an allergist, and the allergy, as you know, is developing. So I'll find my way through that. But being more serious, Of course, as I said, I do not believe that we'll stop drinking and smoking in the nearest future, so in the 2-3 generations. So we'll find a way to survive. I mean, the doctors.
Yeah, and I mean, there's the perverse reality here too that a lot of people don't like to talk about, especially when it comes to something like smoking, is, you know, the Progressive Policy Institute in DC, they did a study, I think in 2018, 2019, of looking specifically at e-cigarettes and the effects on health, on smoking, and on health expenditures. And what they found was that by their predictions, because e-cigarettes helped people live longer, health expenditures actually increase. So like the cost of the government in terms of like Medicare, Medicaid, stuff like that actually would increase because people would be living longer to get those types of diseases that tend to cost a lot of money in older age, like Alzheimer's and diabetes and other things. But, you know, this is made up for in terms of, well, one, lives, so who cares? But then also in terms of productivity. You know, overall lifetime productivity for people who don't die in their 60s of smoking-related disease and suffer for years ahead of that is much greater.
Thank you very much. One last final quick question, and I will ask for a quick answer because we're over time. Coming online, a lot of money is spent on campaigns that end up stigmatizing people who smoke as part of the process of denormalizing smoking. Do you think stigmatizing people who smoke is an effective method of getting people to stop smoking? I think it's you.
This will surprise to get my answer. Yes, it is effective for some people. For some people, it is a very effective method, but not for everybody. And then again, this goes back to what I was originally saying. We don't often think about, for the people it doesn't work for, what is that doing to them and their kids and the people around them, and what effect is that having generally? I think stigmatizing people, if you look, for example, at specifically in America, black pregnant mothers, or black mothers, excuse me, when they're exposed to stigmatizing messaging about their smoking and their kids, their response is that they want to smoke more. They internalize the stigma, they feel bad, and then they want to smoke as a coping mechanism. So that doesn't help them, and that definitely doesn't help their kids.
Stigmatizing a person for any reason is not a proper way to go. It leads us nowhere on the long-time basis. So stigmatizing to have good result because he stops smoking tomorrow because he's afraid of showing that he likes smoking, this is only creating a cycle. Well, it's serious problems in the future. This for starters, and secondly, we do not have a right to stigmatize other people. At least I think so.
Agreed.
Well, thank you very much, and let us all thank with applause our two heroes of the morning session. And let me ask to continue the conversation in a foyer during the morning coffee break. Thank you very much.
Уважаемые дамы и господа, это для меня большая честь открыть и провести эту сессию. Я вижу поднятую руку, и я думаю, что вам должно идти там. Там есть IT. Go there, there's IT help. Так. Продолжая. Это для меня большая честь открыть и провести эту сессию. Посвящена вопросам снижения вреда от табака, курения в контексте Центральной Азии и Восточной Европы. Меня зовут Kasia Kowalczyk. Я сама рядом из Польши, но основная сфера моих интересов – это продвижение концепции снижения вреда в Центральной Азии. И благодаря участию в различных проектах я познакомилась вот с этими замечательными людьми. И мне показалось, что было бы интересно, если бы они здесь приехали.
They seem to me very interesting for us to address the above-mentioned issues and challenges in Central Asia and Eastern Europe. We are an overlooked region by a number of reasons. Maybe because of the geopolitical perspective, this is a very important region. As for the climate changes, these are the regions which will be hit by climate change are the worst. Unfortunately, we constantly observe the incidence rate, the growing incidence rate. And this Global Forum on Nicotine, where we address the percentage of smokers in countries of Central Asia, it makes almost 50%. And possibly some of you took part in GFN last year about the challenges in public health in Central Asia, and I would like to expand this topic this time, how we can advance tobacco harm reduction with the focus on key population groups. We are going to expand this topic, including HIV. Today, we will consider persons who use drugs, also people who use all kinds of drugs, issues related to adolescence. And the focus and goal of this session for us to hear more about this region, for us to learn about the issues and challenges in this region, and I rely on your active participation. And secondly, there are many challenges faced by Central Asia and Eastern Europe, and which are quite similar to those challenges faced by you in your countries. Jarkin, let us start with you, with your presentation. I don't hear the speaker. I'm sorry, I don't hear her. Can you please add there some more volume of the sound? I don't hear the speaker. I'm sorry. I would like to say that Jarkin, I know for 3 or 4 years. Jarkin is quite active, and she will represent the academia today. The floor is yours, Jarkin. Я не слышу, I don't hear the speaker.
Unfortunately, my luggage didn't arrive yet, and I am without suit. Sorry about this. And I will continue in Russian. Я работаю в Казахстане, являюсь
I work in Kazakhstan.
заместителем председателя организации негосударственной организации снижения вреда от неинфекционных заболеваний.
I work in non-governmental organization, harm reduction of non-communicable diseases, NCDs, including tobacco smoking, alcohol use, alimentary disorders, and also environmental issues and reproductive health. All of these issues and will help us to decrease the incidence rates in our countries. We are tackling this issue since 2014 as part
негосударственным сектором и с государственными министерствами и депутатами. Ну, об этом расскажем подробнее попозже. Зовут меня Гинс Кентра. Я сам врач, терапевт, занимался кардиологией. Сейчас, конечно, больше организацией здравоохранения занимаюсь.
Спасибо вам, Гинтас. Я хочу, поскольку эта организация, конечно, мне тоже знакомая, это очень тоже интересный подход, чтобы попытаться как будто продать концепт снижения вреда через неинфекционные заболевания. Так что у них есть очень много тоже интересных проектов, о которых Гинтас позже расскажет. Владимир.
Здравствуйте, уважаемые слушатели и те, кто сейчас пришли на эту сессию. Рад вас здесь видеть. Меня зовут Владимир Геня, я врач-психиатр и кандидат медицинских наук. Начал свою работу снижения вреда я сразу после университета, когда начал работать на пункте терапии опиоидными агонистами для людей, употребляющих опиоиды, и потом продолжил свою работу на кафедре психиатрии и медицинской психологии медуниверситета Белорусского государственного. Постоянно взаимодействую с общественными организациями и работаю в общественной организации экспертом по терапии опиоидными агонистами и социальном сопровождении людей, употребляющих опиоиды и в целом наркотики. И консультирую людей, употребляющих по вопросам снижения вреда в течение длительного времени на пунктах низкобарьерных пунктах снижения вреда, когда они приходят за обменом шприцев, новыми шприцами и тому подобное.
Большое спасибо. С Владимиром мы, конечно, тоже уже знакомы несколько лет. И это тоже интересно, поскольку Владимир как раз будет представлять медицинские сервисы, да, и сервисы по снижению вреда. Алла.
Добрый день всем. Спасибо большое за интерес к нашей сессии. Меня зовут Алла Бессонова, я из Кыргызстана. Я сама имею опыт употребления наркотиков. С 2006 году я бросила опиаты и работала в программах снижения вреда.
I quit opiates and I joined this harm reduction program, and I'm engaged in revising drug policy towards more humane policy. And the recent year, I'm engaged in some gender-based programs, harm reduction policy with the focus on with gender perspectives, and this tobacco harm reduction. Throughout my years of practice in terms of changing and revising the drug policy, when the community of drug users we were trying to change this tobacco smoking situation, and 95% of PVs are smoking tobacco, and it seemed to me very appealing and interesting topic. This is one of the most active persons in Central Asian region, and in addition to what she has said, and she has been nominated by the Bern Feminine Leader Award, and this is about human rights defending of people who use drugs.
Would be also interesting to know more about you, because these activities are such activities that it's not clear who is dealing with harm reduction, who is knows about the harm reduction and the harm academicians here, the people who conduct studies, research in this field, in this room. Yes. Okay. Do we have business people here? It seems that some people will have to raise their hands 3 at no times. Do we have representatives of NGOs here? Great, great. And what about medical workers, health staff who work in this field? Oh, that's cool. We have represented all the spheres. Maybe I didn't mention everyone, but my second question is harm reduction. Who knows what it is? Who works in this area, in this field? Do we have anyone who doesn't know what harm reduction means? I think that you will raise your hands. Okay. And my last question. Do we have any person here who help others to quit smoking? Work maybe in different services and promote quitting. Oh, excellent. Actually, it was the last but one question, and now my really last question. Maybe you work, and I'm just looking at 2 persons over there who are key population, who works with key.
Так что я сейчас еще, вам придется выдержать минут 5. Я хочу чуть-чуть побольше рассказать про ситуацию в Центральной Азии и Восточной Европе. И потом пройдем дальше. Камиль, можешь включить 3 слайда буквально? Да. То, чтобы пока Камиль включает, то, что... Не то, презентацию. То, что вы должны, наверное, некоторые из вас уже знают, к сожалению, район Восточной Европы, тоже Польша и Центральная Азия очень сильно в разном смысле зависит от России. И я говорю про это, поскольку Россия против концепции снижения вреда. И по этому поводу здесь так все и сложно. Концепция или вообще вмешательство, связанное с снижением вреда, конечно, присутствует в районе Центральной Азии, Восточной Европы уже около 20 лет. Да? Особенно, что касается вмешательств, связанных с ВИЧ или с наркотиками. И то, что хочу тоже подчеркнуть, к сожалению, снижение вреда не существует как особое явление. Это часть сервисов, часть ответа на проблемы, связанные с ВИЧ. И большое количество сервисов финансируется за счет иностранных доноров, в том числе Глобальный фонд. И это важно, поскольку много того, что мы можем делать, и либо наше вмешательство зависит от того, на что согласится донор. А они очень негибкие в этом плане, совсем, да? То есть это тоже будет один вопрос, который мы будем обсуждать сегодня. Как достучаться до них. И это одна вещь. Что касается курения, это, конечно, одна из самых главных причин смертности в районе. На третьем слайде, который вы не видите, я показала некоторые данные по этому поводу, но вы должны мне поверить на слово, что в среднем это где-то между 30 и 40% населения курит, да, мужского населения. И это печально, хотя все страны, включая тоже Беларусь, подписчики рамочной конвенции ВОЗ против табака. И по этому поводу все страны пытаются внедрять разные меры. То есть существует запрет на курение в общественных местах. Да? Все, что связано с налогами, тоже есть. В некоторых странах можно покупать разные безопасные продукты, содержащие никотин, но сейчас то, что мы тоже наблюдаем, это запрет идет, да? Запрет на продажу и покупку, особенно сигаретов. Да. То, что является тоже одной из главных проблем в районе, это бездымный жвачный табак, назвай. Да? Я думаю, что Жаркин нам расскажет тоже про больше по этому поводу. Есть тоже очень интересная проблема контрафактных продуктов. То есть благодаря соседу, благодаря Китаю попадают в район очень много поддельных препаратов, поддельных средств и продуктов очень плохого качества. Про это, наверное, Гинталтас может чуть больше тоже рассказать. Но я еще, когда я изучала район, мне показалось интересно посмотреть, ладно, существуют ли сервисы, которые помогают людям бросить курение в районе? В теоретическом плане да. То есть есть nawet
And there is a hotline in Kyrgyzstan. I was able to find it. There is a hotline in Belarus, but I don't know a single person who used this service. And of course, all of them rely.
Поскольку снижение вреда от табака почти не существует, да? Вот это пионеры. Ладно, на этом я заканчиваюсь, и сейчас дам возможность высказать тоже интересные вещи нашим панелистам. Кто хочет начать? Давай. Можно сидя, можно здесь.
Дорогие друзья, давайте для начала небольшой контекст Беларуси вам расскажу для того, чтобы понимать, в каком месте находится курение в Беларуси. Беларусь это, вы знаете, что большинство из вас, наверное, знает, что это страна на востоке от Польши, да, имеет большую границу с Польшей. Наверное, многие из вас слышали про кризис мигрантский, который создан на границе с Польшей, из-за чего сейчас Польша строит большой забор, усиливает уже построенный забор для того, чтобы мигранты нелегальные из Африки и Южной Азии не могли незаконно попадать в Евросоюз. Вот. Но, наверное, еще и многие из вас слышали, в Беларуси 9 миллионов человек живет, и кроме Польши граница с Украиной, граница с Россией, Литвой и Латвией. Наверное, еще, возможно, я могу предположить, что многие слышали, и Беларусь часто называли последней диктатурой Европы, да, и это особенность, которая в том числе влияет на контекст потребления табака в стране, потому что все производство сигарет принадлежит государству. То есть есть люди, то есть в государстве монополия производства табака, и когда, например, говорят о повышении акцизов и поступлении в бюджет от акцизов как компенсации, например, вреда, вызываемого, хоть частичной хотя бы компенсации вреда, вызываемого курением, то надо понимать, что
Okay, we have to understand that the money from selling cigarettes, from producing cigarettes, all of them are collected by the government. The people who are allowed to produce such products, they have to pay taxes and excise taxes. So it comes to one unified budget. And if we talk about statistics, then the recent epidemiological statistics was collected through the social study of WHO on non-contagious diseases, and it took place in 2020. At that time, on the average among adults, 26.5% were smoking. And if we divide them into male and female, among men, 42%, and among women, 11.3%. Quite noticeable gender disbalance. So this has its own implications. So probably there is even more pronounced disbalance in Central Asian countries because the difference can be even higher. And now I wanted to dwell upon the issues related to key groups and the questions related to people who smoke and the people with psychic disorders who smoke. So here I would like to share my viewpoint, why we still talk too little and pay too little attention to the people who smoke, who abuse substances, especially people with psychic disorders. So, and in this context, we can emphasize two specificities. There are reasons which are induced by the society, and there are reasons which can be promoted by commercial sector. So in terms of the society, we know that people with psychic disorders, those who consume drugs and psychic substances, they're also subject to ostracism and discrimination. And in general, for a long time, they were perceived by the society as the people you should not notice at all, as long as possible. You should not see them. And we can even see it using the example of location of psychic hospitals. If you visit the post-Soviet countries, you will see that almost all psychic hospitals are outside the cities. So it means that people with psychic disorders should not be among healthy, normal people. So therefore, these people are considered to be like the people with defects, they should not be paid attention to, so there is no need to pay so much attention to their health. So I would say they should be banned. And the drug policy is a continuation of the police operations. And the hospitals which were created that time for drug addicts, it was not under the health system. So drug addicts were considered to be like delinquents, and therefore there is stigma that these people should be punished for consuming the substances. And the health care regarding smokers is also of the same nature. It seems that we have to punish those who smoke. And therefore, the health sector pays very little attention to people who smoke, who abuse drugs, and who have psychic disorders. And I would say it's a global problem. We know that people with schizophrenia, they live 15, 20 years less than the overall population. And it may look strange, but the major reason of the deaths of people with schizophrenia are the diseases caused by smoking. And in different countries, the situation can be different, but on average, 70-90% of people with schizophrenia are smoking. And similar figures are among people with bipolar disorder. The share is a bit less, but also quite high number of people with depression who smoke. And according to the STEP study, which was conducted by WHO in 2020, Minsk, the capital of our country, turned out to be the city with the largest number of people with depression among all European cities. And a similar situation is with people who use drugs. They live much less compared to the overall population. And if we talk about cancer risks for people who consume drugs, it's not the pressing topic because they do not live as much as to reach that age. So they die because of other diseases, because when they take injection, they disrupt, they damage their blood circulation system, which increases the risk of strokes and thrombosis, and smoking increases these risks even more. Another issue, what I wanted to tell you from the very beginning, and I mentioned the influence of non-commercial sector, is the wording which you heard several times, the key groups. Where this term comes from? It comes from the group of infectious diseases, contagious diseases, or HIV. And on the one hand, when we talk about the HIV infection,
focus of drug reduction, harm reduction, is not on health, but not to spread HIV. So we're not focusing on the customer health, but focusing on protecting other society, the rest of people from those consumers. And smoking does not actually increase the risk of HIV spread. And organizations that provide money and lobby harm reduction programs from drugs. They're not interested in harm reduction in other contexts outside of HIV context. Because if you remember the full name of the Global Fund to fight TB, AIDS, and malaria, and smoking impact on TB. However, it provides less impact compared to drugs or other social factors like poverty. And public health sector are actually trapped in their own trap, so-called, which is created by agenda of infection diseases. When public health focus more not on health of people, but also protecting people from HIV. And now we actually getting the result or response of this system when in harm reduction. We find it challenging to refocus from the opioid market to the new situation when there are some synthetic drugs and newer drugs which not only injected but sniffed or smoked. And but however, this poses less interest to donors, as Kasia said. Harm reduction is financed in Eastern Europe and centered by foreign donors, and governments are not interested. Governments are not interested in this issue because this group contains other age structure and other sort of population structure and age structure. In Central Asian countries, I can talk about Central Asia because I spent 1.5 years in Uzbekistan. I used to work in medical institute in Bukhara in psychiatric and oncology department. And should we talk about the number of population in Europe, we know that population rate is declining, and we know that for the recent 35 years in Uzbekistan, started from 1990, the population used to be 20 million, and now they have 37 million. So they have very high birth rate. and health of people, of aging people is not a big concern to the government because they have enough people of the population. The government interested in exporting people from their country to other countries and transferring funds and transferring money back to their families. This is the context that I would like to outline. Thank you, Vladimir. I fully agree with what you said. I'd like to share a little bit about the context of harm reduction in Kyrgyzstan. Kyrgyzstan used to be a very democratic country. Unfortunately, we're losing this status. We used to be ahead of all countries in Central Asia in harm reduction programs and HIV and prevention of HIV. Needle exchange program was launched in 1999, and substitution methadone therapy was launched back in 2002. As far as harm reduction is concerned, I understand I represent this community, and I believe it's slightly different things. Services available in Kyrgyzstan for drug users. They work in the context of HIV treatment and prevention, and what these programs provide, like needle exchange and condoms. And good thing, a positive thing that I'd like to note is that besides methadone, substitution therapy will include buprenorphine, prolonged. So injection, which is done once a month, and the user, the client, receive this one. And the substitution therapy, this is essential drug for drug users. Unfortunately, doctors tend to manipulate this with their power and can sort of penalize the user client and deprive them from this essential drug. To my understanding, harm reduction program is not limit ourselves only needle exchange. We should include the drop-in center, rehabilitation center, which we don't have since 2019. Education about the culture of drug use, because there is some culture of drug use. If people have access to this information, I believe this will lead to reduction on demand when people have accurate information about all substances. And as Vladimir said, this situation is not only in Belarus. About 10 years ago, our drug policy has changed significantly. When in Kyrgyzstan, we have a lot of opioids, heroin of high quality. It disappeared, and the market was overwhelmed with synthetic drugs, Chinese produced in China. It is not injection, people smoke and sniff. And this toolkit for drug reduction, they don't need that. They don't need syringes and needles, and they don't use condoms because we all know, in particular those people who use drug users, how this synthetic drug impact the sexual behavior because it is not controlled. As Vladimir already said, all these programs built to protect the society from us, but not to make better quality of life or to improve health. When I was thinking about harm reduction, tobacco harm reduction, I understood that this is quite a challenging task. Talking about people, when you have always a threat to have access of essential drug or substitution therapy, how we can talk about the harm reduction, tobacco. Another very important element, taking care of health, this is privilege to people with average income or well-to-do, but 1/3 of population live behind the poverty line. If, for example, person doesn't, if I don't know how I can feed my children tomorrow, how I can take care about my health. At the same time, I believe that we need to start to work on this topic and provide information community. This can bring some results. But this again depends on us, predominantly from civil society. We need to advocate it. We need to implement into harm reduction programs, because if we look from the viewpoint of the government, tobacco, cigarettes is a product that brings some revenue from excise tax, and our members of the parliament are talking some not very smart things about vape and some substitution therapy. I can just show one example. Just recently, before coming here, talking about our government. Unfortunately, we don't have sort of a left or those right or all people have looking at the same side. And just one person can offer in the parliament some reasonable thing, but it's very difficult promotion. One member of the parliament 3 days ago and proposed to penalize for vaping for 40,000 soms, like $500. So in public places. So penalty for cigarettes is 3,000 soms. Smoking 10,000 soms, and smoking vape 40,000 soms. I believe that people are interested not to change the system, to have more cigarettes, to get their own benefits, and to look. We need to have allies, some decision makers that can change this system in harm reduction program. As Kasia said, I will talk about NASVI. NASVI, this is non-smoking type of tobacco. It is produced locally in Central Asia and Kyrgyzstan in one region, which is called Batken region. And it's quite sensible part of the budget of this area. What is NASVI is, in fact, in Central Asia, existed historically for a long time. It's part of the cultural practice. Several hundred years people use that, and historically it was created as we have this production. In this sense, since this is the part of the culture, the government ignored that, didn't pay attention, because this was some part of our life. And NASVI include tobacco, then lime, and just some myths, many myths. Some people say this is true. Some producers say that this is myths or legend. Some people say that in order to make a good form, like chicken, and often they add oil or vodka, and chicken droppings or camel droppings, and obviously this is harmful and cause a lot of diseases, and very and the scary thing is just this chicken dropping of excrements, but no one tells obviously about that. Central Asia doesn't have any lab that will allow to make examination or assessment. Kazakhstan, they tried a Swiss company to do analysis of the content of Nasvai Kazakhstan, and they identified tobacco and other things, and they identified it's quite dangerous because they found that 86 time exceeded the norm of plumbum of different substances like rodbane and other substances that are very harmful to health, and they prohibited to produce nasvai in Kazakhstan. It used to be back in 2011. 2013, have a big problem among young people that start using nasvai in Russia. It was banned in 2013. In Turkmenistan, 5 countries, you know, these are former Soviet Union country. Turkmenistan is one of authoritarian states in the region, and they prohibit production and use of nasvai since this is authoritarian country, and they have clandestine production, I believe, because they have historical practice.
What are diseases it can cause because it's smoke less tobacco, like similar to snus, like in Sweden. And this is quite a safe tobacco product because in Sweden they regulate the production of snus and some negative substances were removed from the content of snus. In Sweden we can see the least number of smokers and the least incidence rates of cancer diseases, cancer diseases of the mouth. And in Kyrgyzstan, it is the contrary. No one is overseeing the production, and no one says can say anything about the content. And the doctors claim it can lead to very adverse effects in terms of health. And the children in the age 13. Children in the age of 13 to 15 of age. No, it's here. It's here. What's wrong? Children in the age from 13 to 15 are exposed to.
Officially, they said it's more than 20% of whole generation. So the age officially they say starts from 13 years, but in reality it starts from 10 years. Why? Because it's so cheap. It's even cheaper than cigarette sticks. So the cost of the nasvai, like it's 20 som, which is like 25 cents, while cigarette pack is 150 som. So that is the 2.5 USD, right? So which means every kid can buy nasvai because nasvai has been sold in front of, like, you know, next to the school. Every shop are selling nasvai, and children are buying it. Why? Because parents cannot recognize that children are smoking. That is smokeless tobacco, and also the peers, right? How all those teenage and other things, so that they influence the impact of the peers. So those are the quite big issues, and there was done one research, and according to the research, almost 60% of whole school children were consuming nasvai. That is, yes, almost 56.6. And they said out of these 56.6%, 27% are the girls, little girls. So, which is really huge issue for the country and for country generation. And we have to pay, like, the government should regulate. So they've tried to do something, and few times. So first time it was in 2000, deputies, the parliament deputies, they started discussing about NASWA in 2013, and they like one said something, and then they like ignored him, and then they started talking about it again in 2015, and then nobody paid attention, and then they started talking about NASWA, like, prohibiting NASWA as it was in the neighboring countries in 2015, and then again nothing happened, and in 2017 also nothing happened, and then they raised this issue in 2021, and they decided, since NASWA is one of the main budget of one of the regions, they postponed discussing this law up to, till up to 3 years. So this year they should start talking about it. So not talking, but mostly about prohibiting. But then recently, this year, the organization which regulates NASWA production, kind of, not that regulates, but oversee, that is our agriculture ministry. And they said, most probably we have to regulate and control the NASWA production in the country, since NASWA is one of like our regional export. Because they say like our NASWA products were exported to Russia and Kazakhstan, while in Russia it's illegal. So this was exported illegally by migrants. And it's still a huge part of the budget for that region. And that is why they're discussing about like regulating, and I hope, of course, it's quite kind of dreamy, but I hope we will have some kind of, system or regulation which Sweden has. So I hope that it will be regulated. And another thing is that with the NASWA, it's very difficult to monitor, control the young generation, because they're consuming. And then the parents, they don't know what to do with this habit. And that is a huge issue. And that is like my research interest on like harm reduction, which is smokeless tobacco in Kyrgyzstan and in Central Asia. And NASWA is really huge part of the smoking practices, cultural practices in our region. Thank you.
Yeah, okay. But when it will be ready in Russian, it will be great, because our region is mostly speaking Russian regions, and it's for us also important that our government.
Can you hear me in English channel? Can you hear me in English channel, please?
It's working, yeah? I will continue in Russian,
yeah. With your permission, I will continue in Russian. Yes, the problem of nowadays is the problem of vulnerable groups of population. We talk a lot about the harm reduction of tobacco harm reduction, THR. There are many recommendations developed. We share these evidence-based recommendations among many groups, and drug use, harm reduction, and harm reduction related to many aspects of life. But Kasia mentioned about the vulnerable groups of population. We tried to bypass this topic, and this is the right time for me to reflect. I come across these people on a continuous basis, but we didn't recognize them as a separate group. Is it reasonable to recognize them as a separate group? Then the answer is probably yes. Schizophrenia, 80-90% of smokers in US, it is 90% amongst people with schizophrenia, and this is high percentage among the vulnerable groups. Drug users are also recognized as a vulnerable group, and as it was pointed out, the drug use implications are quite heavy, and the substitution therapy generate some hopes for them to live a little longer. In Kyrgyzstan, they moved even further. In Kazakhstan, there is a resistance. It is a harm reduction practice recommended by WHO, but nonetheless, in this society, they raise this issue quite often, and law enforcement agencies are quite opposing, and even health professionals lack some appreciation or understanding of this concept of harm reduction. And the harm reduction among in the communities and narcologists in private clinics, which generates quite big earnings for treatment of drug users and drug addicts. Of course, there is a vested interest of these professionals, of these doctors, and tobacco smoking is not raised as an issue among these communities, among these key population groups. Methadone substitution therapy does not generate intoxication, and the person becomes a normal member of the society once they can live until the elderly age, and they can generate income for the country, and the person should be healthy. And of course, this person should comply with all the criteria as other people of this. They should be free, they should not be exposed to the risks of cancer diseases, the same as the other groups of the society. And the other group are the young people. We deal with the students. Our organization is engaging with the students, and we provide lectures to the young people, to the youth. And we provide these lectures to the freshmen in universities. In Kazakhstan, we have a big number of colleges and higher educational institutions or universities in Kazakhstan. And in 2022, the number of people enrolled to first year course of universities is 25,000 persons. These are ex-school children. They come to the big city, and they want to be the same as the citizens and residents of the capital city. They want to feel the same way. This is about risks. This is about nightlife. This is about alcohol. In the best case, cigarettes as in their mouth, as it was in advertisements. If the local residents are smoking, this is a kind of fashionable way of living, and they use drugs, and these young people come unprepared because their parents did not educate them, and the schools don't provide this education, and they are left on their own, and they become vulnerable groups of population. But in fact, we are not used to recognize them as a vulnerable group. The study of the WHO, the average age of initiation of smoking is 17 and a half years of age. And this is exactly that group of population. As for the drug addiction, alcohol addiction, all of these young people start initiating this bad practices. Why not 30 years, 60 years of age? No one will start initiating, and they have some other concerns. They have other diseases. They have their life experiences, lessons learned, and if the person is of young age, they're exposed to these risks. And here it is to do with the psychology, the adolescent maximalism psychology. This is being a rebellion and following some role models. And the psychological dimension of combating dependency we are missing. And I think education should start from the very early childhood. We have to prepare the future parents. We have to provide specific courses. This is this is about the costly program. This is not that costly because prevention is cheaper and the treatment of the cancer is much more costly than conduct the outreach campaign and the combat the effects of nicotine of tobacco smoking or drug use is quite costly. We have to have the big army of the police to control the illicit trafficking, and despite our efforts, it will continue. And another aspect which we come across very often, the easy approach to fight the dependency. This is about prohibition, banning from the university. As years we know about diagnostics, history of the disease, and it reads. And when it comes to the disease diagnosis, they prescribe that we have to get rid of the harmful bad habits. And we say people, you have to quit smoking, you have to quit drinking, and in half a year they come back and we start preaching them.
Но не откажется от привычек. С этим мы сталкиваемся. И по этому же пути, когда идут политические деятели, депутаты, министерства, а мы с этим сталкиваемся повсеместно и не только в Казахстане, но и наших соседей, это методы запрета. Это самый легкий метод борьбы, самый показательный и самый легкий метод борьбы с зависимостью. Запретить. Издал закон, все, и больше ты уже сделал самый максимум, но, к сожалению, это только ширма, она не рабочая. Для самоуспокоения себя и общества, потому что запреты никогда не работают. Любой закон, запрещающий вейпы, наркотики, любой препарат.
Any law which prohibits drugs and alcohol. Do you remember this bootleggers time in the US and the Gorbachev time in the Soviet Union when they prohibited alcohol? What we saw, there were hospitals full of patients with intoxication, and we couldn't cope with that. And the same happens in Kazakhstan because such phenomena is being spread among the teenagers, younger people. And these habits are acquired at the time when they're young, when they're adolescents. And this means that we do not do our work properly, be it the government, the society, the professionals. If we do nothing, whatever we do to ban, every time it is more lucrative for them. And through these bans, we actually create attractiveness for young people. If it is prohibited, but he has a cigarette in his hands, and if it's prohibited, but he has a drink, then he is a hero among his peers. And without working with them, we do not create the negative atmosphere for us, but it's a positive environment for younger people. I will give you some example. I just talked with some of the teachers in Kazakhstan. Toilet for girls. If you don't have a vapor, it means you are a dude. So, you know, it's not already a subculture. It's a stigma younger people. So the time when bullying starts, and the prohibitions are actually dangerous. And if prohibition work, and they work, then we have to follow the same road of bans. And in Kyrgyzstan, they also raise the issue of introducing bans on vapes and tobacco, not telling who needs those bans. They're just covering the reason, saying that it's just to protect young people. And by doing this, we will be able to preserve their lives. We can keep the budget of the family, of the country, and we can reduce the
эти многие исследования, мы их приводим в пример, показываем
uh,
страны успехи в мире.
we can reduce the expenditures. And to try to support these initiatives, we are sharing examples, best practices, but unfortunately, our opponents say only one thing. They are referring to children and teenagers, and by doing so, they are actually promoting the use of the substances by young people. So in some countries even have an age of 21 years old to be responsible for any offenses. In other countries, it's 18. Why there is such a gap when they were trying to increase the age of 21. We didn't support it because people, for example, can start smoking even at 18 because the law doesn't work. Will it any positive aspect? Because the law is actually violated, and this means that the laws work, and it means no need to comply with them. And we have to understand if the law is invalid, it damages the image of the country, and everyone can understand that you do not observe it and nothing happens to you. As for the faked products mentioned by Kasia, we also deal with these issues regarding smuggled or faked products. And during 4 years, the turnover of counterfeit products in Kazakhstan is $30 billion US. 4 years. And our population is 20 million people. And in the world, the counterfeit products, according to the customs data on confiscated products, it's up to 260 billion US. These were the items they were able to confiscate. Why we started dealing with this problem of counterfeit product? Because it undermines the concept of harm reduction. Using the example of chewing gum. So there is a sugar-free chewing gum. We know the brand names. I'm not going to tell them. So we were doing our analysis using those brands. Everything is done ideally, but it contains sugar. It doesn't contain any sugar substitute because it is expensive. But sugar is cheap. So when somebody does this chewing gum in his basement illegally, they think about earning money, but not providing any good impact. So it means the person who tries to avoid sugar-containing products will use it. So in fact, it will not regulate its sugar. It would harm the vessels of the person. The same goes with alcohol. They counterfeit alcoholic products. They counterfeit tobacco products. They fake excise stamps on tobacco products. But they also manufacture vaping devices. I don't know much information about multi-use products, but for vapes, there are so many fake products because their cost will be 3-4 times lower than that of official manufacturers. And what they save money on the ingredients. If we know that lipoic pneumonia, which was caused by vapes which contained E vitamin using oil, and oil is not processed in the body, therefore it resulted in casualties. So the aromatizers with oil, they're very cheap. If you add this aromatizer into the vape and you don't know the composition of that substance and you use it, it will result in some very bad conditions. Unfortunately, we don't have regulations in Kazakhstan regarding these products. So therefore, we use the method of banning them. So by banning these products, we open up channels for fake products, for smuggled products. So, and there would be many of them because it's the rule of the market. If there is a demand, there will be growth, there will be supply. And we already formed the subculture among our teenagers, unfortunately, but it's true. And now, after updating the law, of course, the police will work, the government will work, they will check official sellers. So it said that the situation will come down for half a year, but next time you will see another surge of these fake products. If you remember the dry law in US, for the first time, for the initial period, there was no alcohol in US because everybody was waiting, observing what happens next. But market acted, and there was lots of alcohol coming to the country. Also, again, back to the history of Soviet Union, when we had Komsomol wedding without alcohol. So what they did, they just used a bottle of mineral water, put vodka inside. They used a teapot and put cognac inside. Did it help to eliminate alcohol? No, traditions persisted. The same will happen with with vapors. You don't know what kind of ingredients will be in the vape tomorrow. And unfortunately, I'm more than sure they'll have another problem tomorrow. What should be the right path to introduce technical regulations and control? Regarding the spreading of sales, they can sell, but under control, but it's difficult. So the danger of bans is just to ban, and that's it, nobody controls. So when we can see the vulnerable groups, we have to expand our vision, we have to include all age groups. And I think by raising this issue, the issue of regulation, we have to be prudent. We should not be hiding under the curtain of bans. But another question is, what do we do with other groups? We have the International Disease Classification 10. There are treatment protocols for doctors which describe what they have to do, but they don't have any standards for prevention, for preventive work. We have a diagnosis, we know how to treat, but what to do in terms of prevention? There are no recommendations available. So if these recommendations are developed, how to prevent diseases and include the prevention for tobacco smoking among vulnerable groups, then this would be a law for doctors, what they have to observe, what they have to do. This will be described in detail. Maybe we can follow this path. And now we work in Kazakhstan with the Ministry of Health, with the government regarding harm reduction and introducing this concept in health facilities. We already have some very good results in this area because we do not differentiate alcohol taking, tobacco smoking, consuming substances, and reducing diseases caused by them. Because in all these areas, we have the same approach. And by introducing such approaches, we are trying to find solutions together. Unfortunately, the WHO Frame Convention does not assume any further developments. It doesn't expand its framework in terms of the prospective work. This, unfortunately, is a challenge for us, a problem. But gradually, we see that the medical community starts to understand more and more. And what's more important, the political establishment in Kazakhstan also understands more about harm reduction concept. So it's important to share information, to communicate information in two areas. So the first one, work with the population, and second, the work with politicians, policymakers, which is more important. Thank you very much for that. Sorry for interrupting you. I would like to give an opportunity to our audience to ask questions. And I'm very thankful because in your statements, you already proposed some solutions, some approaches. And one of the comments I would like to add is regarding drugs and new psychoactive substances, including smoking among drug users. We don't have studies on that. And I think that it's one of the aspects we have to take into account. But now it's your time, it's your moment, and I hope that our audience also have questions. Please, if you have questions, raise your hand. While they think, maybe I'll share a comment. So my colleague mentioned some of the items, and I would like to focus your attention on them. So to be brief, just to highlight that sometimes some myths go so deep in the conscious, including among specialists, because our colleague referred that there is a problem with tobacco, especially the problem of drugs, which create harm to health. But if we consider figures, then it turns out that in Belarus, every year at least 20,000 people because of smoking, and 1,000 people die because of drugs. And it means that 20 times more people die because of smoking, and because of alcohol, about 10,000 people. If you consider the same data in Uzbekistan, for example, in Uzbekistan, every year at least 60,000 people die because of smoking, and because of that, about 500 people.
So level of problems are different, and we view drugs as something extraordinary, very severe, very tough. However, if I look at numbers, the number of deaths related to drugs much lower compared to numbers related to smoking. This is one thing, and policy accordingly implemented by politicians very often based on not on evidence-based but based on the convictions. And the second time, what I would like to stress, these convictions or how the policy developed in many countries. One of the signs of authoritarian state when human rights are ignored, and the sign is willingness to control people or authoritarian state that try to control everything. Like we can see in Central Asian countries where homosexual relations are prohibited. We see in countries the attempts to control whether alcohol, for example, are allowed and cannabis is prohibited. And when we support some prohibitions, if we ignore human rights, I mean, this is authoritarian. The human rights are, don't play an important role compared to the willingness to control. And very often, the willingness to control is automatically supported by people which support such tough decisions because they would like to be part of the control group, to be together with those. It's like a small dictator in every person, and potential solution is to pay attention to this internal dictator and to control and remember about how people will take controls through smoking, and this is the right of person until he or she creates some problems for people surrounding, and task the objective of the government the risks to minimize the risk if possible. If somebody would like to enjoy nicotine, to do it like in a safer way, using powder, using vape, if this individual wants to use pellets, to use safer and clean needle and not risking to die from overdosing without naloxone. And this objective is to create a safer atmosphere for people so that their rights will be implemented. Thank you very much. We don't have very bright color here. I don't see. Do any of our audience have questions? I would like to come back to the question, what we're going to do in our relevant areas. We have representatives of academia, we have NGOs, and health services, and the community of users. What do we need to do in order to engage this topic on tobacco harm reduction? I'll talk about Kyrgyzstan, for example, harm reduction from tobacco in Kyrgyzstan. We have, back in 2010, our country developed clinical protocols to treat tobacco addiction. So this clinical protocol exists. We have sort of free communication, but in Kyrgyzstan, all laws are very good. And the problem, they do not always work well, because some government is not interested in certain things because they need to spend money, invest a lot of resources, but we have them on paper, all laws and regulations. The problem is how to regulate. One of my colleagues mentioned that we don't have a roadmap. A roadmap which show how to communicate to people to use this product in Kyrgyzstan. For example, Nasva is very popular among people in Kyrgyzstan. We know that many people use that, and nobody is doing anything. Doctors are aware that this is quite threatening. The age of users is actually becoming smaller and smaller, and children can find it's very cheap, 10 times cheaper compared to cigarettes, and children often buy that. It's the first time when I participate in such event, but I like the context because we discussed that yesterday, and using this in our topic, we cannot achieve good objectives through prohibition. We can prohibit, we can ban things, but unfortunately, we may have opposite effects. I'm talking about the alcohol ban, like in former Soviet Union, in United States, and it did work. To me, it is more important to develop good regulatory mechanism and implement it well, and to have mechanism which will, because as my colleague said, that the banning, complete banning, will lead to counterfeit project. Will be cheaper to do, to produce some fake things and sell it cheaper, twice cheaper, and obviously for users. Financial part is quite important because Kyrgyzstan is not quite a rich country. And when I say that Nasva, my brain's like 20% of budget, or like every third person engaged in a certain way in production of Nasva, it's quite a big number because many people go to Russia and send remittances. The government is not ready to lose that, because if they prohibit Nasva, they need to provide another work opportunity. And this is another challenge, and that's why they postpone each time to addressing this issue. And currently the rhetoric changed, and Ministry of Agriculture that regulates production of Nasva, they say that you need to regulate and control Nasva production. And this context The arguments are quite good and the rhetoric is quite good. Hopefully that we'll be able to finalize. Our country actually wants to do everything well, but it does not always work as well as we expect. But we hope the best, obviously. Responding to Katarzyna's question, and she mentioned partially her answer, what we need to do to reduce harm in vulnerable groups, in people with mental disorders, with drug users. We need evidence, we need data. We need to understand what is interesting and what are the incentives, which incentives can be effective in order to switch from smoking to vape, to pouch, or other HTP. We need to understand which barriers exist, including financial barriers. And exactly what I'm going to do. The next year we plan to assessment or survey using focus group and using quantitative studies to understand what helps people with opioid therapy to switch to vapes and what prevent them doing that, what contribute to already switched to that, what factors contributed to switching back to nicotine, to tobacco, in order to understand how to organize better the program stimulating this switch. Probably we need, it is better to think about how to incentivize this switch from tobacco to alternative use, like in European Union done with electric transportation or bicycles. No one is talking about that we need to prohibit to drive the car, but create some incentives to switch to bicycle. And this is done predominantly with some economic incentives and informing people how electric transportation impacting environment. Which I can talk about environment impact. How well this vape or pouch, how they can be decomposed, because those sticks that have combined like metal and plastic and some other nicotine, what will happen after individual disposal. For example, Naswa is not bad for environment, or using snus is not bad for environment. For vape, as far as vape, what's going on? How this vape is produced, how this, what environmental impact is provided. We can also discuss this thing. Remember, last year at this workshop, one of the important topics that we discuss is environmental issues and how to dispose, and representatives of the company, they propose some to stimulate recycling. What should be done in the other cases? In the most important thing is human resources. Human resources that will be dealing with this program. I would just like to share one example. In Kazakhstan, we have a big issue with sexual upbringing and education among teenagers. We have a lot of marriages without children. We have the problem is if, for example, people have first sexual intercourse in 19 or 18 years old, and they born a baby in a year, now they initiate sexual life in 14 years, and the first child can be born when at the age of 28. So it's quite a big difference, and people tend to develop chronic diseases. It includes abortions, and why we have this situation. The basis, but in order But we need to prevent this, and we need to prevent by providing sexual education from. You have a subject or discipline in school, biology, but they just introduced it not in the best way. They just dig a textbook and to give it to school. But we are Central Asia, and it is very important. Our elder generation always believed that it is not desirable to have a sexual relationship before marriage. This was just recently. Our grandmothers actually lived like that. We remember that now life changed significantly, but mentality of elder generation remains the same. And when this program was given to school, our teachers were very shy. They couldn't talk about sexual education and how teenagers can take that. They couldn't take that well. When we come and deliver lectures, when we deliver the lectures among first-year students, they listen very carefully because they learn many important things. And the teachers ask us, can you do lectures? Because we have shortage of information. We don't have enough well-trained personnel. We can say what we can elaborate textbook, but we can give it to school, but teachers cannot communicate that. And therefore, training of human resources is very important. If a person can communicate well the information, obviously, and they can attract attention of any audience, in particular, focusing on children and adolescents, and take into account specific features of the region, Central Asian, we need to take into account our mentality and our cultural features. We shouldn't just copy the program for European countries or developed countries and apply that in our country, because this will not be accepted in our country, but we should not leave it as it is. We should do something. And combating bad habits, including nicotine, should be done in a wise way by well-trained people. Thank you very much. I know that we're finalizing. Let's come back to people that use drugs. What we're going to do among this group of people. I agree with Kasia, I agree with colleagues. We don't have enough data. We need to collect them. We need to do monitoring and evaluation. And to assess how well this harm reduction program use. Because women taking care better than men, and I believe this will be wise if we start doing this. Thank you very much for
Thank you very much.
And
thank you very much for your participation. Now we are going to break for lunch.
But
I would like to thank the interpreters. Thank you very much for your interpretation. You are all invited for lunch now.
Hello and welcome to this live commentary broadcast from the Global Forum on Nicotine right here in Warsaw. I'm Will Godfrey of Filter, and I'm delighted to be joined today by two of the most prominent and resolute advocates in the tobacco harm reduction field. We're going to be discussing some early thoughts from the conference and then probably engaging in something of a race to the bottom when we talk about policies in their respective countries. Next to me, we have Fiona Patten. We like her even though she has a background as a politician, having served as a member of the Victorian Parliament for 8 years. But more broadly, she has a decades-long background in civil liberties, including sex worker rights and decriminalisation. She was instrumental in some of the progress that Australia has made in implementing safe consumption sites for people who use drugs, and much one of her causes. I'm also delighted to be joined by Samrat Chaudhry. Samrat has a background as written for many publications, including, I'm lucky enough to say, my own. But for years now, Samrat has been at the very center of tobacco harm reduction advocacy in India, a country where those efforts require unusual dedication and no little courage.
Thank you.
So we'll start with you, if I may, Fiona.
Yes.
Now, this is officially the first day of the conference, but actually things were underway long before now, and I know that you hosted a consumers meeting yesterday, so I just thought I'd start by asking kind of what the mood was that you experienced there and some of the points that were up early on.
Yeah, thanks, Will. We had a consumer forum yesterday, and we got an update from the various regions around the world. So from North America, Central America, or Latin America, Europe, and Asia Pacific. And I'd have to say that there was actually some optimism, which, yes, obviously not from Australia, but there was optimism starting to see governments moving towards regulation of tobacco harm reduction products and in particular vaping products, which was really encouraging. It was one of the interesting comments that was made was that some of those countries have recently introduced legislation around taxation. But they haven't
went to the World Health Organization's.
Oh, you were one of the good cops, were you?
Well, in theory, yes, and it was very prominent. The kind of the anti-vaping rules there. There were signs everywhere, and midway through our event, we had notification that Panama's investigative journalists were looking into reports of vaping going on in hotels, which was definitely not happening at our event. And Indonesia too. I mean, I noticed some of the data that Professor Fahl presented in his keynote this morning, showing that it's a country with a very high smoking rate and with a significant proportion of the world's people who smoke, and I'd made a mental note of that because it's not a country I've heard very much about in sort of conversations and coverage, and so perhaps
it's a very quick developing country, isn't it? It's growing economically very swiftly, so the cost of illness will be. They'll be starting to take notice of that as they have a rising middle class in that country, but yes, I mean, it's interesting seeing these countries that certainly around Australia that are taking a different approach and using taxation and seeing the optimism of consumers hearing that taxation actually gave them some surety that the product would remain legal.
Yes, that's an interesting way of looking at it. We've heard a lot about the kind of the conflict of interest already of governments that make an awful lot of money from tobacco sales.
That's right. And yesterday we also had a session on taxation and looked at the sort of the absolute immorality of some of our very high taxes on tobacco products that ultimately impact those that are least able to afford it.
Yes, indeed. Thank you. And Samrat, I know that you've arrived a little bit more recently, but I also know you're going to be involved in plenty this week. Would you give us a look ahead to some of the issues that you're going to be discussing and some of the things that you'll be looking out for?
Well, you know, I mean, India is the poster boy of prohibition, right? So, you know, there isn't...
we are going to fight over that title.
We are competing for that. So, well, you know, things are things could be better. I think they could be, we could, so there is prohibition, but there's also some room, at least in the smokeless tobacco, in the nicotine pouches or snus space, smokeless tobacco is actually India's, the biggest problem in India because there are 200 million users, which is, twice as many smokers, and there are no laws against banning nicotine pouches yet.
Yes, and to be clear, when you say smokeless tobacco, you're not talking about sort of really very safe products such as snus, but you're talking about a really wide variety of different forms.
So this is like deadly toxic SLT, which causes about 350,000 deaths every year. So there is huge room for improvement in, for harm reduction in that space. Also because these products are used by the poorest of the poor, right? Because they're very cheap. So and risk reduction for that population can be really beneficial.
Yeah.
So there is some movement on that front. There is a new government. I mean, it's the same government, but a new dispensation. We have a new health minister. So there is some reason for hope. Let's see, how things progress in the next month or so. We'll have some inclination.
Yes, yes. We'll return to that optimism in a moment, but I also wanted to bring up something really negative that you actually wrote for my publication about recently, which is just sort of the atmosphere of censorship and some of the actions that are taken that are clamping down on even discussion or criticism of the ban that exists. Could you tell us about that?
I think globally there has been, press freedoms are falling everywhere, and in some places they're falling faster than others, and especially in developing countries, especially with authoritarian governments. So the India's rank on the Press Freedom Index fell like really sharply over the last 10 years. So there is that. And then there is also the government, in the name of public good, thinking that it's morally correct somehow not to discuss risk reduction products because it's in violation of the vape ban. So a lot of publications could have stood up against it, but it doesn't to them sound like a big issue, So there we are, and then, but there's also social media. So, like in these elections, what we saw was that a lot of people moved away from mainstream media, and social media just really shone through. There are a lot of independent journalism.
Yes.
So there are ways to get around that. So there is censorship. It is quite disheartening, but there are options.
It's interesting that you say that because in Australia, we're also experiencing this censorship around tobacco harm reduction.
Is that right?
And it's quite insidious, and it's something I actually haven't spoken about. But whenever you try and place an editorial piece on tobacco harm reduction, or whenever you try and speak to a journalist around tobacco harm reduction, and we've had academics and experts coming into Australia to speak to our politicians, we cannot get media interest in it. The media will not report. In fact, we tried to, even at our press club, have a conversation around tobacco harm reduction, and even the press club said no. So it's something we haven't spoken about in Australia a lot, but it is it's becoming really difficult to have those conversations, to have a conversation if you are speaking about tobacco harm reduction.
Really?
If you're speaking about prohibition, well, you'll get the front page.
Yes, yes.
Also, I think if I may just, add one point and why that problem is. Because, people talking in favor of prohibition are all big doctors, very well known, they're government officials. So there is an imbalance, and the people who are talking in favor either are scared to talk about it publicly or they are advocates, consumer advocates who do not have that kind of, so for journalists, they also find it difficult to balance, and that could be one of the reasons why there is so little coverage.
I don't think we've had a positive story on tobacco harm reduction that I can remember.
Yes.
I don't think we've even had anything that would even be what I would say balanced.
And to sort of recap some of the negatives at the moment, I mean, you term it prohibition. I know advocates like Dr. Colin Mendelsohn do as well. I mean, it's theoretically legally available, isn't it? But in practice, not so much. What's the extent to which it's inaccessible, and what are some of the impacts that you've already been seeing from this effective prohibition?
I mean, prohibition just creates a an opportunity for criminals.
Yeah.
And that's exactly what has happened in Australia. And so, you know, yes, you're right. I mean, technically, if you have a prescription, you can have access to nicotine products, and you can access vapes through a pharmacy. The same could be said for prohibition in the 1920s of alcohol. Yeah. I mean, it's famous that Winston Churchill, when he travelled to America, got a prescription for alcohol so he could carry his scotch with him. So yes, so it is prohibition. But I mean, just today I had a message from a friend who is desperately looking to get a vape, and she had always used a dual pod device, and she now can't. And it's impossible for her to get anything. I think there's 2 products available legally. One is a Philip Morris product, and the other is a product that was introduced by a former health minister. So it's, I would say, corrupt.
And if you jump through the hoops and you find a GP who will actually prescribe nicotine, and you go to the pharmacy, then it's extremely expensive on top of that, isn't it? Extremely expensive. And for example, if you lose the device, you've got a pod device and you lose the device, you have to get another prescription to get another device. And it's not covered by our health insurance or our national program. So it's an $80 to see the doctor, and then around another $80 to purchase the product. So when we know that the people who would most benefit from this are the poorest of our nation, the underemployed, and those on the lowest lowest the idea of spending $80 to see a doctor, and then the idea of spending $80 at a pharmacy is beyond the reach of many, and you know, illicit tobacco or an illegal vape product, they can still purchase. And as with India, this has all been done in the name of preventing youth use. Has it seen any sort of success on
no, and really quite the opposite.
Yes.
You know, when you know, really, for a young person to buy a packet of cigarettes a couple of years ago, it would have been quite difficult. There was hefty fines for any retailer that supplied a young person with a tobacco product. Of course, now, when the products are all illegal, there is absolutely no regulation of that. So we're seeing young people saying that it's extremely easy to purchase vaping products either online or at convenience stores, convenience stores, supermarkets, anywhere.
Yes, yes. And Dr. Mendelsohn recently noted that in some age categories, youth smoking has actually risen, which I suppose is, you know, if you present vaping as bad for you as smoking, then people think, well, what's the difference?
And some of the products that they were accessing were, you know, they were very unregulated products. They had very high levels of nicotine in them. Yeah. And so you've got young people who have not smoked accessing incredibly high levels of nicotine in a very sugary flavour. And we were seeing experiences of nicotine dependency, and some of them were actually moving to cigarettes to reduce their dependency on their vapes. I mean, it's created these completely perverse outcomes, and you know, most of the youth vaping is experimental. There's, you know, most people they will try it and then move away, but yeah, some of those perverse outcomes we are seeing people being moving to cigarettes.
Yeah. To turn to a more optimistic note, Samrat, beforehand you were telling me about some media-related action that you and your colleagues are planning around publications that timed for World No Tobacco Day, which passed recently. Are you able to sort of share some of that publicly?
Yeah, see, so one, there is this huge imbalance, right? So this World No Tobacco Day, in a country where 1.35 million people die every year from tobacco use, there was a flurry of articles talking about why vaping is a problem. You know? So if you weren't from India and if you were just tracking news, you would think that India's problem is vaping. which it is not, and not a single Indian has died from vaping, right? So this entire shifting of media narrative towards, and a lot, the same litany of lies, popcorn lung, and, I mean, we've heard those before, right?
Yes.
And they have been rebutted, and they just still keep surviving, and we don't know how. So what we have decided to do is take each of them and publish a detailed rebuttal of each, so that the media knows, the people quoted in those articles who are doctors, they know. So, I mean, it's one way of fighting back. It's one way of responding against this narrative in the ways that we, who don't have those kind of resources, can do, and social media is, is a leveler in that sense.
Yes, yes. And so sticking with the optimism, at Filter we were lucky enough to be able to send our ace tobacco harm reduction reporter, Kiran Sidhu, on a reporting trip to India recently. And I know that she was supported by a KAC tobacco harm reduction scholarship, I should say. I know that you were instrumental in many of the contacts that she made in Mumbai. Thank you for that.
My pleasure.
But what she gleaned from some of your fellow advocates was a degree of medium-term optimism centered around some of the financial incentives that could be created. Since then, of course, we've also had the national election in India with a much reduced majority for the incumbent. I'm interested in any implications of that. How would you assess the kind of prospects for medium-term optimism on those bases?
Well, see, for one, the ban didn't work, and like Fiona was saying, it actually made the problem worse. Earlier, there were mods and pods available. The vendors, they wanted to, play right, and then there was self-moderation. They were sharing information and not selling to minors. But now it's a black market, and these are cheap, disposable products with high nicotine levels, with no consumer protections. Also, because you don't know what you're buying, and by the time a smuggled good lands from China or wherever in the hands of the end user, it's a year and a half old. So so we don't know what's in them. So I think what's happening also is that the government and the tobacco companies, the local ones, are realizing that if everyone is using them anyway, we might as well, then regulate it, earn some revenue from it. So there is some indication of that happening. So that's where the optimism coming from. We aren't sure, this could go either way. Recently CTFK's funding was restricted because they were pumping it. I mean, they're the main
campaign
driver
for tobacco-free kids.
Campaign for tobacco-free kids. So they're the main driver of anti-vaping propaganda. They are the ones who are funding, and with the Bloomberg Philanthropies granting $420 million to be spent in LMICs, a major portion of which was coming into India through CTFK.
Yes.
So that funding being restricted also is an indicator that things might be changing.
Yes.
In the end, it could just well be that they want to make revenue from these products, which people are using anyway.
Yes.
Yes. Yes. And then sort of switching that to Australia, how do stances on tobacco harm reduction play out along the lines of party politics? I mean, would a change of government potentially see a change of direction, or is there some degree
Look,
of
it was the
consensus?
previous government, the previous sort of Conservative government that introduced the initial bans and really started the ball down this prescription-only model. So I don't hold much hope out for them. However, we've got some legislation coming up in the next few weeks that's to further prohibit the importation of vapes. I mean, it's effectively a ban on a ban, so it's fairly ineffective. However, there is much disquiet and concern about this legislation coming from both ends of politics. So our Conservative party called the Nationals, they won't support the legislation. And then probably our more left-wing and more progressive groups, the Greens, are also expressing concern about this legislation. So the legislation is very uncertain to get through the Senate, where the government doesn't have the numbers. And this does open up an opportunity. Again, it's very hard for a government to do a U-turn on a policy. However, if we can get them to relax.
Caveats, to build in some.
To relax in some ways, we may start to see a slightly better conversation occurring. But unfortunately, I don't I don't think we're going to follow the UK or even our brothers in New Zealand.
Well, speaking of New Zealand, I mean, when you look across, this is a comparison often made, and I know that there have been some New Zealand events held already here, related events, I should say. And I mean, how would you assess that comparison, and are the contrasts?
New Zealand and
obvious?
Australia are extremely competitive.
Yes.
There is a significant rivalry there. We beat them in football sometimes. We beat them in cricket very often. But here in tobacco harm reduction, they are miles ahead of us. And we bring out New Zealand doctors, we bring out people from Quit in New Zealand to speak to our politicians about the success of their program, the success of their model, and it seems to just fall on deaf ears, generally speaking. I think New Zealand's got some of its own issues, and certainly the notion of putting the tobacco ban in place.
I was going to say that's something that somewhat divides tobacco harm reduction advocates, in my experience.
Yes.
I would assume that you would oppose, as a civil libertarian, you would oppose that.
I do oppose it, and I think any form of criminalisation is not the answer.
Yes. Maria Wood-Glover has written for us about how it will disproportionately fall on Maori population.
Of course it will.
Yeah.
Of course it will. And, we see, any form of prohibition and any form of regulation or prohibition like that generally falls on our most disadvantaged people in our community, whether that's our drug policies or our smoking policies or whatever else it might be. I understand that the new government in New Zealand is less enthusiastic about this ban, so they may see some rationalisation and they may actually see some improvement on it. Of course, there are the flavour bans that are gaining popularity in other jurisdictions.
Yes.
They're certainly being raised in New Zealand as well.
Thank you, guys. We could go on a lot longer, as you can tell, but I am getting a voice in my ear telling me it's time to wrap up. So we'll plunge back into the conference proper. Only remains for me to thank you for joining us, and thank you very much again to Fiona and Samrat.
Thanks,
Bye for now.
Will.
But we don't have mics.
But there is one.
Okay.
There's
one
there,
and
there's
two
here.
That's okay.
Very good. Hello, shaking. Hello. How's everyone doing? Sleepy after lunch? This is killing time, for speakers.
Test.
Right after lunch? Perfect. So just please, try not to fall asleep, and especially if you fall asleep, don't snore. You gotta wake somebody next to you. That's the opener.
Well, hello. Good afternoon. Rhetoric, regulation, and I would add representation to that. We're all aware of the nonsense that's being spewed out by the WHO at the moment. The most recent one being what's cute, attractive, smells good, and kills. And it's not a Pokemon. They say it's a vape. Now, I'm not sure if this is designed to troll people or rage bait them, or if it has a direct target intended before they ever hit send. Today, we're going to talk about what can work against this, and we have three excellent examples. All the way, I'll start on the far side, because you're the furthest away. Asha, Ignacio, and our first speaker who will tell us how successful Sweden have been. Carissa, have a mic.
Yes. Hello, everyone. My name is Carissa, and I am the director of Considerate Pouchers in Sweden. We're a global consumer advocacy group promoting mainly nicotine pouches, but also tobacco harm reduction, really. And Sweden is a great example of where tobacco harm reduction has worked. We have products like vapes, but we have our main product, I would say, which is snus. It's a tobacco pouch that you put under your lip, and you keep it in there, and it releases nicotine, and then you take it out. Since 2016, we've also had nicotine pouches. They were invented there, and they have contributed to decreasing the smoking rates, mainly among women. For the whole population, we now have 5.6% smokers, which is very, very low. Men have usually used snus and had the lowest smoking rates in Sweden for a long time, whilst women just dropped recently with the introduction of nicotine pouches. So Sweden is a bit of a wonder child, and the reason why we are this is because the Swedes have had snus for a very long time, almost 200 years. And when we entered into the European Union, we said, if we're going to join you, we need to keep our snus. And so we did, and we got an exemption from the EU ban on oral tobacco. And now we can see that Sweden, many years after, has the lowest smoking rates in the whole of the European Union. The rest of the European Union aren't even close. So consumers, Swedish consumers said, don't touch our snus. And that is the reason that Sweden has had snus for a very long time. And this is a consumer-driven movement. This is not some policy that the government wanted. It was not a conscious strategy, more or less. It happened more or less by chance. And you'd think that the Swedish government would be very proud of what we have achieved in Sweden. The truth is that they are not. Rather, they've been for a long time working against it, and they are not promoting it actively around the world. The first positive government towards tobacco harm reduction was last year. This was the first time they said, oh, tobacco harm reduction, that is something that we want to implement in our policy, which is a huge milestone for us. But it's really, really interesting. And the EU are not very positive towards nicotine pouches. Last year, a report was leaked when they are proposing to ban nicotine pouches. And what is very interesting is that the Swedish government, the ones that are positive, had the possibility to give feedback on this report and say, hey, we've done this in Sweden and this works well. Why do you want to ban it? But they have not. And this was reported in the media, and consumers became, of course, outraged. Because why haven't you done something? The EU is looking to ban our nicotine pouches. Why aren't you doing anything? And the same theme goes on internationally as well, globally. We had COP10 last year, and Sweden didn't want to take a stance. You'd think because Sweden is so much before all the other countries in the world, we would actually be there and say, hey, look at our model. We've done something. We're saving millions of lives. But they didn't want to say their stance. And the delegation representative said instead, we are going to have the same approach as the rest of the European Union. That is all I can say. And as we know, the European Union aren't very positive. And so why did the Swedish delegation think that this is a good idea? The EU delegation said in the opening ceremony that because of the growing market for novel tobacco and nicotine products, we have to increase our efforts to curb these products. we are way before everyone else. And this is really because consumers have not been putting enough pressure on our representatives to represent our policy internationally. And I think Sweden has a really huge and important role to play when it comes to this. We have a real life example. Well, the positive thing, though, is that after that this became a huge thing in Sweden, snus was a big part of the European Union election. And many of the parties took an active stance. And this is because consumers demanded this of them. What is interesting, though, is that a lot of other people, other representatives, says that this is a non-question. We don't have to care about snus because we have an exception. But what most Swedes don't know is that we don't have an exemption for nicotine pouches. We only have it for snus. But this, I think, explains a lot why Sweden is a bit passive, and also Swedish consumers are a bit passive. It's because we think that we are protected, but we are really not. So, politicians in Sweden do not realize that we are becoming smoke-free. And they are waking up after a lot of active campaigning from our sides. But we are still facing a lot of challenges and a lot of misinformation. One of these is the idea, one that we face a lot is we don't know about the health effects, but they probably aren't good for you. And the Swedish Public Health Agency states that using snus could affect the heart and blood vessels by reducing the vessel's ability to dilate and increasing blood pressure. People who use snus might have an increased risk of death in the weeks following a heart attack or stroke. These are guesses. They don't know this. And there is a lot of research that are stating the opposite. But they are quite well in the hands of the WHO. So they don't want to be really positive. But we have a lot of research on this in Sweden because we've had it for so long. And we are comparing something that we know will kill you and give you cancer with something that might have some side effects, but we don't know. I think that's very interesting. And this is coming from the Public Health Agency. So this is something that we are facing and struggling with, even in Sweden, which is one of the countries that are at the forefront of tobacco harm reduction. I think I have talked for a while, so maybe I put down the microphone now and then we continue the discussion later.
Thanks, Carissa. Yeah, it's interesting the influence that culture has in a situation like that. I mean, snus has been around for how long?
200 years.
Vaping's been around for almost 20. We might have a long way to go yet. I'll hand over now to Asha over there. And you have a mic, you're good.
I do.
And he'll tell us about the situation in Asia.
Well, it looks like I probably have to speak in the Asia-Pacific region in general. First, let me stress how different each country in Asia-Pacific. For example, I'm from Thailand, and we are right next to Malaysia. Malaysia had already lifted the ban. They have regulations, same as Indonesia. Congratulations to the Philippines that they just there are new laws, and plus you can see a big examples between Australia and New Zealand, which is like completely almost opposite each other. For Asian part, we are trying to the politics in Asia is kind of different from the Western, especially if you know history. Most of the countries in Asia had been occupied at some time or another by European countries like the British Empire, the Spanish, the Portuguese. They tried to conquer the world, but except Thailand, we were lucky. I don't say we were lucky. I said we were unlucky ones that not really smart, really. Smart, yes, but I wouldn't dare go to say like unlucky, lucky or unlucky. I would consider we are unlucky because there are a lot of things that we lack that other people around us, they have their advantages. But let's come back to the tobacco harm reduction point. I can say pretty much what's going on in Thailand is really weird. We just passed the 10th anniversary of vape ban in Thailand. It started like two months ago. We celebrate. So it's been 10 years. It's getting weird to the point that I have I've spoken before, saying like, what is really illegal in Thailand about electronic cigarette? You cannot import. So importation is definitely illegal. It's the intent or purpose of commercial use. So commercialized importation is illegal. You might ask, let us say, what about if one of you, or me, myself, I return from Europe, going back into Thailand, I carry something with me like this, would that be called importation? Well, that depends on which customs you meet. They might think of, it's personal belonging, no problem. Or like, if they're not in a good mood, they say like, this is importation, we're gonna have to confiscate it, especially if they know what we are carrying. They say like, there's a pricey one, there's a high-end one, So it depends, it's iffy. And, but for sure, importation plus distribution is definitely illegal. So that means you cannot sell. Buying is not illegal. Possession is not illegal. Using is not illegal. Vaping is not illegal because there's no law control over it. So in general sense, you can even vape in a no smoking zone. No punishment because there's no laws. And then when you say, like if you want to really fight it, you're going to be going like, well, it's been considered vaping is considered the same as smoking. No, it's not. It's definitely, we know it's not. But even the lawmakers and the police and the customs, they even acknowledge that vaping and smoking is not the same. So ECST, our organization in Cigarette Smoke Thailand, we have like about 100,000 plus members right now at the moment. And so what we are trying to do is we try to educate people and we try to talk with the government. There are lots of suggestions going around in these venues, this event GFN in many years. They like participation is the key. But you have to consider like for people like Thai people, they don't want to engage. Even they are the stakeholders. About 8 years ago, I tried to get a rally getting together because that was the beginning of the ban, and we tried to get together. And I would say, like, if we can have like 150 to 200 people show up at the parliament at one time, that would be it. The government would say, like, okay, it's wrong to put on the ban. We have many, and we try to. At that time, we say like we have at least half a million vapors, at least 500,000 vapors, which is a small number to the government, but still, like right now we probably have at least 1.5 million vapors. But at that time, people promised, about 120 people promised to show up. In the end, when the day comes, we have 8 people show up at the parliament. So the government was going like, well, yeah, you said there's a lot of vapors. Even the taxi motorcycle, they shows up in the hundreds of them. They want to change the law. That is so stupid, like for example, a helmet law. Government has to come back, which is for their safety. But this one, like no one just show up. So I'm going like, well, we're gonna keep on pushing, and I try to insert myself. And one of the problem I think lots of us are facing with, and I have asked quite a few times, like, how do we get the opposition party, the people that said vaping is either equally or more dangerous than smoking, to come and talk with us peacefully, have a debate, forum or something. Because every time, if there's a middle ground and like a big TV national station invite us and them, they were just like, no, we're not going to go because these people, pointing at us, right? These people are violent. We don't want to engage in violent conversation. We don't want to involve it with anything violent. Going like, me violent? I mean, like, if Ignacio maybe, but look at me. I am. But really, because we try, and a lot of people had been said like, we'll try to bring in more engagement. My question back to you is like, how? We tried. I have been attacked since the day I was elected committee of the parliament to study the laws on electronic cigarette. I have been attacked from day one, receiving fundings from the industry, tobacco industries, receiving funding from PMI, get in touch with BAT. I am the representative of tobacco industries. Whatever I go, wherever I go, whatever I do, everything just turned like, no, you got to kick this guy out. So they are also trying to use Article 5.3. We all know that, right? 5.3. We have been faced it. A lot of us had tried to get into COP. Last one is COP 10 that you just mentioned. Stakeholders are not allowed inside, which is really weird. And it's exactly the same thing that's going on. But finally, the government in Thailand is open up. They invite one of our members from ECST. So there are two of us representing vapers, 1.5 million at least vapers. We get to go in there. I get to be at the parliament every week, maybe once or twice or 3 times a week. And we get to explain to them. So it's a small step. And hopefully by the end of this year or end of next year, there will be some changes because now they know that it's a big mistake that they made. Because if you go to Thailand, there's vape shop everywhere. You can buy vape. Everybody vapes. I mean, and one of the problems that is kind of connected is like, how the hell did they lift the ban on marijuana and THC and CBD and cannabis? Everything is openly free. It's even worse than Amsterdam, really, in Thailand right now. But still, they have like tons of restriction on electronic cigarette. And the worst thing that will come is bribery. So that's, like the police will go like, oh, vaping is illegal, especially for foreigners. So, yeah. Were you one of them in jail? No? Yeah, so that's pretty much what's going on in Southeast Asia right now, especially in Thailand. If there's some question, yeah, I'll be glad to. Thanks.
Thanks, Asia. I will be coming back to all of the speakers with some questions later, but let's hear from the far south now in Chile and Ignacio.
Well, yes, I'm from Chile. First, I will tell you the history in Chile. Chile being a very long advocacy consumers story that have been like a roller coaster with highlights, with very low moments, and now we are in a very high moment. So we're very happy. And I will tell you what happened from the consumers in Chile and why we think that it could serve someone to try to do it, to see what it works for us. In 2010, I started with the advocacy. I have been 14 years working by now. We needed to face the possibility of a complete ban of electronic cigarettes in Chile. In that moment, and you will see in the history, we were totally shut down in our country. We were not knowing what was going on in any other place. At the same moment, Brazil was forced to ban the e-cigarettes. Argentina, Uruguay, and many other countries were in the same situation with very bad legislations or finally banned. Chile was the first one to try to ban e-cigarettes at that moment. And in that moment, I said, no way, they won't take my stuff. But I was literally alone. It was the only people that vapes that I know at that moment. And I was like crazy looking, I was standing out of the shops waiting people to come to ask them if they vape, to try to gather some people. We were able to gather a very, very small group. We were 4 persons, plus the only owner of a shop in Chile at that moment. And we created a campaign, something that today won't work, because in that time, social medias and YouTube and that kind of stuff didn't work like today. So we start a formal campaign in the normal medias, radio, TV. I'm a journalist, so I made a plan, and we were able at least to stop the ban in Chile. There was no regulation, but we stopped the ban, but they put on us decree that makes nicotine illegal if it was not sold in a pharmacy. So they put us in a gray market. So for the consumers, it's a very big problem to get nicotine in Chile, because you need to go into the gray market, because we have formal shops that you said, I want e-liquid with no nicotine. There it is. You know what I mean. So the market was evolving all this time, but I understood immediately that this will came back. So what we can do to prevent in the future the next hit that they will make. So I decided to start a community of electronic users via Facebook. At that time, we didn't know much about electronic cigarettes. We didn't even know what the liquids were made of. We didn't know barely nothing. But we start learning by ourselves and gathering people. And that community started growing. And the main objective of that community was inform the users. The users need to know what they are doing, what are the good things, what are the bad things, if they are. And we need to start this way. And we were working for very long, only expecting that day that we will need these people. In 2018, at that moment, we were 7,000 people on the community, very active community with posts like every hours, and the people was really, really passionate on vaping. Came the second strike from the government, and they announced that they will try to ban e-cigarettes again. Sorry. Not helping. It's not helping. I was not alone. That moment, I was not alone now. Oh, gosh. Wait a second. Yeah, good idea. I was not alone, so now we were 6,000 persons ready to fight against them, against Bloomberg, against everyone. At that moment, and you will see in the history, we didn't know about Bloomberg. We didn't know about harm reduction. We didn't know nothing. We were just people that vape and want to save their option of feeling better. We were not even using the right terminology or anything. And in 2018, we went out, we started fighting in the medias everywhere. We were able to stop the possibility of banning, but they went with a very strict law, a project of law to the parliament against vaping. And in that moment, we decided to go to the street. And we made the first public massive manifestation in front of the Minister of Health. And it went very well. We have a very nice moment and so on. And one day after, I received an email from Spain, from someone called Ángeles Montadas. And I was like, why they are talking to me? Who is these people? And the email said, oh, we saw that you exist or something like that, but it was like, we just realized that there is an advocacy in Chile, and the massive manifestation was on 30th of May. And she said, we want to invite you in 14 days more to come to Warsaw to GFN. What? Well, you know what? I'm very grateful that you're inviting me, but all the money that I got I use it here. I can't use my money to fly while we are in the fight. And she said, no, you're not getting it. We're inviting you. To what? And then I start looking, and there was a global forum of nicotine, and there was crazy people like me everywhere. Everywhere. Some of you, the old ones, might remember me. You're not helping me. She started crying first. This time, might remind me. Oh, I came here and it was a new world. A lot of people like me, I was crazy. I was looking to everyone, wanting to talk to everyone. And you teach me harm reduction. You teach me that I was not only not alone in my country. We were fighting for the same. GFN, it's something that changed directly the process in Chile. Everyone said, GFN changed your life. Yet GFN changed my country, changed our advocacy. They teach us how to go through, to professionalize the activism. We were just a mass of people trying to fight. We learned about harm reduction. We understood what we were fighting for. We were fighting for something that we knew that was something, but we didn't know how to express it. And then we start immediately, we come back to Chile, and we start the campaign, Vaping, It's Not Smoking. And again, we start informing, but now not only our people, we start informing the rest of the people, the massive people. But we understood that that can't be done if it's not in a professional way. And I'm not telling it in terms of money. I'm telling it in terms of quality. Make your publications to look as if they were professional. Find someone that is able to do good work. Do a campaign that will be multi-platforms, and don't stop. It needs to be done religiously. There is not a single week that we don't have at least 4 posts. And if we have problems, in that times we post 4 times a day what is going on in Chile. At the same time, what else we can do? And we did everything. When I told you everything, it's everything. We went out to the streets to put posters, putting stickers in the bus stops. We make one of our vaping members to run the marathon and cross the marathon of Santiago vaping with the cloud. Come on, do it, smoking. Vape while you run and cross the line, throwing the cloud. So that became a video that could go in our medias, and videos that were going viral and telling the people, vaping, it's not smoking. Vaping, it's not smoking. And we didn't stop. We tried a lot of crazy stuff. We even thought once to put drones over the capital to throw paper saying vaping, it's not smoking. Was too expensive, but was a good idea. But this was starting to change the mindset of the Chileans. It was not that easy now to say that it's the same. But also we start changing the mindset of the politicians, because we were able to show them that they will affect a lot of people. So in some moment at the beginning, when you start trying to talk with them, as the problem that all of you had, they didn't want to speak with us. Used the Convenio Marco and said, no, we can't speak with you. And what we did, we called our community and said, send emails from today and on, non-stop, to all the members of the commission. They start sending like hell, and in some moment they said, okay, you will come to the Commission of Health, you have 10 minutes, by clock. Okay, I went there. They didn't pay any attention on me. It was a total failure. And when it ended, I realized what we were playing. In that moment, one of the most important senators of Chile told me in the session of the Commission of Health, public, streamed even, that we, the people that are fighting for vaporizing, were the new pedophiles of this century. and they blocked my microphone. I couldn't answer. But that's how bad was the situation through politicians. But we start talking with a lot of other politicians, and some little windows were going to be open. And that process goes after the senator to the Chamber of Deputies. They opened the window to let us enter by the door to the Senate, to the Deputies Chamber. And they wanted to listen. So there, we win. We win. We were able to change up and said, delete this project and make a new one. And this one, even if it's not perfect, it's a way long more friendly to vaping, understanding what vaping, it's not smoking. We were able always focus vaping, it's not smoking. And finally, after 5 years from 2019 until 24, with a lot of commissions of health in both chambers, with a lot of massive elections and stuff, we were able to promote a law in favor of vaping, voted 7 times in the legislative committees by unanimity. All the politicians in Chile, every single politician in Chile, vote in favor for the law, because we finally make them understood that vaping, it's not smoking. I'm super happy at this moment, but we know, as I knew in 2010 that the fight was not ended, I still know that there is a way long to go through. The law was edicted on January of this year. We're waiting for the reglement of the ministry that it's supposed to come on July. We hope that we won't face any surprise on that, but if everything goes as planned, the people in Chile will vape in July. So that's how something so little can make a change. A lot of times I look at the advocacy saying, but it's so difficult. What we can do against all this money? We had a lot of problems. In some moments, that's something. In one moment, we were one election to lose absolutely everything. They were going to vote the first project that was with no flavors. It was a total restrictional, it was so restrictive law that it will be impossible to develop the category in Chile. And they were going to vote, and one of our deputies stopped the election, was able to move it for the next session. We have only 1 weekend, and we knew that we will lose absolutely everything. We called the community, and we did 3 things. One I don't remember. I hope Mauro will remember, because now 2 of them came to my mind. We made a tweet bomb during that weekend. We keep vaping, it's not smoking for the whole weekend at the first hashtag on X. What made the deputies to see it, and they were open to talk with us. And on Monday we had 3 sessions that switched 3 voters. But the most important stuff is that we create electronic platform where each user could enter some data of his experience, and they could send immediately a personalized email telling their experience at vapor and of vaping to each single deputy of the Commission of Health. And also we asked them to do this. That weekend, the deputies of the chamber received more than 9,000 mails from the users from Chile. When the session started, one of the deputies against us said that this could not be something that they should approve, because we hacked his email and put it down, because he got so much email that the server stopped working on his stuff. So we was pissed because we hacked him. And it was just because so much people sent them emails that it was impossible not to see it. So the election couldn't be done. And they said, wait, we need to continue this talk. That was not me. That was the people. You can't do something from advocacy, but they need to be part of it. I know it's hard. I know that it's hard to connect with them. Today, even worse, after pandemic, people got a little far from this stuff and don't understand how important they are. The good thing is to make them understand, to make them feel that this cause, it's not only to keep vaping. It's what it's the most important thing. It's to save lives, not from us, from the ones that are still smoking. And that's it. I hope you cried.
Thanks, Ignacio. I was going to accuse the WHO of raising the emotional temperature with their tweeting, but it would appear it is an emotional subject. Couple of questions. Where's the opposition coming from? Not so much in who, but what place? What is driving it? Is it fear of change? Is it moral opposition to nicotine? In a country like Sweden, where it's so well embedded, where's your opposition coming
from? Unfortunately, I think the boring answer to this one is that it's just the people who used to fight cigarettes now has switched to fighting nicotine because they can't differ between the two. And that is where so much of the resistance is founded. It's like, oh, but since cigarettes are bad and there's nicotine in cigarettes, then also nicotine itself has to be bad. And that one goes strong. And also the fact that it's an addictive substance, but we use a lot of other addictive substances, such as coffee and alcohol. But it's that word, it's very loaded, really.
And loaded seems to be the way the debate is moving. The rhetoric is being ramped up on every round. I'm going to ask Aisha, where's your opposition coming from?
Mainly from the tobacco control people, really. And like Carissa said, I think personally, I have to say this personally, I think they are fighting a battle that they know they're not going to win. They had been fighting this battle for a very, very long time, and they think they have control of the tobacco industry. But I think deep down inside, I get to talk to some of them, and they say like it's an uphill battle, and they're not going to be able to win. And back when COP was held in India, it was COP 6 or 7, someone has a bright idea of saying like, hey, there's a new tobacco product. It's called electronic cigarette. So it's a kind of cigarette, and it just, like we're something very modern, very new, very nouveau. Let's nip let's nip it at the bud. And it said, so let's destroy vape industry completely before it could get itself started, without knowing that Public Health England had already backed up vaping as a method of smoking cessation. And so, so that's a kind of mindset that we got, especially from Southeast Asia countries. Some better, some worse. India is even ridiculous, even more ridiculous than we could think of. Like I just talked to some Indian people. I don't think this is in here. And so it's really, I think it's like the main opposition is tobacco control people. And we even got like this morning, I just got this quote from someone like head of the tobacco control people saying like, well, one thing, if we're going to regulate electronic cigarette, regulate vaping, one thing we must ban is Nic Zero liquid. I'm going like, say what? Because, Nic Zero contains uncertain amount of nicotine. I'm going like, what? Like, what's the concept of nicotine zero means no nicotine. If there's some kind of nicotine inside, whether it's a salt nic, is a free base or synthetic nicotine, then you control it. But nic zero is just like 0% beer, alcohol. They want to tax it same as beer, same as alcohol. But it's non-alcoholic drink. It's this exact same mindset. You know, and a friend of mine just reported me last night. He said like he's being fined for posting. He was holding a bottle of alcohol, a local made brew in Thailand. And he's got this official letters from the government say he has to go in report to the judge, go to court, just for posting on social media, on I don't know, TikTok or X or something like that. So that's a kind of mindset. And he asked me like, oh, who would have done this? I said like, well, definitely same people, the people that say that they care about public health. Those are the same people that come up with all these ridiculous ideas. So these are the tobacco control people that they are probably up to their, I don't know, it's an uphill battle, and they get into a street without end, and then they just found themselves stuck by the wall. So they turn around, they say like, oh, electronic cigarettes.
Yeah.
Unfortunately, they met us. Like,
yeah. South America, the main opposition. Are we all fighting the same dragon? Does anybody think?
I was going to put it in another way. I think that we fought two groups of people. A group of mercenaries with a lot of money. And we fought a group of ignorant people and lazy people that listen these mercenaries, and that goes in all the scales. Politicians, you got some politicians that receive funding from Bloomberg. And when I said Bloomberg, I want to make it clear. When we say Bloomberg, Bloomberg is the biggest one. Bloomberg is the guy. But there are other Bloombergitos everywhere. There are little Bloombergs in other parts that also put their little amount of budget, that we sometimes look Bloomberg as the only person. There are many Bloombergs. But Bloomberg, most of us know, he have put against tobacco, now vaping, $1.5 billion against us. That's the amount of money we're fighting. And that one, it's held by a group of very big mercenaries, politicians, doctors, and advocates that receive this amount of money. But there is a bigger group of people that hear what these mercenaries said. They don't read absolutely nothing more than the title and go fighting like if it were fighting like me. But I read a lot. But I think that's the thing, and we fight too. Politicians, medias, advocacies of tobacco control, and the tobacco control itself, that I will say that are the most dirty mercenaries and a bunch of liars with no morality at all. That's what we fight today.
Carissa, you want it?
Yes, I think on the grand scale, we are all fighting more or less the same misconceptions. But when I hear a lot of people here speak about the situation in different countries, we are on very different level of what arguments are relevant to the context. In some countries, it is this is a way for people to transition from smoking, and that's about it. We can continue it from there. But in Sweden, we have a whole new generation who never smoked in the first place. They never picked up a cigarette. They picked up nicotine pouches instead. And that is another battle. And that argument doesn't work in our context anymore. It works as that they didn't start smoking, yes. But when we in Sweden are looking at how to improve our advocacy, where do we go from here? We are really looking at things like the health part of it. Does nicotine cause cancer? No. That's the message we need to get out there because it's not clear. And
yeah, I wonder, is there a huge protecting the future of our precious children, or are they fighting irrelevancy, tobacco control?
yeah, this is something I spend a lot of time thinking about because it's my generation who picked up these things. And I think we have the answer to the youth question in the answer of, is nicotine a dangerous substance? Because if we find more dangerous than, say, caffeine, that is the case we should make. But in a lot of countries, this is a much harder argument to start with if everybody's super concerned with youth vaping, for example. Maybe that's not a place to start, but in some countries, that's where we're at, and that's the fight we have to begin having.
You go. The one thing I'm hearing from everybody here is that the most important player is the ones that aren't talking at the moment. The consumers themselves, in large numbers, are more important than all of us advocates. How do we motivate them?
I think it's hard. It's very, very hard, and each time harder. Una batalla por agotamiento. Anyone? A long-term battle that make the soldiers get tired of the battle. And it's so full of up and downs that it's like the story of Pedrito and the wolf. The wolf is coming. So the first time, all the advocates were like, ah! The second time, ah! The third time, eh! And now it's like, please come! Yeah, it's a thing. But I think it's not abusing on the users. And when I said don't abuse on the user, is to see them as a resource that it's not endless. They will get tired. So if we don't, this might sound bad, but don't take it in the wrong way. If we don't need them, we don't call them. If it's not a matter of life and death for vaping, we won't ask them to make a tweet bomb just because it's the vaping day. We don't do it. In Chile, we don't. We don't go on tweet bombs on vaping day because we know that the tweet bomb, it's when the senators want to forbid it. We need to save those bullets. So knowing that this so important resource, it's not endless, you need to dosify it in the way that you will be able to go through. And to dosify that, you need to work double. Because in those periods when you're not calling your people to fight, you need to look strong anyway. So that's the time where you need your team, your direct team, to be posting every day, to be working harder, to doing as much as you can. So the image of the users, it's constantly there. We're a lot. We're a lot. You are affecting us. Vaping, it's not smoking. And when the warning or the moment of battle come, then you bring the horde.
Don't blow the bugle. Okay, we're going to get some questions.
Can I
if anybody has any down there?
Can I just add just a wee bit more?
Sorry.
Some of us may feel like we are doing this by ourselves, by myself. We're doing it all alone, and about 10, 12 years ago, I started doing that, especially over 10 years ago that there was a ban. And like I just told you, like I expect 150, 200 people and only 8 show up, and mainly are the people within the border of ECST, ourselves, plus 2 more people that I don't know, But, don't give up. Because like I've always say, like, you know, I've always said to a lot of people, especially to our, we have live casts every Saturday and Sunday, but now we only do it on Saturday. And the purpose of our live cast is just, it's an open room, you know, like whoever got questions, you know, how to build, which atomizer would go with mods, and how to build this, how to do that, which brand is good, which brand is bad, liquid, flavor, everything, and everything in between. Plus, lots of problems like, how's the laws going these days? So we answer that. The live session is about an hour-ish, hour to hour and a half, and at least 3 times within the same session, the people like, is position illegal? So we have to just keep on educating people, keep on saying that, and more and more. And by within this past few, like a year or so, or past 2 years, especially during the pandemic, the COVID, people get to stay at home. Who they stay with? Their phone, their tablet, their computer, right? And right now, we don't have to go out, and when misinformation comes out, we don't have to go out and say, like, hey, it's wrong. No, it's from the people. I was surprised, you know, this past 2 years. I was going to go and say, like, oh, wait, who's this? Somebody else just come like, no, where you get the information from? No, vaping is not is not more dangerous. And like, you know, there are cases of this young 14-year-old girl, like, no, she had like badly injured lung, and there were tons of people saying, like, what did the doctor say? Is really vaping the symptom? What about the back history? This girl had got asthma. What's her lung injury? She's got any allergy? Has she been smoking, or did she use any THC? All these are coming. I was surprised, and I was like, wow, all the past 10 years, it worked out, you know, like it started from us, from 1 people, 2 people, 3 people, and it will spread, you know, believe me, it will.
Okay, open to the floor now, if anybody has questions for anyone on the panel. Harry. Shout.
We do it by there's a national survey. If we go by national surveys, right, per household, we would end up with almost 10 million, but we don't trust the national surveys. So we look at the numbers of expenditures, spendings per person, and we look at almost everything. Plus, about 3 years ago, we have a Facebook that, before it was shut down, has 480,000 members. So we figure like about 30% of vapers belong to that community, belong to that one single Facebook group. And there's a lot of calculation statistics that I'm not, you know, like deep into that, but we have figured out, and there's a very famous professor. He was the one who did all the calculation, and he said like 1 to a million to a million, at least 1 million to 1.5 million. Yep, yes. Yes, the tobacco control people, they work with the national statistic, the Department of National Statistics, yes. 70 to 80,000, yes. In 95% of a household.
policymakers when they read about youth and measure against the access of the youth, the tendency is to read anymore of the West and to judge in a proper way, and they pass the bill just because it's about youth protection. How it is in your countries about
Yeah,
it?
it's exactly the same though, because like I think that we probably knows it comes from.
You need to use it because of the streaming.
Yeah, okay. I think we all know that it comes from WHO, FCTC, and like I said, like they are fighting against the unwinnable battle, and right now, especially in Asian countries and in Thailand, they use the youth as their last resort because like they say like, oh, protect the youth, which actually, if you don't have any kind of regulation, it's going to be very difficult to deal with youth because look at the distributors or the merchants' perspective. If there's a regulation, then you know that if you sell to minors or to youth, then you will lose your license. In countries like Thailand, that's distribution is illegal. Whether you sell it to 8 years old, 10 years old, 12 years old, 50 years old, 60 years old, the results are the same. So you would be business minded, going like, so what? I'm going to sell it to you since it brings me money. So we need regulations. We need some kind of regulations to prevent youth. And especially we need correct information of how harmful each level of smoking or whatever you bring into yourself. Sugar, Carissa, you just missed sugar. That's one addiction that is very dangerous. So yeah, youth is a big issue because right now they know that they cannot fight. Right now, even representative of WHO, FCTC had admitted that yes, vaping is safer than smoking. So right now, that's the only point they go like, oh, so we got to protect the youth.
I want to say something about that, and I think it could help in some way. I understand where your question mark is going to. It's anyone in this room that supports or want to promote vaping on kids? No. I'm totally against of kids vaping. And why I'm making this question that might sound stupid, that's our fight too. And they took it from us. So what we did in Chile is that one of the main messages that we have in our campaign, in the regulation process, everything is we fight for protecting the kids. And we fight a lot more than them. And we expose them. We expose them because we went into the parliament asking for higher sanctions of those ones who will sell or promote vaping on kids. So the topic will continue being a thing, but it's not their thing. It's our thing. It's something that they can't use against you. Because what are you talking about? We are totally against it. We were smokers. So that's the way, at least for us, it works. And I will just take a second to go back to something that I said that I didn't, and I will feel bad if I don't. The first thing is that in my process, as I found these mercenaries in politicians, doctors, etc., I found a lot of good politicians, real politicians that comes to you and help you. And I didn't need to bribe them or pay them or nothing, and they took the cause as them. We have politicians now that are pro-vaping, and when I talk to them, they are so passionate as me. So also that thing of looking at the politicians as very bad people, it's a mistake too, because you will find good ones. And the other thing that I wanted to say, and it will take me just a second, it's that I'm very proud for what we did in Chile, but I'm more proud of Latin America. In 2019, when I was invited to GFN, we were 4 LATAMs here, and it was our first time. There was only 2 associations of consumers in whole LATAM at that time. 3, sorry. Today, we have in Peru Jorge, fighting like me. In Paraguay, Sergio. Mara in Argentina. Miguel in Brazil. In Spain, we have El Mono, Julio Ruades, and Angeles Montada. Sorry, we feel them Latin. I know they are European, but they are more Latin. You know, Spain, it's like Latin of Europe. Yeah, it's true. It's true. We have Boris in Ecuador. We have George in El Salvador. We have Francisco. Francisco is the father of the associations in Latin America. He was the one to work not only in his country, he was going to every single country to find the people, the right people to take in the advocacy. We have Tomaso Gorman and Juan José Sirion in Mexico. We made what GFN do to us. They connect us, and we work all together. They are not alone either, and I don't have only the Chileans to support me. Now we work as a network, and I'm super, super, super proud of the new advocacies in Chile that are working as I remember I was working at the beginning, especially you.
Carissa, yes. As they're mentioning youth use, I have no information. Is snus a problem for underage users in Sweden, or is there any attention on that?
Well, there is attention and there is some discussion on it. But I think what I really want to emphasize is that on a well-regulated market, this is a problem that can be handled. Sweden is doing this. We are handling this. We are looking at it. And I also really want to say, for the politicians in the countries who say, we don't want youth vaping, what do the youth use instead? Many of these countries have youth that use cigarettes.
Yeah.
That's hypocrisy. Why do they want to ban the safe alternatives when the children are already using the dangerous ones? It's insane to me.
Yeah, it's a very fair point. They won't all just, I don't know, take up piano playing or something instead. Question down there, Brent.
But it's because of the streaming that you need to use the microphone. So people.
You've got one.
Thank you. Bengt Wiberg, founder of EU for Snus and inventor. Today, Swedish newspapers were full of more or less hatred to ban all flavors. And there were, in this article, Doctors Against Tobacco, Tobacco-Free Kids, Smokeless Generation, etc. signed this newspaper article. And there were no mentioning of adults whatsoever. So they just want to ban it for everybody, talking about the children. But my question to everybody in this room is why we live in a high-tech world. Everything, when you buy something on the internet, you have to identify yourself with the e-ID or a bank ID. So why not implement this in all places who are selling tobacco products, on either online or in a shop? If somebody looks to be younger than 25, ask for a bank ID. So what's your thoughts?
I don't think everybody has a bank account, but it can vary. Also, if shops are going to regulate things by asking for personal information, that's a huge GDPR issue. It's like way outside of tobacco control or anybody else's remit to bring in regulations like that, I would imagine.
Yeah, I also would say that maybe some stores, maybe not online, but in person, might not have those kinds of resources all over the world. I think in Sweden it would work very well, but not applicable in the rest of the world, I think.
Online, it's easy to implement an e-ID because because there is an 18-year-old limit for any nicotine product in Sweden. But if I walk into a tobacco shop, I'm sure they will not ask me to show my ID because I'm 67. But you could ask a person who looks very young for a driver license or ID.
Sorry, I totally agree with you, Brent. Just to say that maybe I think that, as I said, it's not a pose that I'm against kids vaping. I totally believe it. Even if someone could say that taking some information of you or anything, I think it's worth it to protect the kids. If you will sell online, I agree with you. There should be a way to be sure that you're selling to a person that it's overage. But badly, that it's not on advocacy. That one needs to come from the industry. And touching that point, again, I can only talk about the experience in Chile. We have a very, very close relationship with the shops, with the industry. Not with the big tobacco, but with the industry. We have a very strong connection. It was difficult to make it up because they were very... No. They didn't trust us. They were scared of us because we are the users. We will fight for our rights. So it's at the beginning was a very far relationship, but they understood that they need to be part of the cause. And today, all those jobs that are everywhere, you will have some jobs that will do what they want, but the big industry, the one that have gremiated, they have their association. I swear that in none of them you will be able to buy a single electronic cigarette because they understood that if they do it, we will lose because it's the only thing they have. So it's need to be done. The industry need to understand that we, in this part of the trip, we are together. In the future, I'm sure they will hate me. Today, they love me. Yeah, because I'm fighting for them. But in the moment that we finally need to stop to fight with the government, the fight will be with them. At least we will know our names when we are beating each other. But yeah, I agree. I think measurement to forbid the kids to touch them, it's enough. Everything will be okay. And if you don't want to give your bank account details, go and buy not online. That's it. You will have the choice. Users need to have a choice, but that choice can't go over the bad things like kids vaping.
Okay.
I got the mic, yeah. H from Factasia. I'd just like to ask the panelists, including you, where your governments and where you stand on disposables.
Okay, I'm in Ireland. Our government are currently working on legislation to remove disposables from the market completely. They're doing this under environmental grounds rather than because of nicotine. It's the batteries, it's the plastic, it's the chemicals that will leach. They are entirely recyclable and they do go in to the battery recycling bins. But we have had issues where they've just been thrown in general waste and caused fires at landfills. So yeah, there's an issue there. Where do I stand as an advocate for vaping? I'm going to make enemies. I hated the sight of them when they turned up because I felt they drew a target on our back. But on the other hand, if they had been the first vape had been bright coloured, fruit-flavoured, enjoyable experience as disposables are, I think we'd have way, way fewer smokers now. They reached people that were not interested in the faff and the difficulty. But we are where we are, as the expression goes.
I will say this, and I know that I will cross that door and someone will beat me. Please don't. We can talk. I'm talking personal. I'm not talking in name of association or the next user. You ask, where do I stand? And I will be brave enough to put out loud my position on disposables. I'm totally against disposables. I'm totally in favor of banning disposables everywhere and forever. Vaping, it's something that saves lives. That's why I'm here. That's why I advocate. That's why I feel that I'm doing something good for the people, for the humanity. The disposable cigarettes are exactly the opposite. They damage the environment in a way that it's unmeasurable. I don't want to die, and in 13 years more, the people are still telling how these stupid people were talking about health while they were destroying the environment with this amount of lithium batteries, with this amount of plastic. And also, and it's something that needs to be faced, it's that disposables are easier for the kids to have them, to buy them, to hide them. So there are the first two reasons why I want, or I'm in favor of banning disposables. And the third one, it's that the market of disposables have such amount of different brands, different shape, different color, different flavor, that the user today have no option to know which one is good, which one is bad, if it's not a super crazy guy as us, that we're all day thinking in vaping, but you have so much, it's like a sea of options, and you never know what it's inside, because it's so much that there is no way to control them either. You don't know, even us, you can't be 100% sure that the disposable vape that you're buying, even in a vape shop, it's real from the brand that it was supposed to be. So it have all this bad stuff. And the fourth one, and the thing that it's maybe the most important one, I think, and that's my personal point of view, that if we have any option of losing this battle, it will be because of the disposable. They do an environmental damage, they do damage to be able, easier for the kids to have them, and that's my position. I hope no one beat me, but someone need to be brave and say it.
Mine's going to be quite contrary. I'm saying, like, I'm not for disposable, but then again, I'm not against. But since the question from Ash was asked about each government, I think there are many governments, including ours in Thailand, they're considering lifting the ban on just disposable, because the way the government thing is, it's easier to control. You have to keep this in mind. Disposable are non-adjustable, non-refillable. You cannot do anything. You cannot charge it. You cannot. And they also think that, okay, of course, we are old enough to remember recycling bottles. Coca-Cola, 50 cents, 25 cents in US, right? So some of the government will be thinking like, yeah, why not do that? In the beginning, well, you're an adult, you're a smoker, you spend lots and lots and lots of money on smoking, you put deposit down. The next time you want to go back and buy a new one, you need to bring this one back into recycle it. This I've heard from government officials, not only from my country, but also from other countries. Personally, I agree with Ignacio, say like, I don't like disposable, but it's more personal. Disposable don't have the flavor that I like. That's it. So it's really, for me, it's personal. They don't have, because I smoke like 0 or only 0.3% nicotine. That's it. I cannot tolerate higher level. I started with 24, and it just reduced and cut it down, and now it's either 0 or 3. So So disposable is definitely way too high nicotine for me. So that's personal for me. I don't like disposable because the flavor and the nicotine level is not suitable for me, for personally. But if you want, if I want to answer directly to H's question, the government, we have to be careful. Some government will think that it's easier to control. So it's us to educate them and saying like, hey, I agree with Ignacio, say like it's going to bring lots and lots and lots of pollution. But then again, we have other kind of pollution, which we probably we won't have enough time to talk about that.
I forget one point more that it's as important. I think also that disposables are killing and will kill vaping tops. And why it's important for me, the thing of the vaping tops. Vaping tops are point of tobacco cessation. They are working. They have people that know what they are talking about. They give you personal atenderte personalmente, personal help. They teach you. But with the disposables, you have disposables in tops where the guy that is selling it got no idea what they even are. If you ask him, they got nicotine? How much puff? Read the box. So also it's because I know that, especially from the industry, hearing me saying I will prefer the ban, it's like, no, it's part of the vaping industry will be killed because finally it will be like buying bubble gums and it will be controlled by. It's happening. It's happening now. So that's another reason why I will set not support. I won't go against ban of electronic disposable devices. And the other question, in my country, still not a topic. Still not a topic.
Yes. In Sweden, they are available, and I don't know of any plans to remove them from the market. I'm not going to contradict any of the things that has been said, but one thing I really want to point out is that different products work for different groups. And this is super important. Disposables reach a different group. And innovation and innovative products, they reach new groups and different groups. And I mean, even in Sweden, where we have very low numbers, we're not reaching everyone. Old women especially, they haven't started use snus, nicotine pouches, nothing. We might see a change with vapes and maybe even with the disposable ones that have come to the Swedish market. But we don't know that yet. And I think this is a huge part in making sure that we get not only lower, but maybe to 0% smokers. So I think that's one important point to keep in mind when we're discussing this.
Yeah, it is extraordinary. Disposables appeal to the very young, but also, oddly enough, to the very old. They just find them really easy. Asha, you have a question down there. No, you have it.
Go ahead. Okay. It's your power. I am Mike, and I've got the mic. Turning back to the previous subject, I want to tell you, Ignacio, that we have done the same in Romania and in general in European Union. Romania being a part of European Union, we have probably one of the toughest laws in the world concerning protection of the youth and the kids. Indeed, the industry always sustain without any kind of reserves all the measures who limitate access. At least in my country, concerning the electronic buying, for example, you can do it, but you have to show your ID when the merchandise are delivered to your door. It is totally forbidden, prohibited to be delivered via drop box, like a fast courier or something. You cannot buy it like that, yeah. Meantime, we had at our term, exactly as you have done in Chile and in Latam, Even we had a lot of legislation initiatives and bills to support access of the kids. But the realities show that the kids still smoke on the streets or vape. And with all of that, with all of this positive attitude coming from the industry, we still to be blamed at home. Now we many times discuss with the authorities that from our perspective and our point of view, we have done all good sense could allow us to do in this respect. But much more we cannot do, because we cannot substitute ourselves to the law enforcement special agencies like police or local police or national police or something. So that always they keep this subject with the youth and kids on the higher agenda, just to have a tool to suppress our action and activity in any condition. Just this I want to say, yeah. Which is pity. It's pity. Really, it's pity, because we made really efforts to ban to the kids.
A question. Pass that back there, Alex, I think.
Thank you very much. For policies to work, generally, they have to be not only attractive, that is effective, but they also have to be feasible. And I think there's very little question about the strong demand for disposable vapes in many countries. What I'm concerned about is whether trying to impose a ban on disposables is actually feasible. When Donald Rumsfeld was the Secretary of Defense designate in the United States in 2001, he was interviewed in the Senate at the confirmation hearings, and he was asked whether he would support, if he became Defense Secretary, if he would support the US military being involved in the war on drugs. And he said that the problem in the drugs issue is almost always demand, not supply. And this is the problem here. Whether you like disposables or not, I think the possibility of achieving a ban is minimal.
Yeah, very prescient point. Next there.
I just want to throw a spanner in the works here about disposables. How do you guys feel about kids' toys? Should we ban kids' toys because of environmental impacts? Because hang on, Asa, because basically kids' toys contribute to 77 times more e-waste than disposables. The issue around this is not about the guys. We're getting trapped into chasing after new narratives, after new narratives, after new narratives, and we're actually walking away from the essence of why we are here, and that's to address non-communicable diseases and early mortality around tobacco smoke. And they keep throwing things in the works and in the road for us to challenge. And the idea we challenge these is using the data that we currently have. So just a simple Google search of what creates the most e-waste in the world, it's kids' toys. So do we ban kids' toys, or do we look at ways of recycling these devices and these items, or even repurposing them? You know, I was just looking up just quickly, just to answer here. In order, Barbies, for example, 1 year of manufacturing of Barbie dolls contributes to 380 million gallons of fuel. If you just go through all those numbers, and my issue that we have is that we start talking about a lot of things, colors, flavors, disposable vapes, the environmental impact, how much deforestation. You know, there was a rhetoric that was just last year about we should grow more food than tobacco because we could feed 20 million more people. But did you know that, for example, food waste, if we had prevented food waste, we could feed 2 billion people. That's the data that's out there. So what we're getting, we're falling into traps as advocates, consumer advocates who keep falling and trying to defend our space and defend our space, but we should be taking the art and bringing it back to what the essence of everything is, and not entertain and defend things that is done on purpose to derail or to throw in another conversation point to prove, when in fact there are issues out in the world that are far greater, far bigger, that have solutions, and we should just replicate those solutions.
Yeah, to be honest, as far as disposables are concerned, they're like any other disposable or reusable good. It's how you manage the waste afterwards. That's the solution, not banning the product. But to be honest, I'm not 100% sure the environment is the concern when it comes to justifying the ban, you know? Mm.
Kurt?
80% of the world's plastic bottles end up in waterfalls, and over 1 million plastic bottles are purchased every minute.
Sorry?
According to the United Nations. That's plastic water bottles.
Okay.
So where's the environmental...
Two little things. First, in the part that I totally agree with you, this was to talk about advocacy, and it came a question, we just answer, and it switched to something totally different. So that's the first. And the second one, because of the plastic bottles, do you drop your trash from your car? It's like trying to mix up stuff that have no sense. I won't be throwing my part of the cigarette out because there is hundreds of millions of trash there. I think we are losing the point in both things. We're losing the point in talking about disposables and getting away from advocacy that was our main thing. But this can continue outside. We can continue to see our point of view, that it's nice that we have different point of view, but I think it's going away, and we will end talking about yes.
Yeah.
Ignatius, my point is that it's about rhetoric that we've been combating or fighting throughout the ages. Disposable just happens to be something else that has been thrown in the way. If we think back of over the years of things like popcorn lung and flavors, Ivali, colors, all of these things get thrown in the way, and we find ourselves trapped in defending and using these things in order to prevent us from actually talking about the real true essence around tobacco harm reduction. It's done intentionally to literally dismantle what we're doing.
Yeah, we're talking about all this because we all know what the price of smoking and its continued price is. And we're not here to defend vaping, we're here to defeat cancer, COPD, heart disease. That's the reason we're here. We're right up to time, and I know GFN is a tight ship, so I'm going to thank all the guests and everybody else here and draw a line. And of course yourselves for coming.
Thank you.
7 years ago, I was invited by Gerry Stimson to give the Michael Russell Oration here, and it was my first entry into the world of tobacco harm reduction. I paid attention to it for many years and met some of the people, but this was the first time meeting a community of people who were engaged in this area, and I was really drawn to it. And part of my speech at the time of the oration was on this theme. It was on the theme of, well, a related theme, which is what can the field of tobacco harm reduction learn, or what perspectives can be gained from the broader struggle for harm reduction vis-a-vis illicit drugs and the broader drug policy reform struggle. And obviously, if you've spent your life focusing on the war on drugs and the harms that illicit drugs can do, especially when they're operating in an illicit market, you understand the risks when you see similar abstinence-only ideology and similar ideas of stigmatization and demonization and prohibitionist policies emerging in this area. And for me, the decision after 2017 to become more personally involved in this issue was driven really by a couple of things. One was I simply believed that even with respect to cigarettes, that it would be a mistake to go down the road towards full prohibition, even if harm reduction succeeds. But the other was seeing the harmful consequences and the potential damage that could result from banning harm reduction. To me, it was analogous to banning needle exchange to reduce HIV/AIDS, or banning methadone, or things like this. So today we have a very distinguished panel of people from Australia, the US, the UK, and Malaysia, most of whom have some experience in advocacy and analysis vis-a-vis both tobacco harm reduction and illicit drugs. Now, what I also know is that we don't want to spend all our time here preaching to the converted. I think almost everybody here, is a supporter of tobacco harm reduction, and there may be a few secret opponents lurking among us, but I think we're mostly in favor. Most of us understand some of the consequences of what would happen from criminalization in this area, what is already happening. So we'll get into that. But I wanted to take this opportunity to throw out to the panelists as well some of the tougher questions. Are there areas, for example, where prohibitions might be justified in the field of tobacco or nicotine? What do we say to some of the best arguments of our opponents? Where do we think this is actually going? So you have the names, I think you saw the names of my fellow panelists here, but I'm going to start here with you, Harry. I mean, you've been involved in this area. I mean, apart from being a famous biographer of musicians and all this in your other life, you've been involved in also the area of illicit drug policy and harm reduction. And when I asked you, you said, there's really sort of three sorts of levels of bans or prohibitions. Do you remember this note you sent me about specific bans and about the, the kind of soft bans, et cetera? Just if you could, to an audience which is already sympathetic, but get into some of the nuances of what you see as the world of tobacco or tobacco harm reduction prohibitionism going on today.
Thank you very much for that. Well, I mean, you've obviously got some countries in the world, certainly not as many as the WHO would wish, but you've got some countries in the world that have implemented a total ban. Now, I'm sure a lot of those countries are probably awash with illegal vapes, but in terms of the policy, it's a total ban on importation, possession, buying online, the lot. So those are your sort of total ban countries, of which there are, it's debatable, but around 30 odd countries are doing that. Then you've got what I call soft bans or de facto bans, which are those territories which are trying to implement flavour bans, for instance, using the kind of kiddie flavour narrative. Forgetting, of course, that everybody likes sweet flavours, and a lot of the reason why adult smokers switch is the option for not necessarily having the taste of tobacco in their mouths. So flavor bans represent a kind of, in some areas, a kind of de facto ban, which has its unintended consequences, as we've seen in some of the American states where cigarette smoking has suddenly gone back off. And then I suppose there's something that's a bit more, it doesn't feel particularly nuanced, but when you start getting a kind of a torrent of misinformation that comes out of health agencies, public health agencies, international agencies, doctors, medics, it begins to build itself up into a kind of, and academics as well. We have, journals that are publishing, flawed science or even fake science in some cases. And that kind of cascades its way down to health professionals who are very reluctant to suggest to people who come forward for help. And yes, lots of people give up smoking without any intervention from anybody. People who smoke don't regard themselves as sick simply because they smoke. But some people do go to health professionals and nurses and stop smoking services, and they want help to quit. Mm-hmm. And many of those professionals are very reluctant to suggest people switch. Many surveys show that a worrying percentage of doctors think nicotine causes cancer. And then you've got smokers themselves who've been put off by media headlines that smoking is at least as dangerous, vaping is at least as dangerous as smoking, if not more so. So that, in a sense, prevents a number of people from moving away from smoking. They carry on smoking. So in a sense, that's obviously it's not prohibition in the way that we talk about it, but that is what the actual nub of it is. That's what the end result of all that tsunami of misinformation does, and prejudice and all the rest of it. It results in a situation where people carry on smoking.
So let me get into a little tricky territory here. The issue of the places where you have full bans or partial bans, and we see illicit markets everywhere, right? Gray markets, illicit markets. But in many of these countries, there's not a lot of crackdown as yet, right? I mean, there's not a lot of police enforcement. They're kind of being tolerated. I mean, we'll talk about the kind of example of Australia where you're actually seeing some really violent stuff going on shortly. But, I think about in the area of cannabis, where we're now seeing full legalization, or we're in the US, Canada, Uruguay, we're seeing elements of far-reaching decrim now in Germany, Malta, Spain, what have you. But it sometimes struck me that when people say, what would be the ideal cannabis market? And if you're kind of resistant to kind of big corporations, multinational corporations, you sometimes tend to think of the early years of decriminalization as the ideal period. I think about the Dutch coffee shops in the late 70s, early 80s, when it was mom and pop operations, mom and pop stores, mom and pop growers. Everything was chill. Lots of people were making a little bit of money. No big guys involved. I think about the little neighborhood of Christiania in Copenhagen, which had a similar kind of relaxed cannabis scene. I think about even the early years of medical marijuana in the U.S., right, where we had a similar thing like that. Maybe Spain with the... And I thought, God, that's the optimal, because you get tons of people involved in the market. It's not really being cracked down upon. The police are tolerating it. There's no big business, no advertising, all this sort of stuff. And it seems like almost an optimal middle. Now, it's not sustainable in some sense, because eventually the gangsters begin to take over, as they did in Denmark and Netherlands and elsewhere. But it makes me wonder, are there certain advantages to keeping this stuff in a gray market rather than a fully legally regulated one? I mean, where you now have its... let me throw that one out at Lindsay, because Lindsay's, I think, an activist in the U.S., the Taxpayer Alliance. She's coming from a more libertarian perspective on these issues, which have been crucial allies in the broader drug policy reform struggle for decades. But what's your thought about that?
Hello? Yeah, okay, it's on. Sorry. Well, I mean, the United States is kind of in that gray market if you look at it, and it's always kind of been. And I think of vaping in the United States, it was a lot better when, before the FDA came in with regulations, you know, you could still go to the vape shop and make your e-liquid. And I still don't understand that why that's impossible to do, because you could go to a bar and have people mix you drinks and go drive your car and cause way more damage on that. So there are benefits, but I guess too, the only problems with that is once you start having youth issues, there's no way to, you know, restrict it. And you also, when you start having issues like, you know, the Valley epidemic, I think, is a perfect example because it was illicit, you know, THC containing.
Speak a little bit
products.
slower for our international audience.
Sorry.
Yeah.
The Valley epidemic, I mean, it was largely attributed
Just a little bit slower for our international audience. Take a breath and yeah, you can do it.
I'm used to testifying in 2 minutes or less, okay?
Oh my God. You're not, I'm not gonna, we got 90 minutes here.
In there. So if you guys all remember, back in 2019, around September, the CDC, the Centers for Disease Control and Prevention in the United States, started warning the public pretty prolifically about this spat of lung injuries that they were seeing in ERs across the country, that everything in common was the person who they had vaped. I actually started looking at the state health.
Hold on one second. Is everybody familiar with the whole E-Valley thing in the U.S. 2019 where 70 or 80 people landed up dead and 2,000 hospitalized because of the, does anybody not know about it? Just raise your hand. Okay, well, a few of you, so, but just, I think enough know that we will, go ahead. Yeah.
Well, what a lot of people don't understand is the CDC really wasn't giving us a lot of accurate information on that. They were not warning us that it was, you know, illicit products. And what was actually kind of crazy was the knee-jerk reaction from some of the governors after that was, oh, let's ban flavors now. Yeah, these are all unregulated products. And the Valley, I don't know if everybody saw that the study that came out, that most of the deaths, there were more deaths in states that didn't have recreational cannabis. So you did see that there was a direct correlation to where you're more likely going to have illicit, unregulated products and harms associated with them. So, I mean, that's the only part where I would argue for some strict regulation, especially in vaping. Like if something happened, let's say, you know, vapors were using the vitamin acetate in their vape, and then it did cause a problem because, you know, somebody thought it was a good idea. You should be able to have a recall system on that. And unfortunately, we just don't unless you want to recall the 23 products that are legally for sale.
Right. So that, and I think everybody's aware the issue was not vaping marijuana, THC, it was illegally produced THC cartridges. I remember lecturing some of my allies in the nicotine field, always say these were illicitly produced, and as Lindsay's saying, the states where cannabis was being legally regulated, you saw much less incidence of E-Valley than in the states where people were more dependent upon the illicit vape market. So that is clearly a cost to...
vaping cannabis is safer than smoking it, and I think that's really what got really lost when it comes to the E-Valley stuff, that, you know, I think they also looking at that being a delivering mechanism for cannabis. So.
Okay. So, Sharifa, you know, yesterday I was at a presentation about Central Asia, and somebody put up a chart, and just the diversity of full ban, partial ban, this ban, flavor ban, da-da-da-da ban. Now, when we go, I mean, you're from Malaysia. I'm curious, within Malaysia and more broadly in East Asia, is it the same thing where the degrees of bans vary dramatically from country to country, and where the illicit market is pervasive but still not really being enforced?
Thank you very much, Ethan, for the questions, and thank you for JFN for me being here. That's a very good question. In Asian countries, most of the countries would actually sort of allow vape, even though most of the countries actually put some sort of ban on it, either a complete ban or a partial ban. Some are very strict, things like Singapore would put a complete ban, but of course, coming from Singapore with a high GDP, but also a low number of population comparatively with other countries like Malaysia or Indonesia or even China, where we have a huge number of population, example for Indonesia. And most of the countries in Asia, interestingly, we have signed with WHO FCTC. So in a way, we are sort of bonded with this binding with WHO, and as much as possible, the tobacco control in most of these countries try as much as possible to follow all the articles in WHO FCTC. where they actually put or segregate things like e-cigarettes and vape as a tobacco product. So when that happens, they're going to be, saying that you should not be vaping and e-cigarettes and things like that. And many of the countries do so. Some of the countries that actually sort of regulated vape would be Philippines, Indonesia, and also Malaysia. We have just recently sort of approved the last tobacco bill in 2023, where we sort of allowed e-cigarettes or vape to be sold, of course not for minors, but there are very severe restrictions, meaning that you cannot promote, you cannot advertise, things like, it's the same thing with many other countries. You cannot promote, advertise, use, or you can use, but you're not supposed to promote it, and that's where some of the issues come about, where how do you actually do studies on that? How do you actually tell about the benefits of vaping in this sort of restriction? So most of us, we cannot talk about it in an open manner. There's going to be some maybe soft retaliations to us. And what happened is that what we see now, because of the lack of regulation, we see an increment of black market, and most of this comes from certain countries which is nearby. Some of them comes from Indonesia, but also in China, from China. And we have a huge black market for not only illicit tobacco, but also illicit vaping products. So that gives us a lot of scare, because how do you say to the public, you should vape, but then suddenly all the vape products are being adulterated with vitamin E, VEA. So how are you going to tell people that, you have to choose carefully? How do they actually choose? This creates the problem. So the government last year, what happened is that the Ministry of Health, with good intention, they have sort of promoted or sort of mentioned that all the vape vendors should actually be put in some sort of inventory, so we kind of can control what is being sold and things like that. At the moment, there's no standardization. So everybody can sort of buy their own, and they can actually do backdoor industry. They can buy things from the bakery and just come up with their own products and things like that. And this is what we are worried as well, because even though it's a good thing, but the ill effect is that you see increments of lung abscess, lung collapse, and cases where they represent things like ARDS coming up to the ER, and we don't know what they are vaping or taking. We have a problem with cannabis as well, where most of the vapers now actually use vaping equipments to actually vape substances. And again, how do you actually monitor this? Because even though we are supposed to not do it, but it's in the guidelines, but people still do it, and there's not enough enforcement to go around and look at that. And what happened is that because these are considered black market, and in a way you have certain syndicates doing this, so they sort of get agents to sell this to the youngsters as well. So now this creates a double whammy for us as well. When we advocate for vaping, then it goes into, so how do you tell this to the adolescent or the children or the youngsters? Smoking starts quite early in Malaysia as well. In some cases, you can get initiation from 10, 12 years old. Probably this comes about because we used to be a tobacco producing companies, and most of the tobacco actually do come into Asian markets, as everyone knows. It's a huge market there, and most of the head of household actually smokes, especially the elders, the male elders.
And is a big part of the tobacco market illegal as well?
Oh, yes,
Illicit?
yes.
It is. So
once the children, they can just buy illicit cigarette, which is much, much cheaper.
Right.
It is about 1/3 of the actual price. And they can buy this in singular, meaning that you can just buy 1 or 2 sticks, and they can just use it in schools.
So you're raising it because I was wondering actually, when I ask, is the illicit or gray market problem issue it's massive, billions and billions of dollars worldwide, but it's on the one hand providing some service of making these things available to people who want it, who need it. It reminds me of the concerns around when people would be worried about methadone maintenance programs, and is the methadone being diverted? And then people sort of realize the only people purchasing diverted methadone, they were not young people, naive users. They were people who were addicted to heroin who could not or would not go to a methadone program. So there seemed to be, but you're suggesting that actually there are some cases of people showing up. I mean, one could see that with all these devices that are unregulated, there may be long-term negative consequences, right? They may show up 20 or 30 years from now where they'd be more severe in the products that are not being regulated. But there are cases showing up in hospitals of people being hurt by this illicit market product?
Yes. some of the published reports or some of the statements made in the newspapers and things and like that says that, you know, they keep seeing cases coming up in the ER from people vaping. So the next question is that what are the type of vape that they use?
Yeah.
What was the quality? What was the quantity? Was nicotine added in? And things like that, which are really not answered. So the general effect is that vape is a bad thing. You should not be vaping. And this creates a misperception for everyone. And how do you actually promote vaping for people who are actually smokers, you know?
Right.
So it is an issue. The government is trying to come up with a new regulation which is more technical and things like that. I doubt whether this will solve the problem 100%. As you know, the black market keeps coming up, especially in Malaysia. We are surrounded by, you know, the waters and things like that. We have even different states that has more severe cases compared with certain other inner states, you know, because states which is more bigger, states which is nearer the borders and things like that will have more, you know,
So that's
percentage.
making the case for. So
Correct.
I mean, Fiona, you know, I say Australia. I mean, you know, here Australia has been a leader on much of harm reduction vis-a-vis illicit drugs since the 1980s, on needle exchange, methadone, a whole bunch of it. Been a little bit slow on cannabis reform, but pretty good. And Fiona, for you to know, has been not just an activist, but also an elected official in Australia for many years, and recently stepped down from that, and very active in a whole. We last crossed paths in New Zealand at a conference a decade ago about the issue of synthetic cannabis and how they were going to handle that. But you know, there was a presentation at the E6 Summit in DC last month by Ben Udan, who's a wonderful researcher, and he was comparing Australia with the other US, Canada, and especially New Zealand and the UK. And Australia just, I mean, it just seems absurd. I mean, you know, the most hyper-restrictive, moralizing. You know, you see the personal attacks on probably you, but also Colin Mendelsohn and others, and you know. So I'm curious, in Australia, I mean, the first question, of course, is, you know, why is Australia just so utterly, fanatically antithetical to core public health principles when this should, do you have any deeper understanding or insight into why it's worse there than, as bad as it is in the US and other countries? Why?
A lack of hubris. Oh, no, hubris, sorry. Hubris. We, you know, Australian Tobacco Control was so proud of themselves with plain packaging, so proud of themselves with their escalating tax scheme, but also proud of where our smoking rates were going for many years. I mean, we've plateaued out. I mean, our smoking rates are just are staying pretty much the same now, but we were so overly proud that I think that is part of the reason for this, and particularly the government that we have today, where they led that plain packaging. You know, they beat big tobacco in the plain packaging. It, you know, it went all the way to the high courts. It went you know, it was challenged everywhere, and Australia won. And that, you know, that I think that is actually really underlying where we're going now. And
well, so now let me just say, so I mean, Australia is now emerging bizarrely as the example of where prohibitionist approaches is actually generating real violence and real death with the fire bombings. So just tell us, the audience, a little more about, I mean, some people will know, it may not, about the fire bombings of shops selling these things. And are the gangsters, are the same gangsters involved in smuggling tobacco or smuggling illicit drugs or other sorts of things?
Yes. Yes. All of that. So in my hometown of Melbourne, I think we've had 80 firebombs of shops that sell tobacco or sell vapes. It's a giant illicit market. For a packet of 20 cigarettes in Australia costs about 30 euros, of which probably 95% of that is tax. So you can see how the black market for illicit tobacco, and remembering that obviously as in many countries, people who smoke it are generally from lower socioeconomic backgrounds, lower education, lower employment, etc., and more disadvantaged communities. So we've seen the illicit tobacco market skyrocket. Now you would think that an intervention for that would be vaping. That would be a great way to break that market. But of course, that's not what we did. We went on and banned vaping, and so we've seen the illicit market in vapes. I mean, you can't buy, and you've never been able to buy a vape legally in Australia, except now with a prescription from a pharmacy. But we had these giant illicit markets, very popular product. For tobacco, it's a tax crime. It's not really a criminal activity, so the risk is low. For the importation of vapes, they're such a cheap product. If you lose, you can certainly lose a lot getting picked up at borders or picked up by police, and you can still make a handsome profit on them. So yes, we're seeing crime gangs. We're seeing territory wars around the supply of illicit tobacco and vapes, and there is not a child in Australia that couldn't easily purchase a vape.
Mm-hmm. Hey, so here's a somewhat, cynical question. We all agree, it's almost pat, you have to say, that of course we have to keep young people from vaping, or obviously from smoking, vaping, what have you. And of course we need age limits, right? Of course. Now, I know from the cannabis field that banning it for all adults did not keep it away from young people. In fact, the polls show that young people for the last 50 years have had the best access, to cannabis. In fact, if you ask, so if one 50-year-old or 40-year-old asked another one, like, how do I get some marijuana years ago, the typical response was, have you asked your kids, right? I mean, it's just, that was it. Now, do you think that any of these regulations or restrictions anywhere is actually effective at reducing access to young people? I mean, we all have to say it, and we may actually want it to be true, but does it actually?
Look, I think with Lindsay will probably say this as well, but when you look at tobacco, and when we sort of made tobacco sales restrictive, we increased penalties for selling to minors. You actually did see probably a reduction of access. It was harder for young people to access tobacco when it was strictly regulated and there wasn't this illicit market. So I think yes, you can through regulation, and I think even Canada is finding that with cannabis, that the age of people first experimenting with cannabis is going up. Now that might be because their parents are doing it; it's no longer cool.
Right.
But also I think that regulation is kicking in.
Yeah, Lindsay.
Well, I mean, if you when you ban vaping devices, you do see an increase in smoking. You've seen it in Massachusetts. They've seen it in California, in numerous localities. There was just a study done that looked at cigarette sales data. So it's almost like we're losing the message on harm reduction completely when we're so worried about banning vaping that we're not even paying attention to smoking rates increasing and going after that. So I haven't seen it be successful at all, actually. And even with the bans on places, with some of the vape bans, you can still go get vapes. I mean, you can get them in shops. It's not like in Panama where everyone was selling vapes on the street. Like, there are brick and mortar shops that are selling, e-cigarettes that are technically illegal.
Yeah, I mean, it did seem in the cannabis context, in fact, that when it's banned for everybody, the young people have the best access. When it's banned just for young people, there may be somehow the adolescent market seems to lose some of its dynamism, and maybe But Sharifa, so if you look at Malaysia or Asia more broadly, do you see any evidence that young people have less access because of regulations or prohibitions?
At the moment, no. At the moment, no. One of the reason might be because we have not sort of fully prohibited it. Last year, during our release of the tobacco bill, there was a lot of backlash from certain societies saying that why the government actually allows vaping starting from 18 and above, meaning that if you're a minor, of course, you can't vape or you can't access vape, but if you're 18 and above, you're considered an adult, you can actually use vape, and this is where they actually, access it either online, through friends, buying it from vendors, and so on. So back to your question whether certain countries would actually have a successful prohibition approach, I would see in our region would be probably only Singapore. And that was because they have a very strong tobacco control from the start. Besides that, they have started with a very low number of people smoking. That's the initial, starting point. In many of the countries in Asia, we have a high burden of smokers, like more than 30% many years ago. Even in Malaysia, at one point in time, about 40+% of our male, 15 years old and above males, are smokers. Now that has reduced, but we have seen that adolescent has sort of a reduction in smoking, so has adults, but we have seen an increment of e-cigarette users. And this is something that I would say that, oh, this is good. People are using something which is supposed to be risk-reduced products or alternative nicotine products. But in the end, there's another way of looking at it, is that hopefully all these products are safe. That's the other drawback. Yeah.
So, I mean, Harry, probably nobody has a better global overview. Does that one work down there or not?
This one works.
Oh, okay. Nobody's got, you've been authoring the Global State of Tobacco Harm Reduction report for some years now, so almost nobody's got a better global overview than you do. When you look at, if you look at which countries seem to be doing the best, are they the ones with the most sensible science-based regulation, or are they the ones that are actually just allowing the free market to more or less flow, or what stand out as good examples, and why?
Best in what respect?
Oh, no, if you had to pick one, say, if I had to pick one from the real world here, the one which is more or less doing best at kind of making the stuff available, fewest people getting hurt, most people benefiting, maybe it's gray market, but there's not a lot of, violence with, some mix of...
I suppose in terms of,
And I should say, Harry, when people ask me, when I think about harm reduction, you think about harm reduction intervention, but for me, when a harm reduction applies to public policy, I typically would define it as the optimal harm reduction policy is the one that best does two things. It reduces the negative consequences of the drug usage, of the drug itself, and it reduces the negative consequences of government regulatory and prohibitionist policies. And so the optimal policy will be the one that achieves the best mix of reducing the harms of the drug itself and the harms of the government policies. So by that kind of balanced set of criteria.
Okay, well, I suppose the two most obvious examples would probably be Sweden and Japan. Because Japan has seen now, bearing in mind Japan still bans vaping because nicotine is listed as a poison. Nevertheless, cigarette sales have just gone through the floor in recent years, something like 50% in the last very few number of years, which is probably the biggest fall in cigarette sales anywhere in the world. And it's seen a consequential rise in the use of heated tobacco products. Government seems largely to have stayed out of this, to the best of my knowledge, and it's been consumer-driven. For various kind of cultural reasons within Japan, that there's an element of people not wanting to, inconvenience other people with smoke. And so there are various cultural elements going on. The other classic example is Sweden.
Right, and I think almost everybody here knows the Swedish story. So what are the runner-ups?
Well, UK hasn't done too badly. We've seen steady falls in the numbers of smokers over the years. Steady rise in the number of people using various heated tobacco and vapes. A reasonably proportionate regime control landscape. It's gone a bit wonky recently with, talk about banning disposables and smoke-free generation and it's various stuff like that, which may or may not come to pass because we've got an election going on. But generally, you've got mental health trust, stop smoking services we got switched, stop to switch. I can't remember the exact slogan, but actually giving vapes out. Switch to stop. Thank you very much, you see. As someone who's not even from the UK, knows it better than I do. So they've done
Harry,
well.
what about the less economically advanced countries? If you look at Latin America, Central Asia, Africa, are there places that just seem, whether by chance or accident or purposeful, that actually, seem like they're doing a pretty good job in terms of allowing this stuff to be available and people are benefiting and transitioning?
Well, there have been some, I don't know all the ins and outs, but there's some recent sort of thumbs up from, say, Chile, for example, which has been kind of definitely moving in the right direction. My colleague Ignacio, who may or may not be in the room, will probably know more about that than I do.
I just heard Ignacio give one of the best talks I've heard at this conference.
Yes.
At the previous panel.
Yeah. So,
and which included talking about the success stories of advocacy. It was
Yes.
actually quite inspiring in that regard.
yeah, exactly. I was in the room as well, and I heard that, and it was very inspiring. It shows what advocacy can do. In the face of some fairly monolithic opposition to the premise. We've heard mention of some countries out in the Far East and in Asia. So there are pockets, you can say. There are pockets around the world where you can say there is some promising developments. Huge swathes of the world where either there aren't any markets. I mean, Africa is a good example. There are some pockets of use. There's a very active African Harm Reduction Association, but I think you're just looking at Kenya, Nigeria, South Africa, one or two countries where there are even any markets where even these products are available. South America is lots of advocacy, but still, a bit of a desert when it comes to proportionate regimes. So, it's a very, in all of this subject, everything that we talk about, whether it's numbers of users, products, legislation, everything's mixed. The whole picture across the world is mixed. There's no real homogeneous kind of narrative that you can put around.
And there's no trend line globally, you think, towards, one tends to hope and maybe believe that ultimately the science will win out. Ultimately, the prohibitionist mentality will begin to fade. Ultimately, Bloomberg will decide to, pull back, or maybe it'll stop happening. That, and look, obviously, somebody was involved in, cannabis reform and in broader illicit drug harm reduction, and we had the dark days in the 80s and the 90s, and we've seen, over time, huge progress. And in fact, we've seen it without there being any commercial interest behind us whatsoever. If anything, now the commercial interest of big tobacco is a very double-edged thing. They have the resources to advocate for harm reduction. At the same time, their negative reputation is what undermines the advocacy efforts that have nothing to do with them.
But look how long it took to get any chinks in cannabis prohibition. It took decades and decades before you could even, begin to see any sort of light if you were, embedded in the drug reform movement. And it's different because you started out with an illegal product.
That's right.
And now you've got, you've got transitioning from one form of, legal product to another. And I think the commercial interest in this is very embedded, whether they're tobacco or whether they're non-tobacco. And it ain't going away anytime soon. So I think consumer demand is going to push this forward, almost irrespective of what's going on legislatively. Whether these products are legal or illegal in terms of actually not being allowed in the country, they're going to be there. They're there already. And it's a, it's a Ferris wheel that ain't going to stop turning.
Right. So let me press the issue about, we generally consider ourselves anti-prohibitionists when it comes to tobacco harm reduction products, non-combustibles. But, even within this movement, there's gradations of this sort of thing. And I think we begin probably by all agreeing that there should be a prohibition on sale to people under the age of 18 or 19 or 21, I assume. It's almost impossible, even if you don't believe it's true, to say it. But I think we generally believe that there might be some benefit to making it legal and by banning the sale to young people, even if it creates a de facto illicit market, even if most young people can get it, still good. Well, what about the issue of, let's start with maybe the other one where we would agree, I think, that there should be a prohibition. But, You know, Lindsay, you dealt at one point with the issue of Juul having to deal with counterfeit products. Yeah.
Yeah.
So do we agree counterfeiting's a fraud, it's a crime, and it should be prohibited? Or what can you tell us about that Juul experience with counterfeit products? Or is there some nut public health benefit because they were getting the things out there?
Well, I mean, the counterfeits, Eon Smoke, and I found out that actually Durbin went after Eon Smoke back in 2014, which was kind of interesting.
Durbin, you talk about the U.S. Senator.
U.S. Senator
Illinois, who's
Richard
been a leader in
Durbin.
opposing harm reduction.
He was testifying yesterday. He sent a letter to some of the major tobacco companies. Lorillard was one of them, and then also Eon Smoke was in there. And I don't know if you guys are familiar with the Juuls and the pods. And there's these little ones, and at least in the States, Juul didn't have very good flavors. They also had very limited flavors. But Eon Smoke made these compatible Juul pods that were really a lot cheaper than the Juuls were, and they also came in a plethora of flavors, and they were also terrible products as well. They didn't last, they leaked, I know. I used them, but I never really saw a lot of scrutiny when you know, there was a kind of a convolution between Eon Smoke and Juul, and like who really was the bad actor. And again, all these kids were vaping, you were catching them with Juul products, you can see the actual device, but it wasn't like, you know, school teachers were testing it, or, you know, Juul doesn't make a watermelon, raspberry, Laffy Taffy, you know, but this is that flavor. So I do think that it is a major issue when it comes to all the regulation and all the new products too. You know, disposables, for example, are another problem where it's all counterfeits. Elf Bar quit selling Elf Bar in the United States in 2023, but if you go to any gas station or convenience store or tobacco shop, you're going to see products that sit there and say Elf Bar, and they look just like them, and they're not, and there's really just no supply chain oversight. So, and I think it's just going to get worse with pouches, okay? You're going to see Zyn, the next knockout of Zyn in a few years, so.
Any other thoughts from the other panelists about counterfeit products, whether they are a significant problem or whether they just need to be opposed? Or
yeah, I think if it's about product safety, isn't it? And so it's really just about ensuring that we have a safe product for the consumer. And so yes, counterfeits inevitably seem to be a less safe product. So yeah, as a minimum, it's around product safety.
That enforcement should be there. Well, now, so on the previous panel, there was, which Tommy chaired, and Ignacio and others from Thailand and Sweden also spoke. There was the issue of whether or not to ban disposables, which seems to be a fairly contentious issue in this community here. And, you know, obviously people make the argument about there's the environmental negative consequences of disposals and how big or serious is it really. There's the issue about, you know, that young people are very drawn to disposables, older ex-smokers are more likely to use the non-disposables. What are your respective thoughts about whether disposables should be banned or not, or banned today or banned in the future?
Yeah. Can I give my experience from some of the things happening in Malaysia as well? We see that some of the studies shows that most of the people or the age category or age brackets that use disposable are the young or adolescent, and these are one of the main reasons is because they can purchase this at a cheaper price. You know, the youngsters do not have enough money, so whatever budget that they would use to buy disposable, which is going to be very small, compared with the money that you actually devote. So let's say you buy a pot, you know, it's more expensive. The concentration would be higher, so this is dedicated for more adults, and pots are not sold, you know, just at the corner store. So disposable are very, it's a ticketing because not only that they vape sometimes in school, but it's easily concealed. So this is one of the reasons where we, in a way, it's a good thing is that we plan to ban, or there's going to be some plan to ban disposable. I do agree that for adults, disposable may have some use because, you know, you have like, you know, access, you can actually use it once you need it, things like that, rather than pot. But then because of the issue of youth in Malaysia, this is one of the reasons that they plan to sort of ban the disposables. Maybe concentrate more of allowing pots or closed system where you have high concentration, but more oriented towards the medically prescribed prescription model as what Australia has done, which is again worrisome as well, because then you see that the trajectory will not be as smooth as in UK and also New Zealand. there's less market for HTP. I'm just saying out loud. No, there's less market for HTP in Malaysia because one of the reasons is that it's quite expensive. So the market would be more of affluent and so-called higher income bracket in Malaysia.
Right. Harry, you got a global perspective on this. I mean, what do you think about banning disposables or not?
Somebody in that last session that we were both in made a very good point about the fact that there's kind of the end game on this is reducing death and disease from smoking and trying to get people who are currently smoking to switch if they can't quit altogether. And every so often things get thrown in the past in front of people who are advocating this. You know, it's popcorn lung, it's Ivali, and now it's disposables, you know, with the, oh my God, the young people are using it, and oh my God, look at the environment. And the environment is now the latest kind of wagon to which you hitch your objection to disposables, because it's what everybody's kind of talking about. So I think we've got to be a little bit careful about kind of rushing to think, oh yeah, we must ban disposables. I've actually heard about hybrid products that appear to be sort of disposable but not, so that they are rechargeable and you can refill them, but only for a certain period of time. So they're a sort of so in the end they become disposable, but initially. So
it's possible if you ban disposables, these ones will sneak through by saying, well, we have a rechargeable battery that lasts for a little while.
So there were going to be kind of workarounds. As far as legislation is concerned, much of what we hear about banning this and banning that are what I call foghorn politics. Right? They play well as sound bites, and you tick various kind of political boxes. But ultimately, of course, it comes down to enforcement. And certainly in the UK, the police absolutely haven't got, you know, the numbers of policemen in the UK have been slashed by thousands since 2010. So they haven't got time or inclination to go running about and checking whether some shopkeeper down the road has been selling vapes. Trading standards the same. They're the other people with the responsibility. Huge cuts in budgets for trading standards. So if you're going to put this kind of legislation in place, you've got to have the enforcement in order to make it work. Otherwise, it just becomes you're just ticking boxes.
Yeah, Fiona.
I don't agree with it. I think there's ways that we can address some of the issues around disposables. So whether that's youth access or whether that's the way they're disposed of. So I know last year there was a number of conversations around what you could make a disposable from and the different materials that you could use, or there was conversations around recycling and whether, you know, we could start seeing recycling models being implemented. You can only do that in a regulated market. You can't do it in an unregulated market. I think, you know, for myself, it was a disposable that got me off cigarettes and onto vaping. Now I've moved away from disposables, but it was my introduction to vaping, and I think I'm not alone in that for many smokers it is an entry point into vaping. So I do think it's an important tool, but I do, you know, I get involved in, you know, litter when you go and pick up the trash in parks and things, and we count the number of disposable vapes, and they outnumber the number of cigarette packets now substantially.
Right. You know, actually, Tommy from Ireland, who chaired the last panel, also made a point I hadn't heard before. It's not just young people who are disproportionately drawn to disposables. He said it's also the quite elderly. They just like the simplicity of it, which is something I hadn't thought about before. Now, what about flavors? Right, I think we generally see flavor bans as basically not well, you know, and that basically we know that, you know, offering other flavors, non-tobacco flavors, actually helps people quit and helps them stay quit. On the other hand, you know, I've heard people say, well, if you're going to ban anything, at least ban child-friendly names like, you know, toadstool vomit shit or Captain Crunch or whatever it might be, and that there might be some limits on the flavor. Any thoughts? Is there any rhyme or rationality for limiting any flavors, or are there really such thing as the super child-friendly flavors, not just names? Harry?
I think the industry has got to look to itself to a certain extent. I mean, there is no real reason for having something called iced coconut explosion or something. I mean, I'm not a vapor, and I don't know about the flavour, but I honestly know whether you can tell the difference between hundreds and hundreds of different flavours. I think in New Zealand, I think they've come up with about 60 proprietary names that you can use for flavours, which includes things like cherry, strawberry, vanilla, chocolate, and so on. And also names that you can, descriptive names. So you might have, warm custard so that a set of descriptions and a set of flavours. And I think that something along those lines would help to undermine this, this what I said earlier about de facto bans, because if you ban flavours, you only allow tobacco and menthol, or you might even only allow tobacco, then you're really, cutting the feet from under people who are looking for, an encouragement to switch. On the other hand, you don't have to have a company making 500 different flavours, I don't think.
Other thoughts from the panelists about the flavor issue?
I mean, I'm a hard no. I'm an American, okay? We have our First Amendment right. We can, make what we want. That's why we don't have plain packaging, cigarette packs. But I think the bigger question is, what is kid appealing? And how do you determine what is a kid appealing flavor? I mean, what do you do, some focus groups and find out, these are adults and these are kids? I imagine you're going to see the similarities of who've both found it appealing. It's going to be about the same. Like, oh yeah, that sounds really great. That all sounds really terrible. And you also just don't see it in other, adult age-restricted products. I mean, alcohol is probably the best example, especially when you see, the seltzers or whatever, and you look at the flavors that they have, and those are all sweet, and they're not getting accused of marketing to children at all.
They are in Australia, of course.
Oh, well, not in the States.
I think, if you have a regulated market where the product is regulated and being sold to adults, then adults should be able to have that choice of flavour. It's right now when it's an unregulated market and it's so accessible to children, and there's a perception that the industry is marketing to children. Now, I don't actually think that's the case, but because we have made it so easy for children to access this product, there's now a perception that we're trying to sell it to them.
I see. Yeah.
Same. I think it's the same opinion from my side as well. In Malaysia, most of the youth are really engaged with all the flavors, and but we do understand that flavors play a role in smokers quitting, but also staying away from cigarettes. We have samples from our studies showing that they switch to some form of flavors, and they are, once they sort of switch successfully, they would actually use vape products that do not have nicotine, but do need the flavors to maintain themselves. So we see the role there, but unfortunately, so does the kids. So this trade-off, but some of the things that the government would actually propose is the restrictive flavors, meaning that you concentrate on the mint, menthol, and tobacco, which is very restrictive, because then you will see, I would foresee that some of the smokers would actually go back into smoking.
Yeah, it seems that. So, both, I think a couple of you have mentioned already, either in private conversations or on stage, vaping is not just about nicotine. We know that in cannabis, it's been a huge thing, and certainly we know that if you're a heavy user of cannabis or using it medically, there are good reasons not to smoke it, but rather to vape. I mean, if you're a moderate user, it doesn't make that much difference. But we know, in fact, the company that invented Juul initially was in producing cannabis products, sort of heat not burn, the packs, a heat not burn version for cannabis. But we also, I think, did you mention about vaping? Was it ketamine? And then Lindsay, you were half joking about vaping when it comes to fentanyl, which, for those of you who don't know, fentanyl and the overdose issue in the United States, last year, almost 100,000 people died of overdose or fatal drug use, most of it involving fentanyl. And just to put that in perspective, it's if you add up all of the automobile deaths in the United States of driver, pedestrian, and passenger, and then you add all the gun deaths in the United States, both homicide, suicide, and accident, that still only adds up to about 70 or 80% of all the overdose fatalities in the US. So it's a monumental issue. And there are arguments that, in fact, if you can move towards vaporization, we might be reducing fatalities with fentanyl, and especially if it was regulated. With ketamine, there's a growing evidence about its medical efficacy in helping with intractable depression and pain, but also a growing problematic use issue on the recreational side. There was the intersection with the cannabis thing, right? When EVALI happened, it was about illicit tainted THC cartridges, and then governments bizarrely cracked down on the legal, vaping markets, which just seemed about as ass backwards as one could be. But what are your respective thoughts about how vaping relates to all the other substances apart from nicotine?
We've, of course, in Australia, the prohibition on vapes and the importation of vapes has had the unintended consequence of prohibiting medicinal cannabis patients' access to vapes. So we've now, so we've got this ridiculous situation where we've got medicinal cannabis, and we know that vaping is a great way for medicinal cannabis because of the titration and the very fast titration that you get from vaping as opposed to edibles or to oral, to other forms of consumption of it. So so now we've got medicinal cannabis patients who are being forced to smoke their medicinal cannabis. And as you say, when you're a sick person using medicinal cannabis, this is the last, really the last thing that you should want. And we talk about we actually talk positively about vaping when it comes to cannabis. And we talk about vaping as a harm reduction. In fact, some of those same public health organisations that oppose tobacco harm reduction speak positively about reducing harm with cannabis use by vaping. So yes, we've got a perverse situation now in Australia.
In some other place. Lindsay, thoughts about that?
I think science is missing out on a very big opportunity to look at ways that vaping can deliver a lot of other things, not just, substances, maybe vitamins, maybe nutrients, and especially in low to middle income countries that, might not have access to hospitals, that, you could come up with a med, back of, vapes and, give these people something. So I think that there's so much hostility towards vaping in general that we're not really looking at the science and how it can be used to actually deliver more than just nicotine or substance, illicit substances.
Right. Sharifa or Harry, any thoughts?
Same here. Cannabis simulation is considered illegal. It's still considered illegal. There's no such thing as consumerism, cannabis, and so on. Of course, there's certain purposes like medical and so on. If you have in your possession more than 200 grams, you're considered pimping it. You might actually have consequences such as hanging and so forth. So it's very strict at the moment. So what happens is that some of the very innovative ideas come about where you sort of vape cannabis. And they like that because you don't shoot up in your venous system, so basically you're clean, and the delivery system is quite efficient. So it's coming up. We don't really know how big is the problem yet. We assume that this is going to come out higher and higher, and now we have the issues of synthetic drug as well. So again, we don't really know how big is the problem of youth or users vaping substances.
Okay, Harry, any thoughts on that one?
Surprised you can actually vape fentanyl.
Say again?
I'm surprised you can actually vape fentanyl, to be perfectly honest. The only reason I say that is because when people tried to smoke heroin in the 70s and 80s from the Bermuda Triangle, not from Bermuda Triangle, from the Golden Triangle, you just finish up with a black sticky mess. you couldn't actually smoke it. It wasn't until the heroin came from the Middle East that that's chasing the dragon. So I'm not sure how easy it is to do that. Same with ketamine, actually, but because they're not manufactured to be smoked. To the best of my
Right.
knowledge.
I mean, there's also, we'll have to see also what happens with the issue of nasal inhalers, which we're not really doing in the issue of But you know, I just had a wonderful ketamine experience not long ago that involved a nasal inhaler.
Okay.
So you know,
I suppose the other thing to say,
but you know that each squirt is like 28 milligrams or so. So you're getting the dose exact, and I can well imagine that whether it's vaping or nasal inhaler, that you could get down to a precision of dose, which could reduce, not just remove the impurities that you get, and not just remove the problems of smoking or the risk of injecting, right? But one might think that evolving technology on both nasal inhalers and vaping might actually be a major harm reduction advance with respect to a whole bunch of substances.
But I mean, you would need, regulation and controlled medicinal products for that to actually happen. I think at the moment, as soon as you hear the word vape, it doesn't matter what you've got in it.
Yeah.
The hackles rise and people go, oh no, we don't want anything to do with that because it's
Oddly
vaping.
enough, in Australia, we have 2 approved medical vape devices for cannabis. None for tobacco or nicotine, of course, but we do actually have 2. The Volcano, which I don't know if anyone's seen that device, but
this is a device created about 20 years ago, I think, or maybe more, by a German firm. It looks like it's actually large, about this big, looks like a kind of flying saucer. But if you walked into any of the medical cannabis dispensaries, even 15, 20 years ago, they were on every table because heavy users were encouraged to use those and to vape rather than to smoke. Yeah. Okay, so I have 2 big final questions, and then I hope I'll leave a few minutes for some questions, and I'll walk around with the microphone here. So on the issue of prohibiting cigarettes, and I revealed some of my bias before, but it seems to me in the tobacco harm reduction community, there's 3 views. And by prohibiting, I mean either outright prohibition or the proposals you're now hearing in a number of countries to reduce the nicotine content in cigarettes to so low they're effectively almost without nicotine, right? So they become of virtually no appeal to most people. And there's one group in the tobacco harm reduction world which says, you know what, they're so deadly, so addictive, just ban them. And then there's a second group which says, don't ban them right now, but as soon as we have enough openness on harm reduction non-combustible products, and as soon as use is getting low enough, ban cigarettes then, and that'll help push the remaining people over. And then there's a third group which says, even if you have a very smart, progressive, thoughtful harm reduction tobacco policy allowing all of these variations of pouches and snoozes and heat-not-burns and things, still don't ban it, because there's always going to be some people who want to smoke, and the negative consequences of banning that, you have no idea what will happen. So to ask each of you, I don't know how much you've thought about this question, but where do you come down on that, Fiona?
No. Prohibition has never worked on anything. So why would we think it would work on cigarettes? It will open up a black market inevitably, and that will prove to be more dangerous. I think, certainly great further restrictions on point of sale and other sort of controls will probably come in, but I can't see why prohibition and even the New Zealand idea that anyone under 18 today will never be able to buy a packet of cigarettes. It will fail.
Lindsay?
I'm a big no. I've done a lot of work on the proposed menthol ban that they want to do in the states that got shelved recently this year. But the data even shows in the states that have done menthol bans that it hasn't led to a reduction in smoking rates. In California, there was a really good study where they collected trash out of discarded cigarette packs out of the trash, and it only reduced the menthol incidence by 12%. Mind you, menthol cigarettes are not allowed there at all. So you're always going to have black market, and dangerous actors who are going to, use this black market. And I just can't imagine drug cartels, selling cigarettes. I mean, and it's all started because of the government trying to,
Right,
you know,
right.
protect people. So yeah,
Yeah.
no.
What about you, Sharifa?
In an ideal situation, I would say that we ban everything and people would listen. Unfortunately, even our own children will not listen to us 100%. So I don't think that it will work. It will never work. Even some of the low middle income countries is sadly to say, some of the countries that we have approached. I think we went with a few professors as well here. They just mentioned straight outright that we need the tax money. So if the government says that, you're basically, you know, your hands are really tied. You know, how can you say don't smoke or vape when your government says that we need the tax money? It contributes to about 30% of our GDP.
Yeah,
That's the
and
real
I guess
world.
that's what part of the bizarreness of China, where the tobacco industry is the second greatest source of government taxation revenue even today. And anyway, we'll leave that for another panel. But Harry?
I think Bhutan is the only country in the world that ever tried to ban cigarettes and smoking.
And they reversed that recently,
Of course
right?
they have, yes,
Yeah.
because people either went across to neighbouring countries and brought it back, or it was just smuggled in. I mean, already the global illicit market in tobacco is huge. I mean, there are some countries where nearly all the cigarettes that are coming in are either illegal because they haven't paid the tax, or they're just kind of, you know, I think they call them whites. They're just kind of knockoffs, you know, that look like real cigarettes.
Yeah. I have to say, I mean, I've heard people say, well, if we can get smoking down to under 5% of the population, then why not then? And the point I make to them is, you know, if you look at the global illegal drug market, the one that explains, you know, these vast levels of crime, violence, and corruption in so many parts of the world, and the violations of human rights, and the mass incarceration in the U.S. and other countries, that apart from the marijuana issue, which accounts for a lot of arrests, but not that much incarceration, that almost that entire problem is generated by barely 2 or 3% of the global population consuming heroin, cocaine, methamphetamine, fentanyl, what have you. So even a very small percent of the population desiring a global commodity that is illegally produced and marketed can generate a vast, terrible problem. And then I think the other thing that could well happen, you know, in the United States, where, you know, we have almost as many guns and automatic weapons as we have citizens, but one could really imagine that if you went to prohibiting cigarettes, one could well imagine a lot of these, you know, paramilitary, right-wing, Trumpist, you know, groups basically beginning to see trafficking in cigarettes as not just a lucrative source of income, but as a moral cause against the paternalistic government taking away my right to put in my body what I want, and if I'm going to traffic it, so it would be combining for them a moralistic cause with which many other Americans might agree on the core principle, and then with a huge source of revenue that could be remarkably destructive. Which leads to the last question. You know, part of what drew me to this was the connections that I saw between the whole drug policy reform movement and illicit drug harm reduction and this area. And to some extent, you know, my own view that I was going to be damned if, after having played a major role in helping to legalize cannabis in the U.S. and some other countries, I was going to go to my deathbed, you know, seeing a whole new global war on drugs directed at tobacco and nicotine products, right? You know, with narcotraficantes replaced by tobacco traficantes, and the DEA replaced by the TEA, and massive surveillance and drug testing and all of this sort of stuff, right? But I've also noted that if you look at some of the people involved, it's not just myself who's been involved, in drug policy reform and harm reduction since the 80s, but you look at the founder of the International Harm Reduction Association, Pat O'Hare, his successor, Gerry Stimson, who founded this organization, Alex Wodak, the founding chair, I believe, of International Harm Reduction Association, which is now called Harm Reduction International. You look at David Sweener, who came into this area. You look at Clive Bates, who was on the advisory board of the British reform organization Transform, right? You look at Mark Tyndall in Vancouver doing cutting-edge harm reduction, and all of a sudden coming to the field of tobacco harm reduction because he realized he was helping to keep people from dying of HIV or Hep C or overdose, and they were ultimately going to die of cardiovascular disease or lung cancer related to their smoking. So there's been this connection, and some of you have been part of this. Now, At the same time, one sees, especially among a younger generation of harm reduction advocates, a reluctance to engage with tobacco harm reduction, in part because it's big evil, big tobacco, and therefore they shut their eyes, in part because the issues of racial injustice, which are so prominent in much of the drug war in the US and other countries, are not present here. But I'm wondering about in terms of your own interactions. You know, we look in Australia where there's been a movement against the drug war in favor of harm reduction, but less on cannabis. In the UK, which was a leader on some harm reduction, but also like Australia, slow on cannabis reform. Malaysia, you know, which until some years ago followed Singapore, but now has discussions around the decriminalization of drug possession and some harm reduction. The US, which is so mixed. What are your own experiences and thoughts about the relationship of this tobacco harm reduction movement to the broader movement for drug policy reform and harm reduction?
You know, we hosted the International Harm Reduction Conference in Melbourne last year, and we tried to get tobacco harm reduction onto the agenda without luck. You know, no one was interested. And then, you know, I'm on the board of the supervised injecting room in Victoria. Now, 80% of our clients smoke. You know, we're talking, you know, we'll prescribe the methadone. We're talking about trying to prescribe hydromorphone. Do you think I can convince the doctors around prescribing nicotine? No. You know, so we try and say, just say no to smoking to our clients who we are readily trying to find other opioid replacements or other ways to treat their other drug use. So it is, I don't understand, well, I mean, I do understand, but it is so frustrating. Yeah, I was around in the 80s as well, you know, on working in volunteering in needle exchanges and working on sex work reform. But we cannot seem to have that conversation about tobacco in the harm reduction field, and it's really frustrating. And even, you know, I was speaking to one of the heads of a harm reduction organisation before I came, and he has been involved in harm reduction for decades. Also was part of the international harm reduction, but will not have a conversation with me about vaping.
Wow. Lindsay.
I call it the harm reduction hypocrisy, actually, is what it is. That you can have harm reduction for a lot of things, that we recognize it, you know, with, you know, heroin, especially in the United States and certain parts of it. But, you know, seatbelts is a harm reduction product, and we, you know, don't kind of factor that in what we do to, you know, make our risky behaviors less risky. But I do think it kind of does come from this vitriol against big tobacco, but more so the people who smoke. They just don't seem to have any love in the world at all, and I think that comes from the World Health Organization, and they underscored it very well this year at the end of COP10, where the Secretariat was like, you know, the interest of, you know, even the people who smoke should not come over one child becoming addicted to nicotine. So it's harm reduction hypocrisy pretty much, and just and not caring about the people who smoke.
Same situation in Malaysia as well. Harm reduction has been supported in a way for Malaysia medical harm reduction, things like IBDU users, needle exchange program, even the pre-exposure prophylaxis for HIV patients and LGBTQs and so on. But not on tobacco is even seen as you know, something more sinful. We had a harm reduction conference, and we sort of have to hide the tobacco harm reduction into it. Even though most of the findings are actually presented by scientific prominent leaders in their field. I think this is seen as something sinful because nicotine is supposed to be addictive. But if you look at the spectrum, and we keep repeating that, you know, this toxicology report, the spectrum analysis, you have to compare with combustible cigarettes, but it's an uphill battle, and but we have to start somewhere. And I think Dr. Alex Wodek sort of gave me and a few of us motivation, saying that you have to start somewhere. This is what happened with us during the methadone replacement therapy. So don't give up. You know, it's gonna reach somewhere someday. You know, but until that fine day, you know, some of us may have retired and so forth. Yeah.
Right. Harry.
I agree with Fiona. It's immensely frustrating and tragic in many respects, because Lindsay said, you know, that seatbelts are an example of harm reduction. I kind of disagree. Yeah, it's more an example of health and safety. As far as I'm concerned, tobacco harm reduction, drug and HIV harm reduction are all of a piece, because it's all about civil liberties and human rights. And that's why these interests should come together. And the main problem stopping it from the tobacco point of view is the link with the tobacco industry. I don't think there's any doubt about that. I mean, if the main drug harm reduction intervention had been, say, for heroin from a Mexican drug cartel, I kind of feel that probably drug harm reduction wouldn't have taken off either.
Yeah, no, it really does. You know, it even seems to me that it's not just that this tobacco harm reduction has to really be as proactive as possible, and obviously many of those of us who have crossover can, you know, play a leading role. But it's not as if the international harm reduction movement is that powerful, but it's gained traction over 25 or 30 years. And, you know, the notion that when you have an international conference on drugs or AIDS, you know, the slogan, "Nothing about us without us," is being used by the activists and others to say we're part of the conversation. But you can go to the COP 10 or the Panama meetings, the others, and there's no activists there. You know, that resistance of the international harm reduction folks, that needs to be overcome. I think also, as Harry is saying, that, you know, a lot of times define, you know, what is harm reduction? One definition of harm reduction is where public health and human rights intersects. It's at that intersection where lies harm reduction. And I even think that, you know, I look, for example, at the way in which there's been reductions in funding for harm reduction programs around the world, you know, as George Soros' Open Society Foundation, which was the major private funder of harm reduction around the world, putting in hundreds of millions of dollars over the last 30 years, as they're pulling back to focus on the greater threat to open societies, you know, presented by authoritarian regimes and right-wing populist movement. But it almost seems to me that one should make the pitch to the big tobacco companies. You want to start paying for harm reduction, not just with tobacco, pay for it in other areas as well. And if you look at who are the highest rates of smoking, Fiona, you just said this, you know, here's the average population in many countries in the developed world at, you know, 12, 14, 15%, in Asia at 25, 40, 50%. But if you look, you know, obviously it's lower income people, and then you get indigenous people, and then you get people with mental illness, you know, neurodivergent people, and then at the very top are people who are going to harm reduction programs, illicit drug users at 60, 70%. So the argument for introducing tobacco harm reduction in illicit drug harm reduction programs is overwhelming. And so I think we really need to go to a greater unification here. Now, we have a few minutes left for questions, so I'll see if you have a question, just raise your hand or try to make your way to the aisle. And just say your name and where you're from. I'll hold it. Stand up.
Hi, Rebecca Taylor from the UK. I just wanted to ask a further question about the enforcement issue, because it's definitely a problem in terms of disposable vapes, because a lot of the ones that they want to ban are already illegal anyway. So, you know, it's nonsensical.
Yeah, go ahead.
If you're following the United States, they're having a major problem with enforcing it. The FDA just launched a multi-agency task force on Monday to working with the DOJ, a couple of other things. I think they're trying to get the DEA on it for some reason, you know, to really go out and attack them, because all they've been able to do is really kind of issue penalties, civil monetary penalties. That comes after warning letters. They've only issued a few injunctions, but I do know that they're discussing, I guess the DOJ is discussing criminal penalties on retailers or manufacturers of the illegal vapes.
Fiona?
I mean, in Australia, it is illegal to possess nicotine without a prescription. And less than 10% of the 1.7 million vapers in Australia have a prescription. And I spoke to the police about this. I spoke to the head of the police association a few months ago and said, you know, every single person you pass in the street is committing a criminal offence. They're in possession of a Schedule 4 drug, and there actually is penalties that include jail penalties for it. And he, you know, shrugged his shoulders. So we're not seeing that enforcement.
I imagine the real issue will be if they start creating dedicated police agencies to focus on this, then you'll see people with an institutional interest. Yes. I'll hold it.
Riccardo Polosa from Italy.
I think the case of Bhutan, it's really interesting. It's a reversal of a ban, and I think there's a lesson to learn. Lesson to learn for those who have banned vaping in their own countries. Question, is anybody actually tracking the smoking prevalence and the vaping prevalence in this country that they are actually banned the vaping? Because I think they'll be ready for surprise in there.
Mm-hmm. Harry, do you have an answer to that?
Well, yeah, I mean, I'm sure if you look at global burden of disease, WHO statistics, you can identify the countries, that have banned vaping and have a look and see what's happened to the smoking rates in those countries. What's a lot more difficult is to get data on the number of people who are actually vaping. I mean, that is a big problem. It's something we talked about in a previous session, because in order to make the case in terms of advocacy, you've got to have some pretty good statistics about the numbers of people who are vaping. I mean, there's an estimate for Thailand of about 1.5 million people. Quite a complicated methodology, I think, around that. But you need those kind of statistics in order to try and make the case if you've got legislations that are, looking to ban or looking to over-regulate. But the smoking statistics are definitely out there, and you can match those up against countries that have banned vaping.
Just quickly, I mean, Australia's plateaued as a result, so our smoking rates are not going down like our brothers and sisters in New Zealand. There's an online question here. The Taiwan government is discussing to make vaping at level 3 narcotics. And that was in yesterday's news. So another country bites the dust, and I think probably they're asking for our comments on that.
Yeah. Okay, last question.
Thank you, Professor Mārewa Glover from New Zealand. I would like to know what you and the panellists think. There's this latest sort of narrative that is flooding the tobacco control literature from pro-prohibition, anti-vaping authors, and they claim that the term harm reduction is a tobacco industry strategy. Tobacco harm reduction, and harm reduction is a strategy. What's your comments and suggestions on how to respond to that?
Okay, thanks, Maria. Any comments from the?
I think my comments are probably unrepeatable. I mean, that is just rubbish. I mean, I think I mentioned earlier, I think that the WHO had come out with a tweet that suggested that, vaping was as dangerous as guns, because both are quotes, designed to kill, unquote. This is a tweet this week from the WHO, and I think this sounds to me like the politics of the desperate. I think they're losing the argument all the way around, and to suggest that harm reduction is an industry construct is just plain daft. I mean, you've only got to look at the history of drug and HIV harm reduction and actually read the literature to see that there is this continuity thread between the lot, and it makes sense. So I would, yeah.
I mean, I just think it's a sad state of affair when it's, the tobacco companies who are actively working and spending millions of dollars to make a less harmful product and to help people quit smoking, and it's the World Health Organization that is blocking them from doing that. So it's just a sad state, and I do think they're getting super desperate as well.
And it's politically popular, as you know. I mean, just if you can put big tobacco into the sentence, everyone, it's a very simple, disingenuous way of minimising tobacco harm reduction, and we see it constantly in every sentence by our health minister. He puts big tobacco in every single sentence when he's talking about vaping. And even if big tobacco, certainly in Australia, I mean, Philip Morris actually is involved in the vaping industry in Australia, but they're the legal product that the government approved. So the government approved the big tobacco's vaping product. It was everybody else's vaping product that they banned.
No, I think those are all powerful points. And look, the fact of the matter is, for those of us who've been involved in harm reduction for decades, just standing up and saying, we defined that term, and we are saying tobacco harm reduction is part of our world. And when you who are pursuing the nicotine abstinence-only ideology start making things like saying, well, something's not safe, when harm reduction is all about being safer, you're being disingenuous and hypocritical. So I just want to say finally, you know, as somebody and as many of us coming from the broader drug policy reform movement, I very much hope that all of those of you who are solely involved in tobacco harm reduction will please make those efforts to reach out and to see yourself as part of the broader drug reform, harm reduction movement, and to avoid in your own advocacy distinguishing or saying critical things about what's happening on cannabis reform or other areas of illicit drug policy reform. It's important to see that we're all part of a common community committed to basically the principles of harm reduction and to minimizing the harms of drugs and the harm and the negative consequences of the policies themselves. It's also to be said that in using our language, our rhetoric, I never refer to our opponents as the tobacco control folks and us as the harm reduction folks. In my view, we're all about tobacco control. We're all. But they're the abstinence-only tobacco control folks, and we are the pro-harm reduction tobacco control folks. Remember that tobacco control is a positive phrase. People, the general public, like the notion of something that they see as dangerous being seen as, being controlled. Therefore, let's own tobacco control, but we are the true tobacco controllers because we embrace the full spectrum and include harm reduction. We are not the ideological abstinence-only ones. Finally, come back here at 6 o'clock for the Michael Russell Oration. Cliff Douglas, my fellow American, who has just taken over the organization that was called the Foundation for Smoke-Free World, now called Global Action. He should give a very good talk. I think what will be able to do will help catapult this movement to the next level. Thank you, Fiona, Lindsay, Sharif, and Harry.
Hi, everybody. Welcome back to our live coverage here at GFN 24. I'm Brent Stafford, host of RegWatch by regulatorwatch.com and GFN Interviews. And I'm here with some guests that are all Commonwealth countries. Is that correct?
Yes.
I think we all have the Queen, well, now the King, on our currency.
That's true. So you'll have to excuse me. I can barely speak. There's been so many interviews that I've already done today for GFN Interviews, so I'm going to use my script here a little bit too. So joining us today for this special half-hour live panel discussion on what's wrong with the Commonwealth are three eminent commentators and hopefully soothsayers. Representing Australia, we have Fiona Patten, harm reduction activist and former member of Parliament for Victoria in Australia. And representing the United Kingdom, we have Martin Cullop, prolific writer and harm reduction advocate and international fellow at the Taxpayers Protection Alliance. And representing Canada is Maria Papayawanu, national vaping activist and harm reduction activist. So, man, are we going to be able to fix what's going on, what's going wrong?
Personally, I just think we should become a republic and leave the Commonwealth, but that may not fix Australia's problems anyway.
Martin?
I don't know what to think. It's a shame that the Commonwealth countries seem to be going backwards in this respect on harm reduction, but some countries in Asia, Latin America and smaller countries in Europe are stepping forward in the right direction. So it's a bit disappointing.
Maria?
I think we just, again, I learned something today, and it makes more sense. The role of Minister of Health politically is a stepping stone or a stepping down for a politician.
Oh.
And if we think about it, Minister Mark Holland was this great leader. Minister Mark Holland, for those of you that don't know, is the Minister of Health and the one that has decided that vaping he has to get rid of. Was the leader, had a lot of roles. He was the whip at one time, had a lot of big roles in government, and now he's been stepped down to the Minister of Health. I think once we get rid of good old Marky boy, we might be on the right path again.
So I think it should be said that, of course, there are other countries in the Commonwealth, and some pretty big ones like India, but there's a specific thing that we're trying to get at here. Maybe it's the white progressiveness that is in our countries, but there's something uniquely strange and special about Canada, Australia, and the UK. I'm hoping that we can tease out what that might be. In Canada, of course, we've got a flavor ban potentially coming down. In Australia, well, you've abandoned harm reduction.
Yes.
Yeah, totally.
Well, yes. I mean, certainly for tobacco anyway.
Yes.
For other drugs, we're actually moving in the right direction.
So why? Well, and that's typical in all three countries. Let's start there. Why? Can you explain that contradiction?
You know, I can't explain it, but we have, so for example, we have 2,000 opioid-related deaths in Australia, which I know compared to North America is a small amount, but we have 20,000 deaths compared to tobacco. Now, we will open up supervised injecting rooms to ensure and to help people not die from an opioid-related overdose. However, you know, 80% of those people also smoke, but we would rather they were just abstinent in their smoking, but we will give them methadone or hydromorphone, we will give them an opioid replacement. I think it's a moral issue. I think there's some issue that people who use other drugs can't help themselves, where people who use tobacco just should know better.
Martin, let me just first add that, you know, for the longest time, the UK was really seen as the bastion of common sense and leadership when it came to vaping and safer nicotine products, but that's not the case anymore, is it?
Well, yeah, I mean, every year we come here, poor old Fiona has to apologise for Australia.
Right.
So, but this year I've got to come and apologise for the way the UK is acting at the moment, which is...
It's only because you listen to bloody Australia.
Well, that's one aspect, yeah. There was, I was going to say, you know, that the government we've got, I think, is fairly weak, and that's just not the governing party. All of the parties seem to be weak on this. The media last year, almost there was a firing gun started, and from the 1st of January 2023, we had an avalanche of bad media about harm reduction. There was one day in about March when it was getting to a real peak, and the Daily Mail had 3 anti-vaping articles on the same day. It was amazing. The Times has gone massively anti-vaping. The Guardian always really has been. All of the tabloids, everyone seemed to be attacking vaping, and it all because there was an uptick in youth vaping, but this media was incessant, and I think we've got such weak people in our parliament now that they caved, they collapsed to all this pressure. They didn't even wait to see if this was a blip. They didn't wait till the next youth vaping numbers came out. They've just been pushed into it, and so they were talking to the wrong people. We had public health who were still saying these products are fantastic. Don't throw the baby out with the bathwater. Don't kill the golden goose. But they're not listening to them. I don't know who they're listening to, but for example, we had a proposal in the budget in March that the Chancellor said he's going to bring in, this year, he's going to bring in vape duty, a duty on vapes, and it's a massive, massive amount of money. It doubles the cost of a 10ml bottle of, more than doubles a 10ml bottle of liquid. And when you look at the documents behind it, it's quite clear that has been nowhere near anyone with public health experience. They haven't been talking to the right people. And I seem to think that they are talking to the wrong people. They seem superficially to think the Australian experience is a good one. They think that sounds feasible, prescription only. That's how to keep it out of the hands of kids. And so they're talking to those people rather than talking to the public health who would like to talk to them but aren't getting access. And I think it also comes down to we have weak leaders at the moment who just don't like being seen an outlier. They don't seem to recognise that instead of being a bastion and a world leader in harm reduction and something that the world is looking towards for guidance, they seem to think that they're an outlier and they need to just go along with the herd. Right. And I think that's making all the wrong decisions.
Maria, Martin just mentioned taxes, vape taxes. Now, Canada, we talk a lot about flavor ban. I want you to explain exactly what's going on with that. But importantly, there is a massive tax increase coming too as well.
Yes. So here's the parts that we don't understand. Obviously, one minister isn't talking to the other. So our Minister of Health isn't talking to the Minister of Finance. So in our recent budget, there's a lot more going on, but we'll stick to the tax. They increased the vaping tax by 12%. However, this vaping excise tax, there was an offer made to the provinces, states, for those of you that don't know what a province is, that if you want to join our program, you can match it. So what's happened now is many provinces have offered to match the tax, which is, for some products $20, so it goes up by another 10. So taxing is about 10, plus another 12% increase. So we're looking at, and I do bad math, so you guys, this is my math, 124% increase. That's what I'm going to say it is. Like that, July 1st. Very little communication to have that done. So then, great. So we have this tax. We have all these provinces going in because it is millions upon millions of dollars. For a country like Canada, that's great. Let's add to the fact that our wonderful Minister of Finance said, let's have a national drug program so everybody in Canada gets free drugs. And before you ask how I'm going to fund this, I'm going to fund it from this 12% increase on the vape tax. So great, we are going to fund drugs for everybody, which I have no problem with that. Then comes Minister Holland. Who has the Mark here who's the noisy one? Mark Butler. Yeah, so we both have a Mark. Yeah. So then Marky Mark, Pinocchio, whatever you want to call him, says, I'm going to ban flavors. And so here's the problem is we have this huge increase in tax, which is fine. Then we have Marky Mark saying, I'm banning flavors. We have our Minister of Finance, Jeff Freeland, saying, we're going to fund our drug program with a vape tax, but there's nothing based on the flavor ban that will be available on the market because currently there's not a single product created by any of those ingredients. So literally everybody's lying to the Canadian public and no one cares. No one cares because it's about people who smoke and our systemic beliefs as a nation have carried over. And this is why you can pick on people who smoked, but not any longer, because right around this world, People who have switched to vaping are getting educated, and through that education of understanding, they feel empowered, and empowered allows them to be engaged. And you can see that happening over and over and over again. The more we educate and the more we're educated on a topic, the more empowered we feel to speak up. And it kind of shocks them when we do things. So we're all over the place in Canada of lies, and so we're never going to get free drugs, and we're waiting on vaping.
Well, so let's talk about the weakness, and I want to turn this to Australia because it seems that Australian legislators and public health and tobacco control there are projecting strength, but is it really strength?
Absolutely not, and it's hubris. You know, it's around, well, we beat big tobacco and we can do it again. Now, we have approximately 1.7 million vapers in Australia. So, no, they haven't stopped vaping. I mean, certainly they don't tax it because the motorcycle gangs sell the vapes. It's criminal organisations that sell vapes. So they have completely lost it. But they don't particularly care. They don't particularly care. They can tell the mothers at school pickup that they're doing what they can to protect the children. Meanwhile, they're not caring about our Indigenous population that has 40% smoking rates. They're not caring about the low socioeconomic people in the outer suburbs who have got 30% smoking rates and cannot afford the $50 a packet it costs for tobacco. Well, they don't pay that because they buy the illegal tobacco from the crime gangs and the biker gangs for $10 a packet. So they're losing tax. They have left this large growing market to criminal syndicates, but they're being tough on big tobacco, with the one exception that we have 2 legal products in Australia that you can, if you happen to have a prescription, if you can happen to find a doctor, afford the $80 it costs to see the doctor to get a nicotine prescription, and then find a chemist that will sell it to you. It's a Philip Morris product. So the actual only product is a big tobacco product.
Right. So is the hatred of big tobacco the thing that joins, all of us together in the Commonwealth?
Yeah, maybe.
I don't think they hate big tobacco. Here's my theory.
Okay.
I think they like big tobacco because they're an easy, controllable enemy. Big tobacco, first of all, who's scarier? A CEO from a tobacco company or the CEO of a biker gang? So our Minister of Health, Marky Mark, said, I will find you in any dark corner and I will get those tobacco company guys. Dude, you're not doing this with the Vietnamese mafia that's going to be selling fentanyl-laced vapes. I'm going to get in so in trouble by the Vietnamese mafia one day. I don't even know if one exists. But he's not going to go after gangs, and that's the same thing. Yeah. They love big tobacco. They love the money that they get from them through the taxation. And then they also love the fact is that they're easy to control, they're easy to manipulate, and they back down. What tobacco company stands up against the government? Very rarely.
Yet, though, big tobacco is the foil for the minions.
That's right. I think it's a very convenient whipping boy.
Yeah.
And I think you're probably quite correct. But no one disagrees with a minister who uses big tobacco in their sentence. If they say big tobacco, every mom and dad goes, everybody says, well, they're terrible. Remember them. God.
But they would say the same about the mafia or a biker gang, but they won't use those words. They're going to use big tobacco because they're a legal thing that they can regulate. What's scary about a regulated industry?
I don't think in the UK it's a fear of big tobacco. I mean, I think it's just a fear of youth vaping. They've massively overemphasized the problem. And now they've created almost their own minds, this hysteria, which they're now acting on in the wrong way. I mean, the good thing compared with Australia especially is we're still going to have vaping products in the UK. So we're still much better off than many countries in the world. It's just the offering will be a bit degraded. We'll have a very big tax on the liquids, which will catapult us from the least in Europe to the highest in Europe, I think it's right to say. And that doesn't really help things because they're talking about having this generational age ban on cigarette sales, but at the same time they're massively raising the cost of the alternatives. So it's not very much joined up thinking. They're not thinking it all through. And I said they did a consultation, and many public health organisations were saying, please don't get rid of flavours, please don't tax these products too highly, and they've done that already. But it looks like they're going to have. We're in an election at the moment, so but all three parties have got the same manifestos on this. They all want to bring back the bill and go through with it. So they're going to probably bring in plain packaging. They're going to restrict flavours. All the things public health have said, please don't do. But they're not talking to public health. They're talking. They're just talking based on the pressure they're under from the public.
You know, and I think it's interesting when I think of the Commonwealth countries. So when we first started seeing the bans on nicotine products in Australia, we were pointing to Canada, we were pointing to the UK, we were pointing to New Zealand, going, look at what our brothers and sisters are doing in the Commonwealth. And instead, they were pointing to China, Indonesia, India. Okay, India is part of the Commonwealth, where there were these bans, and it's like, since when do we want to be China? Like, you know, wouldn't we? You know, I mean, we always want to beat New Zealand in everything, and you know, now we're losing against them miserably.
Well, you are winning. You got higher smoking rates.
Yeah, well, that's actually, when you put it that way, Maria, maybe that's our end.
So you're getting more tobacco tax.
We are winning, and we're getting more. I mean, we still get $2.4 billion in tax.
Yeah.
Yeah, Fiona, you mentioned in a previous interview with me that you felt that tobacco control, in and of itself, has become possessed with their own self-worth.
That's right. And it certainly is that, and I think Australia in particular, you know, we won the war on plain packaging. You know, we got plain packaging. You know, we got some of the most restrictive point of sale legislation through that has now, you know, has now been copied in a number of jurisdictions. So there is this misplaced pride. There is this hubris amongst our tobacco control people in Australia, and certainly the government that is in today, the Labor government, they initiated some of those measures. Right. So they feel like they've, you know, that this is just continuing the good work that they did. I mean, when you look at the party that is supposed to be for the working man, this is one of the worst things that they can be doing for workers.
So tobacco control is venerated in Canada, the UK, and Australia.
That's right. Is that what we have in common? Is that what we have in common?
Well, ours just one-upped you. We have cigarette warnings on every cigarette now.
It's true, actually.
We've won up, like, because we've got a competitive guy there. His name's Rob Cunningham with the Cancer Society, who also praises New Zealand on being under 5, yet he ignores the fact of how that happened. But we now can, when you're smoking a cigarette, you'll know that it will cause impotence.
There's also in Canada that's often not discussed. And Martin, we talked about it during our COP10 coverage. What's that group again? The global GFTC.
Is
that what it is?
GATC, yeah.
And Health Canada pays them.
Yes, and they're Canadians. It's global. Yeah. They're the ones that were in the room with all the delegates twisting arms.
Yeah, it's a Global Alliance for Tobacco Control, which used to be called the Framework Convention Alliance. And they're NGOs that are aligned with the thoughts of the WHO and the Framework Convention Secretariat on harm reduction. So they're in there sort of chivying the delegates along to agree with the WHO. Right. And if you don't, they'll give you a nasty award and sort of wag their finger at the.
So they've got to be acting domestically.
Yes, because it's Rob Cunningham. He is the guy who hands out the awards and does the thing. Sorry, Rob Cunningham's my nemesis.
Yeah.
I don't know if I'm his, but
we've got. So I mean, our Cancer Council in Australia. One of the biggest donors is Woolworths and Coles. They donate millions of dollars to them every year. Of course, Woolworths and Coles sell the most tobacco products in Australia. They sell more than every other tobacco outlet combined, and the Cancer Council accepts their donations willingly and happily. And when I've challenged them on it, they just say, don't be ridiculous, Fiona. Of course Woolworths is fine. And we don't get it from the tobacco money, we're getting it from the milk money. You know?
Yes, because it's all
like
separate.
they're hypothecating it. No, they're not.
Maybe that's another thing to look for the commonality, is the fact that these organizations, the cancer, the heart, the lung, they're venerated. And nobody really knows what the heck they do. Like if you asked 10 people on the street, what do they do? And they'll say, oh, they do research, and oh, they're fighting cancer. Well, no, they're a charity mill.
Cancer rates are skyrocketing in all our countries. So if they're trying to stop cancer, they're doing a very bad job.
Well, they use fear, they use misinformation, and when you lie about one thing, you're not going to be trusted by the other things. And you're looking at, our Cancer Society, Heart and Stroke. They're misrepresenting the data. They're cherry picking, and the very people who they're trying to stop, again, the youth, they're a lot smarter. They can actually go and fact check you a lot quicker than a 65-year-old who smokes.
Yeah.
And that's where the problem lies, is their techniques to get kids not to vape have failed because their techniques are working on the people who are still smoking.
And I think this goes to that sort of the media, that you're seeing in the United Kingdom. I mean, I think we're seeing a level of censorship around this issue of tobacco harm reduction. We actually tried to get a fellow from New Zealand, Ben Udan, to come, and he came to Australia. We put him in front of politicians. We contacted the press club and said this will be a great talk on tobacco harm reduction. It's a really, it's a really interesting issue. People are engaged with it, and they went, no, we're not having tobacco harm reduction at the press club. You try and put articles in, you try and give information to journos, they will not touch you. They will run all of the extreme and scaremongering stories, but it's so difficult to get tobacco harm reduction.
We had something similar in the UK, because Rishi Sunak suggested he was going to bring in this tobacco and vapes bill, which included the ever-rising age for sales of cigarettes. And they when it got to committee stage, they chose a committee, all of which had voted for this. And there was a load of MPs who voted against it. Every single MP on the committee was in favour of the legislation. And when they called in the witnesses, all of them were in favour of the legislation. They excluded any trade associations. They excluded consumers. It was like a mini COP meeting, But unfortunately, we have an election. All the manifestos are saying they're going to bring that back. We just hope this time they'll go through the proper process, because I think they were trying to rush it through before any sort of election happened. So fingers crossed.
And in the lead up to an election, no one's going to do anything, are they?
No.
No one wants to piss off anyone. I mean, we're trying to say that in Australia, that, you've got 1.7 million voters who are vapers. But given that they're so stigmatised, there's no regulated market, it is so difficult to engage them and organise them in a way that we've probably found easier with even cannabis consumers.
Oh my goodness,
we
cannabis.
need to get the United States to groups there, or at least external money there to to fund and run on commercial television public service ads that talk about the benefits of vaping, because we can't do that in Canada. We can't do that in the UK. We can't do that in Australia.
It was I went to go get an ad on World No Tobacco Day that said, World No Tobacco Day, simple font, congratulations on the way you quit. That's it. Nothing about vaping or whatever, from Rights for Vapors. And because it was from Rights for Vapors, they considered it a promotion of vaping. And they would not allow me to buy an ad for the Globe and Mail.
So you can't purchase ad space, and you can't get earned media, which is the term,
That's right.
that you use to get, So what do you do?
And it's remarkable, because I speak to journos who I know vape. So I'm speaking to journos that I know are on my side, and they cannot get it past their editors. So certainly, you can bypass it, you can try and use social media, and certainly, people like yourself, Brent, helping getting that message across. But when you don't even have a regulated outlet, so we were, in the consumer group, we were talking about how can we get the manufacturers and the retailers to get further engaged in this program. In Australia, we don't have legal retailers, so we can't engage those. But in the UK and Canada, it's probably really important that we start engaging.
But you're technically not allowed to really promote vaping inside of vape store.
You cannot, you cannot promote vaping inside a vape store, so you can't do any relative risk statements unless you have the full study there that you offer them. And wait a second, this is the part that I love. Guys, I might be off with my numbers, but it's just as dramatic. So if you tell someone that vaping is safer than smoking to sell them that product and you don't hand over the science, that is a $50,000 fine I'll say plus 18 months in a federal penitentiary. Now, say you sold that product based on telling that to someone under the age of 18. So we're going to add on something else. That's only a mere $3,000. So we have a youth epidemic in our country. However, you sell to a kid, it's $3,000. Yeah, tell that same kid that it's safer than smoking without giving them the study. Whoa, you're in prison for 18 months. At a federal one, this is where mastermind criminals and murderers go. Like, can you imagine in the slop line? What are you here for? Well, I murdered this. Oh, this is where I was going to swear, but I'm not going to. So, I murdered my ex-husband because he was this and that. And how about you? Oh, well, I told someone vaping was safer than smoking. Think about the optics.
Yeah. Well, we have states in Australia where the possession of all drugs has been decriminalised. So if you're found with heroin or methamphetamine, it could be a civil penalty, but it's education. You're found with nicotine, 2 years jail.
So I think we've got just about 4 minutes left, maybe a little less, but around that. So let me toss this out then as gasoline into the fire.
Okay.
So if we're looking at, because I believe there's a progressive issue that's going on. Yeah. So if that is indeed the case, you don't believe much in the individual. The society, the social organism is a priori to the individual. Individuals are not born bad. They're all born good. So if one of your little Johnny or little Jane has gone bad, it's not because of little Johnny or little Jane, it's because something's wrong with the society and the social organism. Very convenient to lay that on big tobacco.
Yeah.
And almost in a way, big tobacco as the foil is actually part of the balancing act of progressivism. They to believe in what they believe, you must have big tobacco. And you must still be able to fight it. And so vaping breaks that down.
Yeah. It's sort of like whoever mentions Hitler loses the argument. It's kind of, it's a similar thing, except, you mentioned big tobacco and you sort of feel like you've won the argument. But it's the same thing. They go to that, they take it to that extreme. I mean, in Australia, we've got legislation before our parliament at the moment, and it's uncertain whether it will pass. The government doesn't have the balance of power in the Senate. They need the support of either the progressives or the conservatives, and it seems at both of those ends there's a lot of hesitancy. So from the progressive end, it's they're conflicted because it is big tobacco, but they're conflicted that they think that all drugs should be decriminalised and drugs should be treated as a health issue, so why wouldn't you extend that to nicotine? And then at the other end, at the Nationals and the farmers, they take donations from big tobacco, so they're sort of like...
I think it's more simple than that, really, with big tobacco. I think, these tobacco controllers, they earn money just like anyone else, and I think they need harm. And I think vaping threatens them, because vaping is coming along and it could break up all of the big tobacco that they've been fighting against for years. And they don't like that, because they think, well, what are we going to do if everyone just goes and starts buying things to quit smoking themselves? So I think it's as simple as that. They need the enemy. They need the horned devils of the tobacco industry. So I think they'd be sad to see them go.
I know they would be. They wouldn't know what to do with themselves. I think they're just, honestly, it's down to tobacco control. I think the people in tobacco control at one point in their lives, and there's so many here at GFN, that were in tobacco control and had their aha moment, because maybe it's confidence, maybe it's something else, but the people that are left over are not the best of the best anymore. They're the leftovers.
Yeah.
And especially in Canada.
So you're saying then that there's a red pill moment? Or
You're getting too deep for me.
Yeah, well, take the red or take the blue, right? So the ones that are left are the ones that chose the blue.
I think, I've always said, I think there are two ways of looking at people who are in public health. You have the ones in public health who really care about people, and you're the ones who are in it, only in it for the money. And I think what we're seeing in public health is a split between the ones who recognise the potential of this, and even if it does cost them money or lose them grants or whatever, they really want to stop people smoking. And you have the others who are thinking, if these things go ahead, I'm going to be out of a job. So you've got a split along those lines, I think, in public health.
Well, it's great. Well, thank you very much
Thank you.
for elucidating on that whole thing, or maybe hallucinating.
Yeah.
And thank you, everybody, for tuning in. And I don't even know what's next. So
Cliff Douglas is getting some kind
Cliff
of award.
Douglas and the
is
Mike
providing
Russell
the
Oration.
Mike Russell Oration, yes.
Sounds great. Well, thank you very much for joining us.
Try not to put it. Okay, thank you. My name's David McIntosh. I'm one of the directors at Knowledge Action Change, and it's a great privilege to be introducing this year's Michael Russell Oration, which is one of the highlights of GFN, as those of you who've been here before, but there are many highlights at GFN, but it's undoubted when you look at the excellent speakers we've had over the years delivering the oration, that it's a particular highlight of the event, and this year is certain to be no exception. Before I go any further, I'd like just to remind ourselves a little bit about Michael Russell. A psychiatrist and research scientist, he worked at the Institute of Psychiatry in London between 1969 and 1989. And his work had a huge impact. He fundamentally changed the understanding of the pharmacological and the psychological nature of smoking. He was very clear that nicotine in itself was not driving the vast amount of disease and mortality. Rather, it was how people consumed it, essentially via the cigarette. As such, he recognised early on the potential for safer nicotine products. Now, sadly, Mike Russell died before technology and innovation produced the range and type of products which has now made effective tobacco harm reduction possible. But there is no doubt at all that he helped provide the foundation upon which so many of us are working. Now, building on this work and seeking to deliver on the ambitions of ending smoking-related deaths, I'm delighted to be introducing Cliff Douglas, President and CEO of Global Action to End Smoking, who will be delivering this year's oration. Cliff has an incredibly impressive track record going back 36 years in tackling tobacco use. He has led key legal efforts in the US and elsewhere which have limited tobacco use. Appointed President and CEO of the then Foundation for a Smoke-Free World back in October, he has wasted no time in demonstrating his determination and enthusiasm to drive forward on reducing smoking. His energy and positivity are hugely valued in a field which can often feel irreconcilably divided, despite having an agreed end goal. So, without me going on any further, please let me hand you over to Cliff and let's give him a warm welcome.
That was a very gracious introduction. Thank you so much. And before that, I just had a hug from Roberto Sussman, so I'm good for the day. I appreciated that so much. Thank you. Last year's oration. Well, good evening, and thank you, David. I also want to express my sincere thanks to the organizers of this excellent meeting and all of you who are here in person and also virtually for allowing me to spend a few precious minutes sharing some personal thoughts before the exciting award presentation and what I understand is the world-famous GFN party. So I'm truly humbled by the invitation to speak with you today, especially in the name of Dr. Mike Russell, whose vision and innovative approach to reducing the toll of the smoking epidemic were so critical to the decades of progress that followed, as you've just heard. So exactly 1 month ago today, my organization that was known as the Foundation for a Smoke-Free World relaunched as Global Action to End Smoking. And this is the name that we decided best represents the top-line goal of our charitable mission, which is to end combustible tobacco use, which is, as most people here will know, responsible for somewhere in the neighborhood of 98 to 99% of all so-called tobacco-related deaths. Changing our name also reflects our new identity, which emphasizes the fact that we are 100%, let me say that again, 100%, and again, 100% independent. We are beholden to no one. And I ask, because I can't help but ask, how many public health groups can honestly make that claim? So last October, when I joined the organization, we terminated the prior agreement with PMI. And having made a final payment, the company walked away, eliminating any connection. And this separation was essential to my decision to take on this special role. I then worked with our strictly independent board of directors to adopt a formal new policy to not accept any further funding from manufacturers or of tobacco or even non-medicinal nicotine products. So that means, independent vaping companies. And while I might have some mixed feelings about that, we wanted to make, and I wanted to make, eminently clear where we stand on independence. So when I took on this new role, some colleagues, not to mention some journalists and others, asked me why. Why, after 35 years, and now in my 60s, too young to run for president of the United States, but still, a veteran, would I take such a controversial step? Why not just go play golf? Well, for one thing, I told them, I don't play golf. The last time I tried was 48 years ago. I'm rusty. But more importantly, I said, taking the helm of this organization to help accelerate the end of the world's leading epidemic was simply a logical next step in my journey to educate people and save more lives. As part of this talk, I was asked to say a bit about my career. I hope you won't mind. Older people have to reminisce. Every step I've taken since that first day in February of 1988, when I became the new assistant director of what was called the Coalition on Smoking or Health, it was a predecessor of what later became the Campaign for Tobacco-Free Kids, has been dedicated to defeating this epidemic, including many years in the trenches, in which I worked with others to hold tobacco manufacturers accountable for a devastating history of fraud, conspiracy, and misrepresentations to the public and government health officials. As a lawyer, I represented individuals and classes of people sickened by smoking, as well as families of some who had already died, in cases against the cigarette manufacturers. We fought one case all the way to the US Supreme Court. It went up to the court 3 different times before we won on appeal almost 10 years to the day after we had received a verdict at trial. As a policy advocate with the American Cancer Society and the American Heart Association and the American Lung Association, I champion the regulation of tobacco products in the US and eliminating smoking in restaurants and other public places, including coordinating the national campaign to remove smoking from commercial airline flights. I was also the first to highlight how cigarette manufacturers engineered their products to deliberately cause dependency in millions of unsuspecting consumers, including children. And for those efforts, which led to a major news expose, I was targeted along with ABC News in a $10 billion, with a B, dollar defamation lawsuit by Philip Morris. I was subjected to a subpoena that was thrown at me in the presence of my mother. I was cross-examined under oath for 16 hours and had my phone tapped. So that's a little background. Moving to the present, it's tragic that despite valiant efforts all around the world, this toll from smoking is not only not receding, it continues to grow. And so for our part, we are developing new approaches to strengthen our life-saving work in collaboration with many others who are similarly committed, including people in organizations who are here today. It's been great seeing some of you in person, whom for years I've only had the opportunity to know virtually. As Global Action, we're maintaining our focus on funding cutting-edge health and science research, but we've also embarked on a new area of focus under the umbrella of what we broadly refer to as cessation education. Unlike some other programs that employ similar names, however, this involves addressing the widespread misinformation and disinformation regarding nicotine and relative risk that continues to confuse and mislead millions of people who smoke, their healthcare providers, and of course, decision makers. We are going to be promoting research and related educational efforts to accurately inform people about the continuum of risk among different tobacco and nicotine products, and to objectively and compassionately inform people about the wide array of options available to support them on their personal quitting journeys. We're going to continue to support and promote robust, cutting-edge scholarship. But let me also emphasize this. We are stepping down from the ivory tower to meet people where they are, based on their actual personal lived experience, needs, and preferences. One size does not fit all, as you know, but too many others don't. We owe it to people to listen, to understand their challenges, to understand how they can reduce their health risks if they can't or don't otherwise choose to stop smoking. And we must recognize and build upon the reality that well over 100 million people, I've heard closer to 120 million people across the globe, have already made the decision to use vaping as well as other non-combusted nicotine products in their dedicated personal efforts to avoid painful and early deaths from smoking. Now, these varied alternatives may or may not, in some cases, be the very best possible remedies, especially where they aren't effectively regulated for quality control, safety, and health effects. I mean, in the United States, about 99% of our entire marketplace is either illicit, in the black or gray market. That's kind of a challenge. But people deserve to know what they're putting in their bodies and what the effect will be. And we also know that those products are more appealing, popular, and effective for many people who are in urgent need of practical options to save their lives. And we also know that in many cases, as reported by the Cochrane reviews and others, e-cigarettes, for their part, are often more effective than nicotine replacement medications in helping people stop using combustible tobacco products. In the course of my nearly 4 decades fighting this epidemic, it became clear to me that one of our biggest challenges has been identifying knowledge gaps in the field so we can take corrective action. One of the most common misconceptions is that we have, quote, solved this epidemic, which results in part from the fact that those with more years of education and higher incomes, who are not incidentally also those who have more power and influence, don't see much smoking around them. Developed nations have generally done a pretty good job of reducing smoking prevalence since the 1960s. But this success has not applied equally in many low and middle income countries and across different population groups. Many of the people who smoke today come from disadvantaged communities. While I was leading the annual Great American Smokeout for the American Cancer Society while serving as its vice president for tobacco control, we came to call this the hidden epidemic, as it disproportionately affects people with less education, with mental health and substance use disorders, from certain racial and ethnic groups in the LGBTQ+ communities, and in the military, and that's especially among those in the lowest pay grades. People who smoke are not a monolith, and their off-ramps will vary considerably. In the US, smoking rates are highest among indigenous communities, though only 11%, I'll say only 11% of the US population smokes today. The figure is in the high 20s, about 27% for American Indians and Alaska Natives. In China, about a quarter of the population smokes, but among farmers, that figure is about 30%. And in Pakistan, smoking rates are less than 10%, but within that figure, nearly 30% of men smoke, compared to just over 6% of women. And by the way, you can find these data and much more information for dozens of countries on our increasingly consumer-friendly new website, which is globalactiontoendsmoking.org. The fact is that with over 1 billion users of combustible tobacco products today, many, many people have been left behind in the fight for health equity. The status quo is not acceptable. But to address their needs, we must first understand what's really going on and meet them where they are through targeted new research, product innovation and dissemination, and much more effective communications. At this point, however, as we've been discussing at this conference, and as I touched on earlier, misinformation and disinformation about nicotine is a global problem. It's itself been referred to as an infodemic that's interfering with progress to end smoking. Last year, a survey of nearly 15,000 doctors across 11 countries, conducted by Sermo with our support, found that about 2/3 of physicians, and in some countries far more, even in excess of 90%, mistakenly believe that nicotine causes the death and disease associated with smoking. But of course, this is flat wrong. It isn't true. The science is clear. Nicotine causes the dependency that drives the repeated exposure to the 7,300 chemicals and roughly 70 known human carcinogens, those chemicals that cause cancer, produced by the burning of a cigarette. But when separated from the dirty needle of the cigarette, as Mitch Seller himself called it a few years ago, nicotine is approved as, quote, safe and effective for use as a smoking cessation medication. It doesn't take a rocket scientist to know that nicotine itself cannot be both lethal and safe and effective. The spread of the false belief that nicotine is what kills, rather than the toxic soup of cigarette smoke, is harming our public health efforts and everything that everyone in this room is seeking to accomplish. Too many healthcare providers and the consumers they serve believe that their only options for quitting are either going cold turkey or using a medicinal nicotine replacement product such as nicotine gum or the patch, or maybe they'll try hypnosis. But we know, probably everyone in this room knows, that there are many individuals who either can't or won't quit smoking using those options. And I would submit that it is a moral imperative that they not be forced to choose between those limited and too often ineffective options or nothing at all. With so many lives on the line, we must step up our game. And just as Knowledge Action Change and others among you have done, Global Action has crafted resources and information for consumers who want to learn how they can most effectively quit smoking, and when helpful, as it is for many, to move down the continuum of risk to minimize the likelihood that they'll become ill and die before their time. One thing I know for sure: requiring people who smoke, in effect, to simply quit or die is inhumane and it's unacceptable. So we'll be consistent in encouraging consumers to take the healthiest step possible for them and respectfully meeting them where they are. If for those who want or need nicotine and won't otherwise stop smoking, we'll deliver unbiased facts about the evidence-based options available to them that can help save their lives. This sounds simple, doesn't it? But unfortunately, it isn't, because of what some have aptly referred to, as I noted earlier, as the infodemic that currently plagues the global discussion. And no matter how much poor and false information is spread, including by some global health authorities and their benefactors who know, or damn well should know better, we will be relentless in simply telling the truth. Telling the truth. People deserve the truth. People need the truth. People rely on the truth. And people must be told the truth. So let me now just say a word about the subject reflected in the title of my talk, Bridging the Divide. When I embarked on this more recent phase of my journey, following a critical learning stage while I was leading tobacco control at the American Cancer Society, I issued a personal statement of March of 2021 that I titled, "It is time to act with integrity and end the internecine warfare over e-cigarettes." In it, I appealed, quote, to my friends on both sides of the internecine divide over tobacco harm reduction. My use of the word internecine led to some humorous discussion about what the hell that meant. But it basically refers to destructive conflict within a group. Now, there may be some different opinions about whether we are all actually part of a single group. But for me, as a tobacco control specialist, who was always very much involved in pursuing, or also very much involved in pursuing, the promise of innovative alternatives that would help accelerate the end of smoking, this was all, for me, part of a whole. I invite you to read the not very long original statement online if you're interested, but this is how I began it. And I decided to go back and see what it was I said 3 years ago. We are now neck deep in intractable internecine warfare between the mainstream tobacco control community, whose primary focus is on protecting youth from the dangers of vaping, and the tobacco harm reduction community, some of whose scientists are also committed participants in mainstream tobacco control efforts. The THR community emphasizes the potential benefits of vaping for adult smokers who cannot or will not quit smoking otherwise. It seems that ne'er the twain shall meet. I urge all of us in the tobacco control community to climb out of the bunker, come to the table, and try to genuinely work together. Stop skirting the truth when it feels inconvenient, and open your minds and ears to all of the science that is before us. But the same goes for my other community, with whom I agree regarding the evidence-based promise of THR, but which also bears some responsibility for the adversarial nature of the relationship and for not always acknowledging areas of ambiguity or concern, including significant rates of experimentation with vaping by youth, Mind you, this has in the United States, for example, changed quite a bit for the better in the last 3 years. And youth-oriented marketing by some segments of industry, generally the illicit industry. We won't come together if we don't come together. Well, a lot has happened since I wrote that, some of it very challenging. But my faith in the cause of bridging this divide hasn't wavered because we can't afford it to do so. I firmly believe that driven by a lot of hard work, collaboration wherever we can find it, and reaching out honestly with an open hand, we will bridge differences and find more common ground. So to conclude, I want to emphasize that how we choose to approach ending the epidemic of death and diseases caused by smoking is reflective of how we really feel about the people who smoke. If we continue to offer them only the same solutions that have failed them time and again in the past, I think that we imply, whether we intend it or not, that we do not think them worthy of compassion or the potential benefits of innovation. As scientists, public health advocates, social justice warriors, and simply as people who care about our neighbors, we must accept when the evidence shows that past solutions are not working well enough. The status quo, again, is not acceptable. And finally, let me just say, those who say it cannot be done should get out of the way of those who are doing it. Thank you again for your privilege, the privilege of your time, and for linking arms in this noble cause.
Thank you, Cliff, for that tremendous oration. Triumphs over adversity, some of the challenges laid out, a very important reminder of just what we can achieve, and a very practical point about trying to reach out where we can to partners and finding people to help us advance. I'm pleased you're sitting there, Gerry, because I was just about to say, I would now like to invite Gerry to come up here with what I hope are the important props that he needs for the important prize giving.
Practicing the Joe Biden's.
I was actually worried for a minute. We have been rehearsing somersaults all week, but it hasn't always gone well. Gerry.
Thank you. Thank you, Cliff, and thank you, Dave. And so we come to the second highlight of this evening, which is the presentation of the Michael Russell Award. The award acknowledges the insights that Mike Russell had in the 1970s about the individual and the public health gains that would come about by separating nicotine from its dirty delivery system, the cigarette. I had the privilege of working in the same research centre as Mike, and I think he had a great understanding of the needs of nicotine. Well, he was a nicotine user himself. Didn't smoke cigarettes by then, but he liked the occasional, certainly liked the occasional cheroot. So I think he had a great compassion for what the issues are. The award is named after Mike with the kind permission of his family. The full potential of that vision, of his vision, is now realizable with the plethora of safer nicotine products. The switch to safer products is being driven by good products and, of course, by consumers, people who want to avoid smoking but who wish to continue using nicotine. Governments can speed up that process, they can stand in the way, but I think the indicators are there about the right direction of travel. But it's an unrealized potential because of the antipathy towards tobacco harm reduction. That's why it's so important that the award recognizes people who have made a special contribution to advancing tobacco harm reduction. The choice of the recipient is always difficult because there are so many people who deserve recognition. So I won't keep you in suspense. This is the Oscar moment, the awards moment. And let's just see. There's a rather old 10 zloty note in here. So it looks like we doubled the prize from last year. That's for later. So it's my pleasure to tell you that the 2024 Michael Russell Award goes to Colin Mendelsohn. Colin came to tobacco harm reduction after a long career in general practice and with a special interest in helping people to cease smoking. He educated general practitioners about helping smokers and helped develop national smoking cessation guidelines. One of the top national experts in the field of smoking cessation in Australia. Impeccable credentials. He became aware of vaping through his patients in 2014. In 2015, he visited smoking cessation experts in London. I met him in October 2015, and that didn't put him off his trajectory. And he came to GFN in 2016, and since then has never looked back. So his message, as the title of his book says, is Stop Smoking and Start Vaping. But in Australia, there's an almost universal hostile opposition to vaping from government departments, from health charities, and from medical and public health organisations. Impeccable credentials and no protection from hostile opposition, personal attacks, attempts at censorship, rejection by medical journals, complaints to professional bodies, and misrepresentation. Despite this, he's never given up or silently slipped away. Last year, he announced his retirement, but thank goodness that didn't last long. Once a tobacco harm reductionist, it never leaves you. So he is here today, and he continues his good work. The second part of the title of his book is The Healthy Truth About Vaping. He spreads the truth about vaping in a multitude of articles, in meetings with parliamentarians, a newsletter for MPs, submissions to inquiries, in media briefings, through webinars, and much more. He is really a one-person advocacy organisation. Australia will eventually give up its bizarre attempts to regulate vapes out of existence, and Colin will have helped make that happen. So Colin, the world is a better place because of you, and it's my great pleasure to present you with the 2024 Michael Russell Award. And I'll move my things out of the way because I think you've got. I'll leave you the 10 zloty note there. And I think you've got a few words to say.
Just a few.
I'll leave you with this nice thing as well.
Oh, good, thank you. I was hoping for a gold logie, actually, but I guess that's not coming. Look, thank you very much, Gerry, for those kind words and this great honour. I first met Gerry, as he said, in October 2015. I developed an interest in tobacco harm reduction. Gerry visited me when he came to Australia, and I must admit I've become much more involved since then. But over the next 9 or 10 years, well, it's been brutal in Australia. Advocacy in Australia has been very challenging. As Gerry said, there have been personal attacks, smears, harassment. I'm constantly accused of receiving tobacco company money, lots of dirty tricks, and that's been quite persistent over that time. So thank you very much, Gerry, for that, for your contribution to my being in that position. And I have a feeling that the reason I'm getting this award is partly because Gerry feels guilty about his role in what's been happening. But there have been light moments, and I have some slides. I'm not quite sure how to control them. Here we go. Okay, do I control them, or does somebody? No, somebody else does? Okay. So the first thing is, I get called lots of interesting names. The first one is, I'm Alex Wodak's Tweedledum to his Tweedledee. Apparently I'm the one on the left and he's the one on the right. The second one I quite liked is, I'm the Energizer Bunny of vaping promotion. If we can just show that one. This is a little rabbit that goes around beating a drum and never stops. I'm not quite sure how to bring him on. Do we have a clicker? Oh, he's up there? He's up there, okay. So that became my avatar for a while in social media. But my current favourite... Oh, is there a clicker? Yes. Oh, up here. Oh, okay, thanks. My current appointment is as the Commander-in-Chief of Vaping Theology in Australia. These names have been offered to me by the leading vaping hater in Australia, who's well known, I'm sure, to everyone. Look, I have tried to retire several times. As Gerry said, not once. But vaping advocacy is a very addictive behaviour, as I've discovered. And Ron Borland, who's probably Australia's leading smoking expert researcher, has called me Australia's Nellie Melba of tobacco harm reduction. And for those of you who don't know Nellie Melba, she's a famous opera singer from the 1920s in Australia, who was well known for her endless farewell appearances in concerts back in the 1920s after allegedly retiring. She just kept coming back, and I guess that's what's happening here. You're rather stuck with me. Australia's prescription model has been a resounding failure, and it's really a lesson in unintended consequences. So the way it works is, if you want to vape, you get a prescription. Well, this guy's not getting a prescription, and the doctor's not going to give him one. And over 90% of Australia's 1.7 million vapers go to the black market. And the black market's controlled by organised crime, outlaw motorcycle groups, who import millions and millions of disposable vapes, and they're totally unregulated and they're sold freely. They compete like with other drug wars, in a turf war to control market share. And that involves, as we've heard today, fire bombings, extortion, homicides, intimidation, just like in all other drug wars. And we've created this. The illicit tobacco market, the vape market, is Australia's second biggest illicit drug market, which we've created. And of course, these products are freely sold to young people, and we have the highest rate of youth vaping, one of the highest rates in the world as a result. It's not made it harder for kids to get illicit vape products, it's made it easier. And of course, there's the inevitable moral panic and the inevitable cry for more restrictions, which is what created the problem in the first place. It's clearly not working. But what bothers me is what Cliff was talking about earlier, which is the rampant misinformation about vaping and about nicotine. In Australia, policymakers endlessly quote two government-commissioned reports. This first one by our National Health and Medical Research Council, our peak health body. The second one by the Australian National University, both government-commissioned. Well, we did peer-reviewed critiques of both these reports. We found them to be full of scientific errors, misinformation, bias, and not fit for purpose. Both of our critiques, which are peer-reviewed with impeccable authors, were totally ignored in Australia. No media coverage, no government response except go away, we know what we're doing. So what's driving policy in Australia? It's driven by everything but the evidence. It's driven by ideology, people should just quit. It's driven by moral outrage about kids using nicotine. It's politically risky. There's the hatred of big tobacco. We don't trust them. Anything they're associated with has to be a problem. Too many organisations benefit from the sale of tobacco and the income from that. That's the financial considerations, financial tax. They're all together working in lockstep. And there's a fear of innovation and competing values. Different things are important to different people. That's what's driving innovation, driving resistance to, not the science, that's what's driving the problems we're facing. And finally, this misinformation is spread by otherwise respected organisations whom we should be trusting, and you all know who they are. These are some of the ones that certainly involved in our area, but there are many others. And these messages are amplified by the media. And, you know, some of these headlines are all very familiar. There's the inevitable erectile dysfunction and the lung transplant due to nicotine vaping. I mean, it just goes on, and that's unbelievable. And our health minister says exactly the same things. The media is mostly, not always, but mostly negative, critical, sometimes wildly inaccurate, often imbalanced. The articles don't have, there's no opportunity for someone to speak to this misinformation, which is why I wrote my book. So the book was basically about getting the real evidence out there. It didn't seem to be available through any other format. Our health minister, in a radio interview a couple of days, said this: "I'm determined to drive the vaping industry out of the country. Rather than being an opportunity, vaping is a scourge on public health, apparently, in Australia." That's what we're up against. But I changed the slides just before I came up because I had a big win last night. So a year ago, I was shown on a national current affairs program as a representative of big tobacco. It was very clear that I was a representative of big tobacco. A hit job, the usual sort of thing. I complained to the television channel, and they said, "Go away." Of course, we didn't mean that. The regulator disagreed with them, and last night they published an apology on their website. So we occasionally have wins. That's one that was particularly satisfying. It won't make a lot of difference. Makes me feel better. Of course, it'll get no media in Australia. We don't publish good news about vaping, but we're very quick to publish any potential negative news. I wanted to thank two very special people before I finish. Clive Bates, and I don't know if Clive's here, but I have to thank Clive for his leadership and his guidance, which has been absolutely inspiring. And of course, my very good friend Alex Wodak for his support and wisdom. Thank you, Alex and Clive. And without them, I'm sure I would have given up long ago. Thank you very much.
He's giving it back. Okay, thanks very much, Colin. It's now closing of the sessions for today. The conference party is in the Sphinx restaurant, which is in the same block as the hotel, and I think it's there. Okay, you follow the map, take a photograph of the map now, and I think it starts at 7:30-ish or a bit earlier. Okay, you'll find out if the door's open or not. So see you all at 7:30. So see you all at 7:30 in the Sphinx. So thank you very much.